1. Cardiac arrhythmias, often resulting from disruptions in the heart's electrical conduction system, can lead to symptoms such as palpitations, dizziness, and syncope, while potentially increasing the risk for more serious conditions like stroke and heart failure. Hence, understanding the complexities of atrial and ventricular arrhythmias is crucial for effective clinical management. 2. Diagnosing cardiac arrhythmias often involves the use of electrocardiograms, ECGs, as a primary tool, where healthcare providers analyze the electrical activity of the heart through P, QRS, and T waves, which can reveal patterns indicative of atrial fibrillation, tachycardia, or other arrhythmic conditions. 3. Although antiarrhythmic drugs like amiodarone, beta blockers, and calcium channel blockers are integral to the medical management of various cardiac arrhythmias, they come with their own set of pharmacokinetic challenges and side effects, necessitating careful patient monitoring and individualized treatment plans. 4. Atrial fibrillation, one of the most common types of arrhythmias, is characterized by rapid and irregular beating of the atria and is often associated with an increased risk of thromboembolic events, which calls for anticoagulation strategies in addition to rhythm or rate control therapies. 5. The pathophysiology of ventricular arrhythmias can involve abnormalities in ion channel functioning within myocardial cells, leading to conditions such as ventricular tachycardia or fibrillation, which are particularly serious due to their potential to precipitate sudden cardiac arrest. 6. Holter monitoring, which involves continuous ECG recording typically over 24 to 48 hours, is a valuable diagnostic method for identifying transient arrhythmic episodes that may not be captured during a standard ECG test in a clinical setting. 7. In certain cases of refractory arrhythmias or when medical management is insufficient, catheter ablation procedures might be considered. These involve the targeted destruction of arrhythmic foci within the heart tissue via radiofrequency or cryoablation techniques, aiming to restore normal cardiac rhythm. 8. Breach of cellular homeostasis and calcium ion handling in cardiomyocytes can contribute to arrhythmic phenomena, highlighting the importance of calcium channel function in maintaining proper myocardial contraction and electrical stability, often factored into pharmacotherapeutic interventions. 9. Genetic predispositions, sometimes linked to inherited channelopathies such as long QT syndrome or Brugada syndrome, can underpin the development of arrhythmias, indicating the need for genetic counseling and screening in at-risk populations to guide preventive and therapeutic strategies. 10. Cardiac arrhythmias in the context of ischemic heart disease can arise from scarring and fibrosis post-myocardial infarction, which disrupts electrical conduction pathways, thereby necessitating not only direct arrhythmia management but also comprehensive cardiovascular care to mitigate underlying ischemic burden. 11. Lifestyle factors such as excessive caffeine or alcohol consumption, smoking, and stress can exacerbate or trigger arrhythmic episodes, suggesting that a holistic approach to arrhythmia management must include patient education and lifestyle modifications alongside medical interventions. The occurrence of arrhythmias during pregnancy presents unique clinical challenges due to physiologic changes and the need to consider fetal health, often requiring collaborative multidisciplinary care to address rhythm disturbances while minimizing risks to mother and child. 13. For individuals experiencing symptomatic bradyarrhythmias, potentially due to sinus node dysfunction or atrioventricular block, implantation of a pacemaker can provide effective rhythm management, thereby alleviating symptoms and reducing the risk of complications associated with low heart rates. 14. 14. Unlike mere heart rate increase or decrease, arrhythmias involve the intricate disturbance of the heart's electrical impulses, necessitating attentive risk factor stratification in patient-specific treatment protocols, considering the vast array of underlying etiological mechanisms in each case. 15. A comprehensive history and physical examination remain pivotal in the initial assessment of patients presenting with suspected arrhythmias, for symptoms such as palpitations, fatigue, or dyspnea can stem from a vast differential diagnosis, thereby helping clinicians to triage and guide further investigations efficiently. 16. The role of the autonomic nervous system in modulating cardiac rhythms is significant, where imbalances in sympathetic and parasympathetic tone can precipitate arrhythmic events. Clinical interventions sometimes involve modulation of autonomic inputs to stabilize cardiac function. 17. Antiarrhythmic drug therapy carries potential proarrhythmic risk, necessitating diligent monitoring for QT interval prolongation or other adverse effects, especially in drugs that alter ion channels, underscoring the complexity of striking a balance between therapeutic benefits and possible toxicities. 18. Emerging non-invasive technologies like wearable ECG monitors provide continuous cardiac rhythm surveillance, empowering patients with real-time insights and facilitating early detection of arrhythmic phenomena outside of traditional clinical environments, fostering proactive management. 19. Pathological hypertrophy and dilation of cardiac chambers, often seen in conditions such as left ventricular hypertrophy or cardiomyopathies, can induce arrhythmic electrical conduction, highlighting the intersection between structural myocardial changes and electrophysiological disturbance. 20. Psychoemotional factors, including anxiety and depression, have been noted to influence the presentation and perceived burden of arrhythmias, thereby requiring a biopsychosocial model of care that integrates mental health support in managing patients with cardiac arrhythmias. The electrophysiological study, EPS, serves as a cornerstone diagnostic tool for elucidating the mechanisms of arrhythmias, whereby intracardiac electrode catheters help in mapping the heart's electrical activity and understanding specific arrhythmic circuits for targeted therapeutic decisions. 22. The electrophysiology of the cardiac conduction system involves synchronized depolarization and repolarization events, with the sinoatrial and atrioventricular nodes playing critical roles. Disruptions here can result in inefficient cardiac cycles and highlight areas of potential electrophysiological intervention. 23. Structural heart conditions such as valvular diseases may predispose patients to arrhythmias due to resultant atrial enlargement and pressure overload, demonstrating the interconnected nature of mechanical and electrical heart dynamics in arrhythmogenesis. 24. Synchronization of ventricular contraction and improved hemodynamics are the goals of cardiac resynchronization therapy, CRT, used in select cases of heart failure with arrhythmias where biventricular pacing can dissolve dysynchrony and ameliorate symptoms. 25. Pediatric arrhythmias demand careful consideration, as they may manifest differently than in adults, with common etiologies including congenital heart defects or genetic syndromes, necessitating age-appropriate diagnostic and therapeutic approaches tailored to the developmental context. 26. The intricate anatomy of the cardiac conduction system, involving specialized pathways through the atrioventricular node and Purkinje fibers, underpins its vulnerability to disturbances, where even minor alterations in anatomy or physiology can have significant arrhythmic consequences. 27. The multifactorial etiology of arrhythmias often includes electrolyte imbalances such as hypokalemia or hypercalcemia, underscoring the importance of maintaining adequate electrolyte homeostasis in both prevention and treatment regimens for cardiac rhythm disturbances. '28. Lifestyle interventions, such as the incorporation of regular graded exercise, have shown beneficial effects in reducing the incidence of certain arrhythmias, promoting autonomic balance and cardiac fitness, when duly tailored to individual patient capabilities and risk profiles. '29. The risk stratification for sudden cardiac death in individuals with potentially malignant arrhythmias involves assessing factors such as ejection fraction, presence of syncope, and familial history, guiding decisions on the appropriateness of implantable cardioverter defibrillators as prophylactic measures. '30. Cardiac imaging techniques, including echocardiography and cardiac MRI, illuminate structural and functional status, providing essential information to correlate anatomical findings with arrhythmic potential, vital for comprehensive arrhythmia care planning. '31. The pathogenesis of arrhythmias can sometimes be attributed to inflammatory processes, as observed in conditions like myocarditis or cardiac sarcoidosis, where inflammation-induced scarring can alter conductive pathways, necessitating both anti-inflammatory and rhythm management strategies. '32. Clinical innovations, such as the development of bioengineered cardiac tissue grafts, hold promise for repairing arrhythmic substrates by restoring normal myocardial architecture and electrical continuity, offering a glimpse into future regenerative therapies for arrhythmia management. '33. Polymorphic ventricular tachycardia, often associated with electrolyte disturbances or ischemic insult, typifies the diversity within arrhythmias, necessitating nuanced understanding and management approaches, including correction of precipitating conditions and pharmacological stabilization. '34. The potential for asymptomatic arrhythmias to progress undetected adds an element of unpredictability to their management, emphasizing the value of regular cardiac evaluations, especially in high-risk populations, to mitigate possible adverse outcomes through proactive surveillance. '35. The utilization of implantable loop recorders extends diagnostic capabilities over extended periods, capturing sporadic arrhythmic events that might otherwise go undiagnosed, enhancing the diagnostic yield in patients presenting with unexplained syncope or palpitations. '36. Paroxysmal supraventricular tachycardia, PSVT, arises from reentrant circuits within the atria or atrioventricular node, often requiring acute interventions such as vagal maneuvers or adenosine administration, alongside long-term consideration of pharmacological or ablative strategies for persistent cases. '37. The advent of telemedicine and virtual arrhythmia clinics has augmented patient access to specialized cardiac care, allowing remote consultations and monitoring that adapt to patient needs, optimizing management and follow-up in the evolving landscape of digital healthcare. '38. Wolff-Parkinson-White syndrome, a pre-excitation disorder characterized by the presence of an accessory pathway, manifests in tachyarrhythmias due to abnormal electrical conduction, underscoring the importance of accurate ECG interpretation and patient-specific intervention planning. '39. Not all arrhythmias convey the same clinical significance, with distinctions existing between benign ectopic beats and life-threatening tachyarrhythmias, thus imposing the need for differential diagnosis in the context of patient symptoms and overall cardiovascular risk. '40. Environmental factors, such as exposure to certain toxins or medications that prolong the QT interval, can precipitate arrhythmic events, necessitating awareness and mitigation strategies in both clinical and occupational contexts to prevent potential cardiac complications. '41. Cardiac arrhythmias present gender-specific prevalence and risk factors, as hormonal influences and genetic predispositions may differ, warranting consideration of gender in both the research and clinical management paradigms of arrhythmic disorders. (42) Technology-driven advancements in algorithms for arrhythmia detection leverage artificial intelligence to enhance the precision of diagnostic tools, transforming the landscape of non-invasive arrhythmia screening with the potential to improve early detection and intervention outcomes. (43) The therapeutic landscape for arrhythmias continues to evolve with approaches such as gene therapy, targeting underlying molecular defects in inherited arrhythmogenic disorders, offering a frontier in personalized medicine that reaches beyond symptom control to address disease at its genetic root. (44) Emotionally induced arrhythmias exemplify the direct link between mind and heart, where stress can precipitate acute arrhythmic events, highlighting the importance of integrating stress management techniques into comprehensive care plans for patients with cardiac susceptibility. (45) Despite their potential diversity, arrhythmias share a common thread in their potential to affect cardiac output, emphasizing the interconnectedness of electrical dysrhythmia and hemodynamic compromise, necessitating a holistic grasp of cardiovascular physiology in clinical practice. (46) The management of arrhythmias in patients with comorbid conditions, such as diabetes or chronic kidney disease, often involves additional layers of complexity due to interaction with existing therapies and potential alteration of drug metabolism, underscoring the importance of multidisciplinary care teams. (47) Recent studies suggest that the gut microbiome may influence cardiac rhythm through mechanisms involving metabolic byproducts, opening intriguing possibilities for novel approaches to managing arrhythmic disorders via dietary modulation and microbiome-targeted therapies. (48) In some instances, a pacemaker or implantable cardioverter defibrillator interaction with electromagnetic fields necessitates vigilance regarding potential interference, leading to patient education on avoiding certain environments to ensure device functionality remains uncompromised. (49) Considering arrhythmias from a global health perspective unveils disparities in access to arrhythmia care, prompting efforts towards enhancing healthcare infrastructure and education in resource-limited settings to bridge gaps and improve patient outcomes. (50) The use of risk prediction models in arrhythmia care, incorporating variables such as age, comorbidities, and lifestyle factors, facilitates a more tailored risk assessment approach, enhancing predictive accuracy and informing preventive strategies in clinical decision-making processes. (1) Esophageal cancer is a malignancy arising from the esophagus characterized by two main histological types: squamous cell carcinoma, which typically affects the upper portion of the esophagus and is strongly associated with smoking and alcohol consumption, and adenocarcinoma, which often develops in the lower part of the esophagus and is linked to chronic gastroesophageal reflux disease in Barrett's esophagus. (2) The pathophysiology of esophageal cancer involves the uncontrolled proliferation of cells lining the esophagus, often initiated by chronic irritation or inflammation caused by factors such as tobacco, alcohol, and gastroesophageal reflux, which over time can lead to genetic mutations and the development of neoplasms. (3) Early-stage esophageal cancer is often asymptomatic or presents with subtle symptoms like difficulty swallowing, dysphagia, which is frequently noticed with solid foods and can progressively worsen to include liquids as the tumor grows, causing obstruction within the esophageal lumen. 4. Diagnosis of esophageal cancer commonly involves upper endoscopy with biopsy for histological examination, offering direct visualization of the mucosal abnormalities, combined with imaging techniques such as CT and PET scans to assess tumor staging and metastatic spread. 5. The most significant risk factor for esophageal adenocarcinoma is chronic gastroesophageal reflux disease, GERD, which can cause Barrett's esophagus, a precancerous condition marked by the metaplastic transformation of normal squamous epithelium to columnar-lined epithelium over time. Six. Squamous cell carcinoma of the esophagus is more prevalent in certain geographic regions such as East Asia and Eastern Africa, with dietary influences, consumption of very hot beverages, and nutritional deficiencies playing contributory roles in its etiology. 7. Treatment for esophageal cancer varies based on the stage and location of the tumor but generally involves a combination of surgery, radiation, and chemotherapy, with esophagectomy being the mainstay curative approach for localized tumors, while systemic chemotherapy is pivotal for metastatic disease. 8. Barrett's esophagus represents a premalignant condition in which the squamous epithelium of the distal esophagus is replaced by intestinal columnar epithelium, increasing the risk of developing esophageal adenocarcinoma due to chronic acid exposure and inflammation. Nine. Endoscopic ultrasound, EUS, serves as a critical tool in the staging of esophageal cancer, allowing for detailed assessment of tumor penetration into the esophageal wall and surrounding lymph nodes, which is crucial for planning effective treatment strategies. Ten. The prognosis of esophageal cancer varies significantly by stage at diagnosis, with localized disease offering the best chance of cure, whereas advanced or metastatic disease is associated with a poor prognosis and a 5-year survival rate of less than 20%. 11. Symptomatic treatments for esophageal cancer may include esophageal dilation or stenting to alleviate obstructive symptoms, thereby improving swallowing and nutritional intake, especially in cases where the tumor is unresectable or the patient is unfit for surgery. 12. Molecular markers and genetic profiling are gaining attention in the prognosis and targeted therapy of esophageal cancer, with HER2 overexpression and PD-L1 expression being examples of biomarkers that can influence treatment plans, including the use of targeted therapies like trastuzumab or immune checkpoint inhibitors. 13. Smoking cessation is crucial in reducing the risk of esophageal squamous cell carcinoma, as tobacco smoke contains numerous carcinogens that contribute to the development of various intraepithelial lesions and malignant transformations in the esophagus. 14. The role of the p53 tumor suppressor gene is pivotal in esophageal carcinogenesis, with mutations in this gene frequently encountered in both adenocarcinomas and squamous cell carcinomas, leading to impaired cell cycle regulation and increased susceptibility to neoplastic transformation. 15. Nutritional support is a key component of managing esophageal cancer, especially when advanced disease or treatment side effects compromise oral intake, necessitating interventions such as enteral feeding or supplementation to maintain adequate nutrition and weight. 16. Esophageal leiomyoma is the most common benign esophageal tumor, often asymptomatic and discovered incidentally on imaging, and differs from malignant lesions by its smooth muscle origin and low potential for malignant transformation. Surgical removal is warranted only if symptomatic. 17. PET cord scanning is invaluable for detecting metabolic activity and assessing distant metastasis in esophageal cancer, giving comprehensive information on disease spread that cannot be obtained through conventional imaging alone, thereby influencing decisions on the need for neoadjuvant therapy. 18. Alcohol use is a major risk factor for esophageal squamous cell carcinoma, with a dose-dependent relationship indicating that higher alcohol intake significantly elevates the risk of developing this type of cancer, emphasizing the importance of moderation or avoidance in at-risk populations. 19. Chemoradiotherapy can serve as a neoadjuvant treatment for esophageal cancer, intending to shrink the tumor preoperatively, improve the surgical outcome, and address microscopic metastatic disease, particularly in patients with locally advanced but still resectable tumors. 20. The development of minimally invasive esophagectomy (MIE) techniques has revolutionized the surgical management of esophageal cancer, offering reduced postoperative morbidity, faster recovery times, and comparable oncological outcomes to traditional open surgical approaches. 21. The expression of matrix metalloproteinases (MMPs) in esophageal cancer correlates with aggressive tumor behavior and metastatic potential, as these enzymes degrade extracellular matrix components, facilitating tumor invasion and spread, making them potential targets for therapeutic intervention. 22. Regular monitoring through endoscopic surveillance is critical for patients with Barrett's esophagus to detect dysplastic changes early, allowing for timely intervention strategies aimed at preventing progression to esophageal adenocarcinoma, including endoscopic resection or ablation techniques. 23. Dysphagia, or difficulty swallowing, is often one of the earliest and most common presenting symptoms of esophageal cancer, primarily resulting from tumor-induced luminal narrowing, progressing from solids to liquids as the disease advances, warranting prompt diagnostic evaluation. 24. The incidence of esophageal adenocarcinoma has been rising in Western countries, likely related to increased prevalence of obesity and gastroesophageal reflux disease, highlighting the role of lifestyle modification and surveillance in at-risk populations to curb this trend. 25. Adenocarcinoma of the esophagus frequently exhibits overexpression or amplification of the HER2/Neu oncogene, which has made the trastuzumab-based therapeutic regimen a viable option for improving outcomes in HER2-positive esophageal cancer, similar to its use in breast cancer. 26. Genetic syndromes such as tylosis, characterized by palmoplantar keratoderma, are associated with esophageal cancer, particularly squamous cell carcinoma, underscoring the importance of genetic counseling and early surveillance in affected families due to their markedly increased risk. 27. The role of E-cadherin, a cell adhesion molecule, is significant in esophageal cancer, with loss of its expression being linked to epithelial to mesenchymal transition, increased invasiveness, and metastatic potential, suggesting its potential utility as a prognostic marker. 28. Achalasia, a primary esophageal motility disorder, increases the risk of esophageal squamous cell carcinoma due to long-standing stasis and inflammation, making periodic endoscopic surveillance vital in patients with this condition to detect early neoplastic changes. 29. Proton pump inhibitors (PPIs) are commonly prescribed to manage gastroesophageal reflux disease and can play a role in preventing progression to Barrett's esophagus and esophageal adenocarcinoma by significantly reducing acid exposure and subsequent esophageal inflammation. 30. The overexpression of VEGF, a potent angiogenic factor, in esophageal cancer correlates with poor prognosis due to its role in promoting tumor angiogenesis and growth, making it a potential target for anti-angiogenic therapies such as bevacizumab in the treatment of advanced disease. 31. Photodynamic therapy, PDT, is an endoscopic treatment option for early-stage esophageal cancer or dysplasia in Barrett's esophagus, utilizing photosensitizing agents activated by light to destroy cancerous cells with minimal damage to surrounding healthy tissue. Multidisciplinary management of esophageal cancer, incorporating input from gastroenterologists, oncologists, surgeons, radiologists, and nutritionists, is essential to delivering comprehensive care tailored to individual patient needs and maximizing therapeutic outcomes. Epstein-Barr virus, EBV, has been implicated in certain cases of esophageal squamous cell carcinoma, with studies suggesting a possible etiological role, though the exact mechanisms of oncogenesis remain unclear and warrant further investigation to establish causation. The assessment of esophageal tumor margins post-resection is critical to ensure complete excision and prevent local recurrence, often involving frozen section analysis intraoperatively to guide the surgical approach and achieve clear margins for optimal oncological outcomes. Targeted therapies, such as monoclonal antibodies and small molecule inhibitors, are increasingly explored in esophageal cancer treatment, with ongoing research focusing on biomarkers like EGFR, MET, and PD-1/PD-L1 pathways to enhance response rates and survival benefits. Monitoring treatment response in esophageal cancer often involves serial imaging studies, including CT or PET scans, combined with clinical evaluation of symptom resolution, providing key insights into therapeutic effectiveness and facilitating timely adjustments in management plans. Obesity is a known risk factor for esophageal adenocarcinoma, primarily through its association with gastroesophageal reflux and subsequent Barrett's esophagus, emphasizing the importance of weight management and lifestyle modifications in lowering cancer incidence in overweight populations. Human papillomavirus, HPV, has been investigated for its potential role in esophageal squamous cell carcinoma, with some studies identifying HPV DNA in tumor tissue, yet its significance remains controversial, and additional research is needed to clarify its impact on esophageal carcinogenesis. The use of serological markers, such as squamous cell carcinoma antigen, SCC-AG, provides supplementary information in monitoring and prognosticating esophageal squamous cell carcinoma, although their utility is limited by specificity and the need for further validation. Brachytherapy, a form of internal radiation therapy, can be employed as a palliative treatment in esophageal cancer, particularly in advanced or recurrent disease, to provide symptomatic relief from dysphagia and improve the quality of life, especially when external beam radiation is not feasible. Robotic-assisted esophagectomy offers a modern surgical approach with advantages including enhanced precision, reduced blood loss, and shorter hospital stays compared to traditional methods, though it requires specialized training and equipment, contributing to its limited availability. Chronic esophagitis, resulting from prolonged gastroesophageal reflux, can cause progressive cellular alterations, ultimately leading to Barrett's esophagus and increasing the risk for esophageal adenocarcinoma, hence the importance of early and effective management of reflux symptoms. The gut microbiome's role in esophageal cancer is an emerging field of study, with research suggesting that dysbiosis or alterations in the microbial balance may influence carcinogenesis, although the precise mechanisms and implications for prevention and therapy remain to be fully elucidated. Neoangiogenesis, the formation of new blood vessels, is crucial for esophageal tumor growth and progression, often driven by factors like VEGF, making anti-angiogenic agents an appealing therapeutic option to limit nutrient supply and impair tumor expansion in advanced cancer stages. Inflammatory mediator overproduction, such as prostaglandins, in chronic reflux esophagitis can exacerbate tissue damage and increase cancer risk, supporting the use of anti-inflammatory drugs, like COX-2 inhibitors, in potentially reducing the progression to esophageal cancer. Salvage surgery is sometimes employed in esophageal cancer for recurrent disease following chemoradiation, offering the possibility of disease control or cure when initial non-surgical treatments fail, though it is associated with higher morbidity and requires careful patient selection. Nanotechnology applications in esophageal cancer encompass drug delivery systems aimed at enhancing therapeutic efficacy and reducing systemic toxicity, utilizing nanoparticles to target cancer cells more precisely, representing a burgeoning area of research with promising potential. Esophageal cancer screening is not widely implemented due to the lack of a sufficiently sensitive and cost-effective method for the general population, although high-risk groups, such as those with Barrett's esophagus, may benefit from regular endoscopic surveillance to identify early malignancies. Dysregulation of cyclooxygenase 2, COX2, expression in esophageal cancer is associated with increased proliferation and resistance to apoptosis, providing a rationale for using COX2 inhibitors as a potential therapeutic strategy to enhance treatment response and inhibit tumor progression. Cryotherapy is an emerging endoscopic treatment for early esophageal cancer or precancerous lesions, utilizing extreme cold to ablate dysplastic tissue with minimal invasiveness and complications, offering an alternative to more invasive surgical options in select patients. Uterine cancer, primarily endometrial carcinoma, arises in the lining of the uterus and is primarily influenced by hormonal imbalances, particularly excess estrogen without the counteracting presence of progesterone, which can lead to the overstimulation of endometrial tissue and the eventual development of malignant cells. The most common symptom of uterine cancer is abnormal uterine bleeding, especially in postmenopausal women, where any vaginal bleeding should be considered potentially indicative of malignancy and warrants prompt medical evaluation to assess for possible endometrial hyperplasia or carcinoma. Type 1 endometrial cancer, often associated with high estrogen levels, includes endometrioid adenocarcinoma that tends to have a better prognosis than type 2 cancers, which are estrogen independent and often include aggressive variants such as serous carcinoma and clear cell carcinoma. A transvaginal ultrasound is frequently utilized as an initial diagnostic tool in uterine cancer to assess endometrial thickness. A measurement greater than 4 to 5 mm in postmenopausal women typically prompts further investigation through an endometrial biopsy for histopathological evaluation. Risk factors for uterine cancer include obesity, which can elevate estrogen levels due to increased peripheral conversion of androgens to estrogens in adipose tissue. Other factors include nulliparity, early menarche, late menopause, and a personal or family history of Lynch syndrome. Treatment of uterine cancer often begins with surgical intervention, typically a total hysterectomy with bilateral salpingo-oophorectomy, which involves the removal of the uterus, cervix, fallopian tubes, and ovaries, often accompanied by sentinel lymph node mapping to evaluate for metastatic spread. The staging of uterine cancer is crucial for guiding treatment and is primarily based on the extent of tumor invasion into the uterine wall, cervical stromal involvement, spread to pelvic and para-aortic nodes, and the presence of distant metastasis, typically assessed through imaging and surgical staging. 8. Adjuvant therapy in uterine cancer, which may include radiation, chemotherapy, or hormonal therapy, depends on the stage and specific histological features of the tumor, with advanced or high-risk cases often requiring more aggressive multimodal treatment strategies to manage recurrence risk. 9. Hormone therapy, using agents like progestins, can be an option in select cases of uterine cancer, particularly for younger patients with early-stage low-grade tumors who wish to preserve fertility, as long as they are closely monitored for disease progression. 10. Lynch syndrome, a hereditary cancer syndrome caused by mutations in DNA mismatch repair genes, significantly increases the risk of developing uterine and colon cancers, necessitating heightened surveillance and consideration of prophylactic options in affected individuals. 11. Advanced uterine cancer may present with symptoms beyond abnormal bleeding, such as pelvic pain, a palpable mass, unexplained weight loss, ascites, or symptoms related to metastasis, underscoring the importance of a thorough clinical evaluation in symptomatic women. 12. Immunotherapy, specifically using agents that target the PD-1/PD-L1 pathway, has emerged as a promising treatment for certain cases of advanced or recurrent uterine cancer, particularly for tumors with high microsatellite instability or mismatch repair deficiency. 13. Histopathological examination of the endometrial tissue is essential for diagnosing uterine cancer, with findings distinguishing between well-differentiated endometrioid adenocarcinomas, which typically have glandular patterns, and poorly differentiated or high-grade tumors, which may show solid sheets of atypical cells. 14. The role of obesity in the pathophysiology of uterine cancer is significant, as excess adipose tissue not only increases estrogen availability but also contributes to a state of chronic inflammation and insulin resistance, which can independently promote carcinogenesis. 15. Prognosis in uterine cancer is most favorable when detected early, with localized disease, stage 1, having a 5-year survival rate exceeding 95%, while advanced cases with distant metastasis, stage 4, reduce the 5-year survival rate to around 15 to 17%. 16. The role of genetic counseling is particularly important for individuals with a strong family history of uterine cancer or associated hereditary syndromes, offering insights into risk assessment, potential genetic testing, and possible preventive measures such as risk-reducing surgery. 17. Histological subtypes of uterine cancer, including serous, mucinous, and clear cell carcinoma, often demonstrate distinct clinical behaviors with varied prognostic outcomes, necessitating tailored approaches in treatment planning based on subtype-specific risks and characteristics. 18. Once a diagnosis of uterine cancer is made, imaging studies such as MRI or CT may be employed to further assess local and regional spread, determine surgical resectability, and aid in the comprehensive staging process critical for optimal therapeutic planning. 19. Research into the molecular pathogenesis of uterine cancer has identified key genetic mutations and pathways involved in tumor growth and progression, including mutations in the PTEN, PIK3CA, and KRAS genes, offering insights into potential future targeted therapies. 20. Uterine sarcomas, constituting a rare subset of uterine cancers, include subtypes like leiomyosarcoma and endometrial stromal sarcoma, characterized by their highly aggressive nature and often poor prognostic outcomes, necessitating specialized management strategies distinct from epithelial endometrial cancers. 21. Endometrial hyperplasia, particularly when atypical, is considered a precursor lesion to uterine cancer, with risk stratification and management depending on the presence or absence of cytological atypia, guiding decisions regarding surveillance or intervention like hormonal therapy or surgical excision. 22. Fertility-sparing management of uterine cancer, applicable in young women with early-stage low-grade disease, typically involves high-dose progestin therapy, careful selection based on favorable prognostic factors, and rigorous follow-up, including regular endometrial sampling to monitor response. 23. The role of radiation therapy in uterine cancer involves both external beam radiotherapy and brachytherapy, which can be used post-surgically to reduce the risk of local recurrence or, less commonly, as a primary treatment modality in medically inoperable patients. 24. Scientific studies suggest that the ingestion of tamoxifen, a selective estrogen receptor modulator often used in breast cancer treatment, may slightly elevate the risk for developing uterine cancer due to its partial agonistic effects on the endometrium, underscoring the need for diligent monitoring. 25. Molecular testing for mismatch repair proteins and microsatellite instability, especially pertinent for assessing Lynch syndrome-associated uterine cancers, also helps inform treatment options, particularly regarding the efficacy of immunotherapeutic approaches in identified defective cases. 26. Researchers exploring the link between lifestyle factors and uterine cancer risk advocate addressing modifiable behaviors, such as diet and exercise, to potentially decrease risk through weight management and reducing exposure to endogenous and exogenous estrogens. 27. The identification of aggressive histologic variants like dedifferentiated or indifferentiated carcinoma of the uterus warrants an understanding that these tumors often exhibit rapid growth, resistance to standard therapies, and unfavorable outcomes, challenging clinicians to pursue innovative treatment avenues. 28. Preoperative assessment of uterine cancer typically involves a comprehensive health evaluation to identify comorbid conditions that could affect surgical outcomes, appropriateness of anesthesia, and the potential need for neoadjuvant treatment. 29. In recent developments, the exploration of biomarkers such as serum CA-125 levels could offer supplementary insights into the prognosis and recurrence threat in uterine cancer, although their routine use remains debated due to variable sensitivity and specificity. 30. Herbal and natural supplements are often scrutinized for their potential hormonal effects, with healthcare providers advised to query patients on such usage, which might influence the hormonal milieu and risk of uterine cancer through phytoestrogenic effects or drug interactions. 31. The interdisciplinary team approach in uterine cancer care, involving gynecologic oncologists, radiologists, pathologists, and supportive care specialists, ensures a comprehensive plan that addresses the multifaceted needs of the patient, from diagnosis through survivorship. 32. Uterine cancer surveillance post-treatment commonly includes regular pelvic examinations and possibly imaging, balancing the need for vigilant recurrence detection with the consideration of minimizing unnecessary interventions that may lead to anxiety or procedure-related morbidities. 3. Advances in laparoscopic and robotic-assisted surgery have revolutionized the management of uterine cancer, offering minimally invasive options that potentially reduce hospital stays, lower complication rates, and promote quicker recoveries while maintaining oncological safety. 34. Extended staging procedures in uterine cancer may include omentectomy or peritoneal washings to evaluate cancer dissemination, particularly in cases with serous histology, where there is a higher predilection for peritoneal and omental involvement similar to ovarian cancer. 35. Non-hormonal therapies, such as lifestyle interventions targeting insulin sensitivity and anti-inflammatory pathways, are being increasingly recognized for their possible roles in complementing traditional treatments, providing holistic care that addresses metabolic and endocrine factors in uterine cancer management. '36. Clinical trials continue to explore novel drugs and combination regimens that target specific molecular aberrations found in uterine cancers, offering hope for improved therapeutic options and potentially altering the standard of care practice in resistant or high-risk disease. 37. The significance of microsatellite instability testing lies not only in its ability to identify a subset of uterine cancers that may respond favorably to certain immunotherapies but also in its role as a universal screening tool for hereditary cancer syndromes like Lynch syndrome. 38. Intraoperative frozen section analysis during hysterectomy for suspected uterine cancer provides immediate insights into the tumor grade and invasion depth, facilitating real-time surgical decision-making concerning the extent of lymphadenectomy or additional procedures. 39. The supportive care of patients with uterine cancer emphasizes the importance of addressing psychosocial aspects, as coping with a cancer diagnosis often entails navigating emotional, fertility, and sexual health concerns, ensuring comprehensive care extends beyond purely medical interventions. 40. While often overshadowed by conventional treatments, participatory decision-making between patients and clinicians in uterine cancer care involves discussing the potential benefits, risks, and side effects of various interventions, along with considering personal values and quality of life impacts. 41. Most uterine cancers are sporadic in nature. However, approximately 3 to 5% are attributed to hereditary syndromes, denoting that genetic testing and consideration of family cancer history are integral parts of personalized care and tailored prevention strategies. 42. Hormonal changes associated with diabetes mellitus and polycystic ovarian syndrome, both contributing to hyperinsulinemia and increased ovarian androgen production, further underscore the complex interplay of endocrine factors in uterine cancer risk elevation. 43. Personalized oncology approaches are gradually reshaping treatment paradigms by incorporating genetic and genomic profiling in uterine cancer to predict therapeutic responses and tailor interventions based on the unique tumor biology of individual patients. 44. Newer radiation techniques such as intensity-modulated radiation therapy, IMRT, offer enhanced precision in targeting cancerous tissues while sparing healthy surrounding structures, potentially reducing the adverse effects traditionally associated with radiotherapy in uterine cancer treatment. 45. The importance of ongoing research into uterine cancer pathophysiology is manifest in the exploration of stem cell origin theories, which propose that cancer stem cells may play a pivotal role in tumorigenicity, resistance, and metastasis, driving ongoing innovative treatment investigations. 46. Routine pelvic exams may not efficiently detect uterine cancer early, especially when disease is confined to the endometrium. Thus, heightened awareness and timely investigation of symptoms like abnormal bleeding remain critical for early diagnosis and improved outcomes. 47. Given the hormonal influences on uterine cancer, hormone replacement therapy, HRT, must be carefully considered in postmenopausal women, with non-estrogen therapies often preferred or, if estrogen is necessary, used with progestins to mitigate endometrial cancer risk. 48. Smoking, though primarily linked to cervical cancer, has been associated with a decreased risk of uterine cancer due to antiestrogenic effects induced by certain carcinogens, though cessation remains paramount for overall health and cancer prevention. 49. Some uterine cancers exhibit overexpression of specific proteins such as HER2, NOI, analogous to certain breast cancers, leading to potential therapeutic implications including the use of targeted therapies. Though not yet standard practice, ongoing research aims to clarify their efficacy. 50. The role of viral infections such as human papillomavirus, HPV, is minimal in uterine cancer pathogenesis compared to cervical cancer. However, emerging data continue to explore the broader implications of viral and microbial influences on gynecologic cancers. One. Prostate cancer is the most commonly diagnosed cancer among men worldwide, affecting significant numbers annually and emphasizing the importance of routine screening and early detection methods like PSA blood tests and digital rectal examinations to identify the disease at stages where it is most treatable and potentially curable. Two. Age is a primary risk factor for prostate cancer, with the majority of cases occurring in men over the age of 65. And it is rarely seen in men under 40, indicating the necessity for heightened awareness and regular monitoring as men age. 3. Family history plays a significant role in prostate cancer risk, with men having a first-degree relative with the disease being more than twice as likely to develop it themselves, highlighting the genetic components that must be considered in risk assessments and screenings. 4. The symptoms of prostate cancer can be subtle and may include difficulty urinating, loss of bladder control, and bone pain, which often appear once the cancer has spread beyond the prostate, thus underlining the importance of early diagnostic procedures. 5. The Gleason score is a grading system used to evaluate the prognosis of prostate cancer by examining the patterns of cancer cells in the prostate, with scores ranging from 2 to 10, where higher scores indicate more aggressive and poorly differentiated tumors. 6. Prostate cancer can exist in various forms, from indolent types that grow very slowly and may not require immediate treatment to aggressive cancers that quickly spread to bones and other organs, necessitating prompt and comprehensive therapeutic approaches. 7. Aside from family history, ethnicity is a known risk factor for prostate cancer, with African American men having a higher likelihood of developing the disease compared to Caucasian and Asian men, necessitating tailored strategies for prevention and early intervention. 8. The development of prostate cancer is associated with hormonal factors, particularly the role of androgens like testosterone, which can fuel the growth of cancer cells, making hormonal therapy a pivotal treatment for advanced stages of the disease. 9. A biopsy is the definitive method for diagnosing prostate cancer, involving the extraction and microscopic examination of prostate tissue samples, which determines the presence, extent, and grade of cancer, guiding subsequent management decisions and treatment planning. 10. Radical prostatectomy, the surgical removal of the entire prostate gland along with some surrounding tissue, is a standard treatment option for localized prostate cancer and can lead to a high probability of curing the disease when performed at an early stage. 11. Radiation therapy, using high-energy beams to target and kill cancer cells, serves as a primary or adjunctive treatment option for prostate cancer, showing particular efficacy in localized cancer in situations where surgery might not be feasible. 12. Active surveillance is a management strategy for low-risk prostate cancer cases where the disease is closely monitored through regular testing and biopsies, deferring immediate treatment unless there are signs of progression or significant changes. 13. Androgen deprivation therapy, ADT, is a cornerstone treatment for advanced prostate cancer, involving medications or surgical procedures that lower testosterone levels, slowing cancer growth and reducing symptoms, albeit with potential side effects like hot flashes and reduced libido. 14. PSA, or prostate-specific antigen, is a protein produced by prostate cells and measured through blood tests, serving as a marker for prostate health with elevated levels potentially indicating cancer or other prostate disorders, thus aiding in screening and monitoring. 15. The role of chemotherapy in prostate cancer is typically reserved for advanced stages where the cancer no longer responds to hormone therapy alone, utilizing drugs that kill rapidly dividing cells, thereby managing symptoms and potentially extending survival. 16. Immunotherapy for prostate cancer, which harnesses the body's immune system to attack cancer cells, is an evolving field with treatments like Sipuleucel T providing a novel approach for certain patients with metastatic castration-resistant prostate cancer. 17. Bone metastases are common in advanced prostate cancer, leading to complications like fractures and pain, and require targeted therapies such as bisphosphonates or radiation to reduce skeletal-related events and improve quality of life. 18. Obesity is a modifiable risk factor that may influence the development and progression of prostate cancer, with evidence suggesting that excess weight is linked to an increased risk of aggressive disease and poorer outcomes, highlighting the importance of maintaining a healthy lifestyle. 19. The association between diet and prostate cancer risk is still under investigation, with studies exploring the potential protective effects of diets rich in fruits, vegetables, and fish, and the possibly increased risks posed by high consumption of red and processed meats. 20. Genetic testing for BRCA1, BRCA2, and other similar mutations is advised for men with a strong family history of prostate cancer, as some mutations can elevate risk and influence personalized screening and treatment strategies for individuals at genetic risk. 21. Prostate cancer's microenvironment is complex, with stromal cells, immune infiltrates, and signaling molecules interplaying with cancer cells, influencing tumor initiation, growth, and resistance to therapies, underscoring the need for comprehensive treatment strategies. 22. MRI-guided biopsy is an advanced diagnostic technique that improves the accuracy of prostate cancer detection by using magnetic resonance imaging to target suspicious areas within the prostate, potentially leading to more precise and earlier identification of significant cancers. 23. Chronic inflammation and prostatitis have been investigated as potential factors in prostate cancer development, with some studies suggesting that inflammatory processes could contribute to carcinogenesis, though more research is needed to establish definitive causal links. 24. Advances in precision medicine are shaping the future of prostate cancer treatment, where specific genetic and molecular profiles of a patient's tumor can guide individualized therapy choices, improving effectiveness and minimizing unnecessary side effects. 25. Prostate cancer staging is crucial for determining the appropriate treatment approach, with stages ranging from I to IV, indicating the tumor's extent and spread from localized to distant metastasis, which directly influence prognosis and therapeutic decisions. 26. Cryotherapy is an alternative treatment option for localized prostate cancer where extreme cold is used to freeze and kill cancerous tissue, offering a less invasive method compared to surgery, though primarily utilized for patients with recurrent disease after radiation. 27. The role of vitamin D in prostate cancer prevention and treatment is a topic of ongoing research, as its potential anti-cancer properties and influence on prostate cell growth suggest that adequate levels may offer some protective benefits, though evidence remains inconclusive. 28. Robotic-assisted laparoscopic prostatectomy is a minimally invasive surgical technique used to remove the prostate with precision and typically results in quicker recovery times, less blood loss, and reduced likelihood of long-term complications compared to open surgery. 29. External beam radiation therapy, EBRT, for prostate cancer involves directing beams of radiation from outside the body to the prostate, effectively treating localized cancers with sophisticated techniques like intensity-modulated radiation therapy, IMRT, that maximize tumor targeting while sparing healthy tissue. 30. Brachytherapy is a form of internal radiation treatment for prostate cancer where radioactive seeds are implanted directly into the prostate tissue, providing targeted therapy with minimal exposure to surrounding organs, making it a suitable option for some localized cancers. 31. The concept of the prostate cancer gray zone describes cases with intermediate risk features where treatment decisions are particularly challenging, as they require careful consideration of potential benefits versus adverse effects, emphasizing the importance of individualized patient counseling. 32. Hormone-refractory prostate cancer occurs when the disease progresses despite androgen deprivation therapy, necessitating alternative treatment modalities such as second-line hormonal therapies, chemotherapy, or participation in clinical trials evaluating novel agents. 3.3. Neuroendocrine differentiation in prostate cancer is an aggressive variant that demonstrates unique histological features and may arise de novo or following hormonal therapy, necessitating distinct management approaches as it often shows resistance to conventional treatments. 34. The ongoing debate about the benefits and harms of PSA screening highlights the importance of shared decision-making between patients and healthcare providers, considering individual risk factors and preferences when deciding the appropriate age and frequency for testing. 35. Focal therapy for prostate cancer is an innovative approach that treats only the cancerous part of the prostate, utilizing techniques like HIFU, high-intensity focused ultrasound, to minimize side effects while effectively controlling the disease, although long-term outcomes are still under evaluation. 36. Combination therapies, involving the concurrent use of multiple treatments such as ADT and radiation, have been shown to improve survival outcomes in patients with high-risk prostate cancer, emphasizing the importance of a multidisciplinary approach in managing complex cases. 37. Sarcomatoid differentiation in prostate cancer is a rare but aggressive form characterized by a mixture of epithelial and mesenchymal features, associated with poor prognosis and challenging treatment courses, often necessitating a combination of surgery, chemotherapy, and radiation. 38. Sentinel lymph node biopsy is an emerging technique in prostate cancer that identifies the first lymph nodes to which cancer cells are likely to spread, providing valuable staging information that can guide the extent of surgical intervention and additional therapies. 39. The impact of prostate cancer on sexual health and function is significant, with treatments like surgery and radiation potentially affecting erectile function, hence the importance of discussing potential side effects and considering options like nerve-sparing techniques or penile rehabilitation. 40. Timely management of urinary symptoms associated with prostate cancer can improve quality of life, whether through surgical intervention, medications, or lifestyle modifications aimed at addressing obstructive urinary issues or irritative symptoms linked to treatment. 41. A multidisciplinary prostate cancer clinic involves specialists from urology, oncology, radiology, and other fields collaborating to create a comprehensive care plan tailored to each patient's unique clinical situation, optimizing outcomes through a coordinated approach. 42. Investigations into the microbiome and its relationship with prostate cancer suggest that bacterial colonization in the body's microbiota may play a role in disease development and progression, although concrete mechanisms and therapeutic implications are yet to be determined. '43. Advanced imaging technologies such as PSMA, prostate-specific membrane antigen, PET scans provide superior specificity and sensitivity in detecting prostate cancer metastasis, particularly in cases of biochemical recurrence where conventional imaging falls short. '44. Cognitive decline and mood changes are potential side effects associated with hormone therapy for prostate cancer, reflecting the far-reaching impacts of treatment on a patient's overall well-being and the need for comprehensive supportive care measures. '45. Metastatic castration-resistant prostate cancer, mCRPC, represents a treatment-resistant stage where the cancer progresses despite androgen deprivation therapy, requiring innovative therapeutic options such as targeted therapies and novel androgen pathway inhibitors. '46. The risk factor of dietary fat intake in prostate cancer remains contentious. However, some studies suggest that high consumption of saturated fats may correlate with an increased risk of aggressive forms, signifying the potential benefits of dietary modifications in prevention strategies. '47. Sarcopenia, or the loss of skeletal muscle mass and strength, can be a concern in prostate cancer patients, particularly those undergoing ADT, highlighting the importance of exercise regimens and nutritional support to maintain muscle health and minimize treatment-associated morbidities. '48. The psychological impact of a prostate cancer diagnosis can be profound, contributing to anxiety and depression, underscoring the necessity for mental health support and counseling as integral components of comprehensive cancer care. '49. Liquid biopsies, which analyze circulating tumor DNA in the blood, represent a promising non-invasive method for detecting and monitoring prostate cancer, offering insights into tumor genetics and treatment resistance patterns that can inform personalized therapeutic decisions. '50. Radioligand therapy, an experimental approach in prostate cancer treatment, utilizes molecules that deliver radiation directly to cancer cells while sparing normal tissues, showing promise in early trials for patients with advanced disease that has not responded to conventional treatments. '1. Cardiac arrhythmias, often resulting from disruptions in the heart's electrical conduction system, can lead to symptoms such as palpitations, dizziness, and syncope, while potentially increasing the risk for more serious conditions like stroke and heart failure. Hence, understanding the complexities of atrial and ventricular arrhythmias is crucial for effective clinical management. '2. Diagnosing cardiac arrhythmias often involves the use of electrocardiograms, ECGs, as a primary tool, where healthcare providers analyze the electrical activity of the heart through P, QRS, and T waves, which can reveal patterns indicative of atrial fibrillation, tachycardia, or other arrhythmic conditions. '3. Although antiarrhythmic drugs like amiodarone, beta blockers, and calcium channel blockers are integral to the medical management of various cardiac arrhythmias, they come with their own set of pharmacokinetic challenges and side effects, necessitating careful patient monitoring and individualized treatment plans. '4. Atrial fibrillation, one of the most common types of arrhythmias, is characterized by rapid and irregular beating of the atria and is often associated with an increased risk of thromboembolic events, which calls for anticoagulation strategies in addition to rhythm or rate control therapies. 5. The pathophysiology of ventricular arrhythmias can involve abnormalities in ion channel functioning within myocardial cells, leading to conditions such as ventricular tachycardia or fibrillation, which are particularly serious due to their potential to precipitate sudden cardiac arrest. Six. Holter monitoring, which involves continuous ECG recording typically over 24 to 48 hours, is a valuable diagnostic method for identifying transient arrhythmic episodes that may not be captured during a standard ECG test in a clinical setting. 7. In certain cases of refractory arrhythmias or when medical management is insufficient, catheter ablation procedures might be considered. These involve the targeted destruction of arrhythmic foci within the heart tissue via radiofrequency or cryoablation techniques, aiming to restore normal cardiac rhythm. 8. Breach of cellular homeostasis and calcium ion handling in cardiomyocytes can contribute to arrhythmic phenomena, highlighting the importance of calcium channel function in maintaining proper myocardial contraction and electrical stability, often factored into pharmacotherapeutic interventions. 9. Genetic predispositions, sometimes linked to inherited channelopathies such as long QT syndrome or Brugada syndrome, can underpin the development of arrhythmias, indicating the need for genetic counseling and screening in at-risk populations to guide preventive and therapeutic strategies. 10. Cardiac arrhythmias in the context of ischemic heart disease can arise from scarring and fibrosis post-myocardial infarction, which disrupts electrical conduction pathways, thereby necessitating not only direct arrhythmia management but also comprehensive cardiovascular care to mitigate underlying ischemic burden. 11. Lifestyle factors such as excessive caffeine or alcohol consumption, smoking, and stress can exacerbate or trigger arrhythmic episodes, suggesting that a holistic approach to arrhythmia management must include patient education and lifestyle modifications alongside medical interventions. 12. The occurrence of arrhythmias during pregnancy presents unique clinical challenges due to physiologic changes and the need to consider fetal health, often requiring collaborative multidisciplinary care to address rhythm disturbances while minimizing risks to mother and child. 13. For individuals experiencing symptomatic bradyarrhythmias, potentially due to sinus node dysfunction or atrioventricular block, implantation of a pacemaker can provide effective rhythm management, thereby alleviating symptoms and reducing the risk of complications associated with low heart rates. 14. Unlike mere heart rate increase or decrease, arrhythmias involve the intricate disturbance of the heart's electrical impulses, necessitating attentive risk factor stratification in patient-specific treatment protocols, considering the vast array of underlying etiological mechanisms in each case. 15. A comprehensive history and physical examination remain pivotal in the initial assessment of patients presenting with suspected arrhythmias, for symptoms such as palpitations, fatigue, or dyspnea can stem from a vast differential diagnosis, thereby helping clinicians to triage and guide further investigations efficiently. 16. The role of the autonomic nervous system in modulating cardiac rhythms is significant, where imbalances in sympathetic and parasympathetic tone can precipitate arrhythmic events. Clinical interventions sometimes involve modulation of autonomic inputs to stabilize cardiac function. 17. Antiarrhythmic drug therapy carries potential proarrhythmic risk, necessitating diligent monitoring for QT interval prolongation or other adverse effects, especially in drugs that alter ion channels, underscoring the complexity of striking a balance between therapeutic benefits and possible toxicities. 18. Emerging non-invasive technologies like wearable ECG monitors provide continuous cardiac rhythm surveillance, empowering patients with real-time insights and facilitating early detection of arrhythmic phenomena outside of traditional clinical environments, fostering proactive management. 19. Pathological hypertrophy and dilation of cardiac chambers, often seen in conditions such as left ventricular hypertrophy or cardiomyopathies, can induce arrhythmic electrical conduction, highlighting the intersection between structural myocardial changes and electrophysiological disturbance. 20. Psychoemotional factors, including anxiety and depression, have been noted to influence the presentation and perceived burden of arrhythmias, thereby requiring a biopsychosocial model of care that integrates mental health support in managing patients with cardiac arrhythmias. 21. The electrophysiological study, EPS, serves as a cornerstone diagnostic tool for elucidating the mechanisms of arrhythmias, whereby intracardiac electrode catheters help in mapping the heart's electrical activity and understanding specific arrhythmic circuits for targeted therapeutic decisions. 22. The electrophysiology of the cardiac conduction system involves synchronized depolarization and repolarization events, with the sinoatrial and atrioventricular nodes playing critical roles. Disruptions here can result in inefficient cardiac cycles and highlight areas of potential electrophysiological intervention. 23. Structural heart conditions such as valvular diseases may predispose patients to arrhythmias due to resultant atrial enlargement and pressure overload, demonstrating the interconnected nature of mechanical and electrical heart dynamics in arrhythmogenesis. 24. Synchronization of ventricular contraction and improved hemodynamics are the goals of cardiac resynchronization therapy, CRT, used in select cases of heart failure with arrhythmias where biventricular pacing can dissolve dysynchrony and ameliorate symptoms. 25. Pediatric arrhythmias demand careful consideration, as they may manifest differently than in adults, with common etiologies including congenital heart defects or genetic syndromes, necessitating age-appropriate diagnostic and therapeutic approaches tailored to the developmental context. 26. The intricate anatomy of the cardiac conduction system, involving specialized pathways through the atrioventricular node and Purkinje fibers, underpins its vulnerability to disturbances, where even minor alterations in anatomy or physiology can have significant arrhythmic consequences. 27. The multifactorial etiology of arrhythmias often includes electrolyte imbalances such as hypokalemia or hypercalcemia, underscoring the importance of maintaining adequate electrolyte homeostasis in both prevention and treatment regimens for cardiac rhythm disturbances. 28. Lifestyle interventions, such as the incorporation of regular graded exercise, have shown beneficial effects in reducing the incidence of certain arrhythmias, promoting autonomic balance and cardiac fitness, when duly tailored to individual patient capabilities and risk profiles. 29. The risk stratification for sudden cardiac death in individuals with potentially malignant arrhythmias involves assessing factors such as ejection fraction, presence of syncope, and familial history, guiding decisions on the appropriateness of implantable cardioverter defibrillators as prophylactic measures. 30. Cardiac imaging techniques, including echocardiography and cardiac MRI, illuminate structural and functional status, providing essential information to correlate anatomical findings with arrhythmic potential, vital for comprehensive arrhythmia care planning. 31. The pathogenesis of arrhythmias can sometimes be attributed to inflammatory processes, as observed in conditions like myocarditis or cardiac sarcoidosis, where inflammation-induced scarring can alter conductive pathways, necessitating both anti-inflammatory and rhythm management strategies. 32. Clinical innovations, such as the development of bioengineered cardiac tissue grafts, hold promise for repairing arrhythmic substrates by restoring normal myocardial architecture and electrical continuity, offering a glimpse into future regenerative therapies for arrhythmia management. 3. Polymorphic ventricular tachycardia, often associated with electrolyte disturbances or ischemic insult, typifies the diversity within arrhythmias, necessitating nuanced understanding and management approaches, including correction of precipitating conditions and pharmacological stabilization. 34. The potential for asymptomatic arrhythmias to progress undetected adds an element of unpredictability to their management, emphasizing the value of regular cardiac evaluations, especially in high-risk populations, to mitigate possible adverse outcomes through proactive surveillance. The utilization of implantable loop recorders extends diagnostic capabilities over extended periods, capturing sporadic arrhythmic events that might otherwise go undiagnosed, enhancing the diagnostic yield in patients presenting with unexplained syncope or palpitations. 36. Paroxysmal supraventricular tachycardia, PSVT, arises from reentrant circuits within the atria or atrioventricular node, often requiring acute interventions such as vagal maneuvers or adenosine administration, alongside long-term consideration of pharmacological or ablative strategies for persistent cases. 37. The advent of telemedicine and virtual arrhythmia clinics has augmented patient access to specialized cardiac care, allowing remote consultations and monitoring that adapt to patient needs, optimizing management and follow-up in the evolving landscape of digital healthcare. 38. Wolff-Parkinson-White syndrome, a pre-excitation disorder characterized by the presence of an accessory pathway, manifests in tachyarrhythmias due to abnormal electrical conduction, underscoring the importance of accurate ECG interpretation and patient-specific intervention planning. 39. Not all arrhythmias convey the same clinical significance, with distinctions existing between benign ectopic beats and life-threatening tachyarrhythmias, thus imposing the need for differential diagnosis in the context of patient symptoms and overall cardiovascular risk. 40. Environmental factors, such as exposure to certain toxins or medications that prolong the QT interval, can precipitate arrhythmic events, necessitating awareness and mitigation strategies in both clinical and occupational contexts to prevent potential cardiac complications. Cardiac arrhythmias present gender-specific prevalence and risk factors, as hormonal influences and genetic predispositions may differ, warranting consideration of gender in both the research and clinical management paradigms of arrhythmic disorders. Technology-driven advancements in algorithms for arrhythmia detection leverage artificial intelligence to enhance the precision of diagnostic tools, transforming the landscape of non-invasive arrhythmia screening with the potential to improve early detection and intervention outcomes. The therapeutic landscape for arrhythmias continues to evolve with approaches such as gene therapy, targeting underlying molecular defects in inherited arrhythmogenic disorders, offering a frontier in personalized medicine that reaches beyond symptom control to address disease at its genetic root. Emotionally induced arrhythmias exemplify the direct link between mind and heart, where stress can precipitate acute arrhythmic events, highlighting the importance of integrating stress management techniques into comprehensive care plans for patients with cardiac susceptibility. Despite their potential diversity, arrhythmias share a common thread in their potential to affect cardiac output, emphasizing the interconnectedness of electrical dysrhythmia and hemodynamic compromise, necessitating a holistic grasp of cardiovascular physiology in clinical practice. The management of arrhythmias in patients with comorbid conditions, such as diabetes or chronic kidney disease, often involves additional layers of complexity due to interaction with existing therapies and potential alteration of drug metabolism, underscoring the importance of multidisciplinary care teams. 47. Recent studies suggest that the gut microbiome may influence cardiac rhythm through mechanisms involving metabolic byproducts, opening intriguing possibilities for novel approaches to managing arrhythmic disorders via dietary modulation and microbiome-targeted therapies. 48. In some instances, a pacemaker or implantable cardioverter defibrillator interaction with electromagnetic fields necessitates vigilance regarding potential interference, leading to patient education on avoiding certain environments to ensure device functionality remains uncompromised. 49. Considering arrhythmias from a global health perspective unveils disparities in access to arrhythmia care, prompting efforts towards enhancing healthcare infrastructure and education in resource-limited settings to bridge gaps and improve patient outcomes. 50. The use of risk prediction models in arrhythmia care, incorporating variables such as age, comorbidities, and lifestyle factors, facilitates a more tailored risk assessment approach, enhancing predictive accuracy and informing preventive strategies in clinical decision-making processes. 1. Brain tumors, particularly gliomas, can disrupt the blood-brain barrier, altering its permeability and potentially making the brain environment more susceptible to the influx of macromolecules and peripheral inflammatory cells, which can exacerbate cerebral edema and influence the tumor's microenvironment, requiring tailored therapeutic strategies to manage these effects alongside the primary treatment. 2. The distinction between primary and secondary brain tumors is critical, as primary brain tumors originate within the brain itself and may include glioblastomas or meningiomas, while secondary brain tumors, or brain metastasis, result from cancer spreading from another part of the body, such as the lungs, emphasizing the need for comprehensive systemic cancer management. 3. Advances in neuroimaging, including functional MRI and PET scans, enable not only the precise localization of brain tumors but also the assessment of tumor metabolism and potential malignancy, thereby refining preoperative planning and post-treatment monitoring, which enhances surgical outcomes and minimizes damage to critical brain areas. 4. The application of precision medicine in the treatment of brain tumors involves utilizing genetic and molecular profiling of tumors, which allows clinicians to tailor therapies based on specific mutations, such as IDH1 and IDH2 in gliomas, potentially improving response rates and minimizing unnecessary exposure to broader chemotherapeutic agents. 5. Tumor Treating Fields, TT fields, are an innovative non-invasive treatment modality for glioblastoma that employs alternating electric fields to disrupt cancer cell division by targeting the meiotic spindle, offering an additional therapeutic option that can be combined with surgery, radiation, and chemotherapy for comprehensive multimodal treatment. 6. The role of the tumor microenvironment in brain tumor pathophysiology is significant, with components such as hypoxia, immune cell infiltration, and extracellular matrix modulation influencing tumor growth, angiogenesis, and resistance to therapy, making it a focal area for developing novel therapeutic agents that can alter these pathways. 7. The utilization of stereotactic radiosurgery, SRS, such as Gamma Knife or CyberKnife, provides a highly precise irradiation method that delivers concentrated doses to brain tumors while sparing surrounding healthy tissue, making it particularly beneficial for small to medium-sized tumors or those located in surgically challenging areas. 8. Brain tumors can cause neurocognitive deficits, including memory impairment and executive dysfunction, due to direct neural disruption and indirect effects of treatments such as radiation and chemotherapy, necessitating cognitive evaluations and rehabilitation programs as integral components of comprehensive patient management. 9. The growing field of oncolytic virotherapy explores the use of genetically engineered viruses to selectively infect and kill brain tumor cells while sparing healthy cells, combining direct oncolytic effects with immune-mediated tumor suppression, holding promise as a novel approach especially in immunoresponsive tumors. Dexamethasone is commonly utilized in brain tumor management to reduce vasogenic edema and improve neurological symptoms by decreasing capillary permeability and stabilizing the blood-brain barrier, yet its long-term use requires careful monitoring for side effects such as hyperglycemia and immunosuppression. Bevacizumab, an anti-angiogenic monoclonal antibody targeting vascular endothelial growth factor, VEGF, is utilized in recurrent glioblastoma to hinder abnormal blood vessel formation, thereby reducing tumor vascularity and edema, although its use requires consideration of potential adverse effects and the development of resistance. Neuro-oncology has witnessed the promising advancement of immunotherapy, including checkpoint inhibitors and CAR T-cell therapies, that harness the body's immune system to recognize and eradicate tumor cells, although challenges remain in overcoming the immunosuppressive environment inherent to brain tumors. The integration of artificial intelligence in brain tumor diagnosis allows for the automation and enhancement of imaging interpretation through machine learning algorithms, improving accuracy and consistency in identifying tumor characteristics, predicting outcomes, and aiding in the early detection of subtle tumor changes. Enhancing the delivery of chemotherapeutic agents in brain tumor therapy involves various strategies, such as the development of nanoparticles and liposomal formulations, which can cross the blood-brain barrier more effectively, increase drug concentrations at the tumor site, and reduce systemic toxicity. In molecular pathology, the detection of 1p19q co-deletion in oligodendrogliomas not only serves as an essential diagnostic marker distinguishing them from other types but also indicates a favorable response to chemotherapy, highlighting the necessity of genetic testing in establishing a precise diagnosis and treatment plan. Diffusion tensor imaging, DTI, is a specialized MRI technique that enables visualization and mapping of white matter tracts in the brain, assisting neurosurgeons in assessing tumor infiltration and preserving vital neural pathways during surgical resection, thus optimizing functional outcomes for patients. Chordomas, rare malignant tumors arising from embryonic notochord remnants, predominantly occur at the skull base or spinal column and require meticulous surgical excision, often followed by proton beam therapy for radiation-sensitive tissues, underscoring the need for specialized multidisciplinary care. Seizures are commonly associated symptoms in patients with brain tumors due to epileptogenic changes within the cerebral cortex, often managed with anti-epileptic drugs such as levetiracetam, although careful titration and monitoring are necessary to avoid adverse effects and interactions with other cancer therapies. The discovery of EGFR mutations and amplifications in certain glioblastomas has opened avenues for targeted therapies using tyrosine kinase inhibitors, although resistance mechanisms and heterogeneity within tumors present ongoing challenges that require the development of combination therapeutic strategies. The blood-brain barrier, BBB, poses a significant obstacle in the delivery of effective chemotherapy for brain tumors, prompting research into methods to transiently and safely disrupt the BBB using focused ultrasound or osmotic agents without compromising the protection it affords the central nervous system. Understanding the progression of brain tumors from low-grade to high-grade malignancies is crucial, as it often involves distinct molecular pathways and genetic alterations, necessitating vigilant monitoring and potential intervention to halt or delay malignant transformation and improve long-term outcomes. 22. Integrating palliative care early in the treatment of brain tumors focuses on optimizing quality of life by addressing symptoms, psychosocial support, and patient and family education, ensuring that holistic care is provided alongside curative or life-prolonging treatments for a balanced approach to the disease. '23. Tumor heterogeneity within brain tumors contributes to variable responses to treatment and recurrence rates, emphasizing the importance of obtaining tissue biopsies from multiple tumor areas and employing comprehensive genomic profiling to guide personalized therapeutic interventions effectively. '24. The incidence of pituitary adenoma, generally benign tumors, can lead to hormonal imbalances and pressure effects on nearby structures such as the optic chiasm, requiring a combination of endocrinological management and surgical intervention via transsphenoidal resection when indicated. '25. Optic gliomas, associated with neurofibromatosis type 1, can lead to progressive visual loss in children and are managed through a combination of observation, chemotherapy, and in some cases, radiation therapy, with ongoing research into targeted molecular treatments aimed at preserving vision and stabilizing tumor growth. '26. Recognizing the signs and symptoms of increased intracranial pressure, such as headache, nausea, and papilledema, is vital in patients with brain tumors, prompting immediate intervention with measures like shunt placement or craniotomy to relieve pressure and prevent further neurological deterioration. '27. Novel techniques in intraoperative visualization and navigation, such as intraoperative MRI and fluorescence-guided surgery using 5-ALA, have enhanced the precision of tumor resection, allowing surgeons to distinguish neoplastic tissue more reliably, thereby improving surgical margins and patient outcomes. '28. Studying the role of microRNAs in brain tumor biology has unveiled their functions in regulating gene expression, tumor growth, and metastasis, paving the way for therapeutic targeting of these small non-coding RNAs to disrupt oncogenic pathways and improve the efficacy of existing treatments. '29. The exploration of epigenetic modifications, such as DNA methylation and histone acetylation, in brain tumors has revealed their influence on gene expression and tumor behavior, leading to the potential for developing epigenetic drugs that can reverse aberrant changes and restore normal cellular functions. '30. The prognostic significance of MGMT promoter methylation in glioblastoma lies in its correlation with improved response to alkylating agents like temozolomide, offering insight into personalized treatment planning and highlighting the critical role of molecular profiling in guiding therapeutic decisions. '31. Cerebellar tumors, such as medulloblastomas, primarily affecting children, can disrupt coordination and balance, requiring a combination of surgical resection, craniospinal irradiation, and chemotherapy, with ongoing research into molecular subtyping aiming to optimize treatment strategies and reduce long-term side effects. '32. Unveiling the potential of chimeric antigen receptor (CAR) T-cell therapy for targeting specific antigens expressed on brain tumors represents a promising frontier, but challenges remain in ensuring T-cell penetration into the central nervous system and sustaining durable responses in patients. '33. Assessment of tumor-associated epilepsy in brain tumor patients involves distinguishing between seizure types and understanding the complex relationship between epileptogenic networks and tumor pathology, highlighting the necessity for individualized anti-epileptic regimens and neurosurgical consultation when refractory seizures persist. '34. Recognizing the role of neuroinflammation in the progression and treatment resistance of brain tumors opens avenues for therapeutic targeting of inflammatory pathways, with agents such as COX-2 inhibitors and immune modulators being explored for potential anti-tumor efficacy and symptom relief. '35. Pseudoprogression in brain tumor imaging, often seen after radiation therapy and characterized by transient inflammatory changes rather than true tumor growth, poses diagnostic challenges requiring differentiation from actual progression through serial imaging studies and potentially utilizing advanced metabolic imaging techniques. 36. Ethical considerations in brain tumor clinical trials encompass informed consent, balancing innovation with patient safety, and equitable access to experimental treatments, necessitating robust ethical frameworks and communication strategies to ensure patients and families make informed decisions regarding participation. 37. Managing the neurocognitive side effects of radiation therapy for brain tumors involves implementing strategies such as hippocampal sparing techniques, cognitive rehabilitation, and pharmacological interventions aimed at reducing the risk of long-term intellectual impairment and ensuring sustained quality of life. 38. The potential use of ketogenic diets in brain tumor management explores the hypothesis that reducing glucose availability may affect tumor metabolism and growth, although this requires rigorous clinical investigation to verify efficacy and ensure safety in combination with standard oncological treatments. 39. Glioma stem cells are implicated in tumor recurrence and resistance to therapy, highlighting the importance of targeting these cells specifically with treatments that can impede their self-renewal and differentiation capabilities, thereby improving long-term control and patient prognosis. 40. The exploration of biomarkers, such as circulating tumor DNA, ctDNA, in the blood of brain tumor patients, offers a non-invasive method for monitoring disease status, treatment response, and early detection of relapse, providing a valuable tool for precision medicine approaches in neuro-oncology. 41. Neurofibromatosis type 2, NF2, is characterized by the development of multiple nervous system tumors, including schwannomas and meningiomas, requiring vigilant surveillance and, when necessary, intervention with surgery or newer medical therapies such as VEGF inhibitors to manage tumor growth and maintain neurological function. 42. Differentiating between tumor recurrence and radiation necrosis in brain cancer patients involves evaluating clinical presentation and employing advanced imaging modalities such as perfusion MRI or PET scans, aiding in determining the appropriate management pathway and avoiding unnecessary interventions. 43. Innovative surgical techniques in skull-based tumor resection, utilizing endoscopic approaches, allow for minimally invasive access to complex regions while reducing patient morbidity, emphasizing the critical role of specialized multidisciplinary teams in achieving optimal surgical outcomes and preserving neurological function. 44. The neuropeptide Y, NPY, receptor system has been implicated in brain tumor growth and angiogenesis, presenting a potential target for therapeutic intervention with antagonists designed to disrupt these pathways and complement existing treatments aimed at brain tumor control. 45. Olfactory neuroblastomas, originating in the nasal cavity extending into the brain, demand a multidisciplinary approach involving surgery, radiation, and sometimes chemotherapy, highlighting the complexities and importance of specialized care in managing these rare and challenging tumors. 46. Understanding the epidemiology and risk factors associated with brain tumors, including genetic predispositions and environmental exposures, provides essential insights for public health strategies aimed at early detection, prevention, and improved patient education on potential risks and symptoms. 47. The intricate relationship between neural stem cells and brain tumor development suggests potential strategies for therapeutic targeting, as alterations in stem cell regulatory pathways may contribute to tumorigenicity, requiring an understanding of stem cell biology in the context of oncogenesis and therapy. 48. Intracranial germ cell tumors, though rare, often present in pediatric patients and typically respond well to chemotherapy and radiation, depending on the type and location, underscoring the need for age-appropriate treatment protocols and long-term follow-up to monitor for potential late effects. The role of metabolic reprogramming in brain tumor cells includes alterations in glucose and lipid metabolism to support rapid growth and survival, providing a potential target for novel therapies aimed at disrupting these pathways to reduce tumor proliferation and enhance treatment efficacy. Exploring the potential of biodegradable polymer implants delivering localized chemotherapy directly to the site of brain tumor resection offers a method to maximize drug delivery while minimizing systemic toxicity, demonstrating a novel approach in the quest to improve patient outcomes and quality of life post-surgery. Parkinson's disease, a neurodegenerative disorder, primarily results from the death of dopamine-producing neurons in the substantia nigra, a region of the midbrain crucial for controlling smooth movements, leading to the hallmark symptoms of tremors, rigidity, bradykinesia, and postural instability. Traditional diagnosis of Parkinson's disease relies heavily on clinical evaluation, where neurologists observe motor symptoms and response to dopaminergic therapy, but innovative approaches now include the use of DAT-scan imaging to visualize dopamine transporter levels and differentiate Parkinson's from other movement disorders. The pathophysiology of Parkinson's disease includes the misfolding and aggregation of alpha-synuclein proteins, forming Lewy bodies in neurons, which disrupt cellular processes and contribute to neuronal degeneration and the progressive nature of the disease. Levodopa, a precursor to dopamine, remains the gold standard for symptomatic treatment of Parkinson's disease, its effectiveness rooted in its ability to replenish depleted dopamine levels in the brain, though long-term use may lead to motor complications such as dyskinesias. Parkinson's disease non-motor symptoms, such as depression, anxiety, sleep disturbances, and cognitive decline, often precede motor symptoms and are increasingly recognized as key aspects of disease management due to their significant impact on quality of life. Deep brain stimulation, DBS, an innovative surgical treatment for Parkinson's disease, involves the implantation of electrodes in the brain, typically targeting the subthalamic nucleus or globus pallidus internus, which modulates abnormal electrical impulses and alleviates motor symptoms. Genetic factors play a critical role in Parkinson's disease, with mutations in genes such as LRRK2, PARK7, and GBA identified as contributors to familial cases, while emerging research explores gene therapy as a means to target these genetic components directly to slow disease progression. The Braak staging model theorizes that Parkinson's disease pathology begins in the gut and olfactory system, moving upward to affect brain regions responsible for motor control, suggesting a potential biomarker in the early gastrointestinal symptoms for early diagnosis. Exercise has been shown to have neuroprotective effects in Parkinson's disease by promoting neuroplasticity and improving motor function, with studies indicating that regular physical activity may slow the progression of the disease and enhance quality of life for patients. The role of oxidative stress and mitochondrial dysfunction in Parkinson's disease pathogenesis is highlighted by evidence showing that impaired mitochondrial respiratory chain activity leads to increased production of reactive oxygen species, contributing to neuronal damage and disease progression. Epidemiological studies have identified several environmental risk factors for Parkinson's disease, including exposure to pesticides, heavy metals, and industrial solvents, all of which are thought to inhibit mitochondrial function and contribute to neuronal cell death. 12. Impulsive and compulsive behaviors, known as impulse control disorders, are potential side effects of Parkinson's disease medications, particularly dopaminergic therapy, emphasizing the need for careful monitoring and potential behavioral interventions in susceptible individuals. Neuroinflammation, characterized by activated microglia and increased levels of pro-inflammatory cytokines, is posited as a contributing factor in Parkinson's disease pathophysiology, offering a target for future therapeutic strategies aiming to dampen inflammatory responses in the brain. 14. Alpha-synuclein, a protein central to Parkinson's disease pathology, is not only involved in Lewy body formation but also in the disruption of synaptic vesicle trafficking and neurotransmitter release, which contributes to the complex network dysfunction observed in affected individuals. 15. The progression of Parkinson's disease is highly variable among individuals, with some experiencing rapid motor decline while others show a more gradual progression, underscoring the importance of personalized medicine approaches to tailor treatment plans and improve outcomes. 16. Retinal changes in Parkinson's disease, detectable through non-invasive optical coherence tomography, provide insights into neurodegenerative processes and have been proposed as potential biomarkers for early disease detection and monitoring of therapeutic effects. 17. Autophagy, the cellular process of degrading and recycling damaged components, is impaired in Parkinson's disease, leading to the accumulation of toxic proteins in damaged organelles, and therapeutic strategies aimed at enhancing autophagy are being explored as a means to halt disease progression. 18. Voice and speech disturbances, such as hypophonia and dysarthria, are common in Parkinson's disease due to the impact on motor coordination and respiratory control, and targeted speech therapy can significantly improve communication abilities and patient quality of life. 19. The gut-brain axis in Parkinson's disease is an emerging field of study, with research indicating that intestinal microbiota dysbiosis may influence neuroinflammation and alpha-synuclein propagation, offering potential therapeutic avenues that target gut health. 20. Neuroprotective strategies in Parkinson's disease focus on slowing disease progression through interventions that enhance neuronal survival, such as the use of antioxidants, anti-inflammatory compounds, and agents that stabilize mitochondrial function and cellular energy production. 21. LRRK2 inhibitors are a promising class of drugs under investigation in Parkinson's disease, aiming to mitigate the hyperactivity of the LRRK2 protein, which is implicated in both familial and sporadic cases, thereby reducing neuronal damage and potentially slowing the disease course. 22. Cognitive decline in Parkinson's disease, known as Parkinson's disease dementia, PDD, is associated with cortical and subcortical changes, with cholinesterase inhibitors like rivastigmine being utilized to manage cognitive symptoms and improve daily functioning in affected individuals. 23. The non-invasive technique of transcranial direct current stimulation, TDCS, is being explored as a therapeutic option in Parkinson's disease, with studies suggesting it can modulate cortical excitability and enhance motor learning, offering a complementary approach to traditional therapies. 24. Olfactory dysfunction is one of the earliest non-motor symptoms of Parkinson's disease, occurring in up to 90% of patients, and the loss of smell may precede the onset of motor symptoms by several years, providing a potential early marker for disease diagnosis. 25. Monoamine oxidase B, MAO-B, inhibitors, such as selegiline and rasagiline, improve Parkinson's disease motor symptoms by blocking the breakdown of dopamine in the brain, thereby prolonging its action and enhancing the efficacy of other dopaminergic treatments. 26. Dysphagia, or difficulty swallowing, affects approximately 50% of Parkinson's disease patients, posing significant risks of aspiration and malnutrition, and comprehensive management including dietary modifications and swallowing therapy is crucial for patient safety and quality of life. (27) REM sleep behavior disorder, RBD, is a sleep disorder commonly associated with Parkinson's disease, characterized by vivid dreams and lack of muscle atonia during REM sleep, and may serve as a prodromal marker indicating increased risk for developing Parkinson's or related neurodegenerative diseases. (28) Neurotrophic factors such as glial cell line-derived neurotrophic factor, GDNF, are being investigated for their ability to support neuron survival and axon growth in Parkinson's disease, with clinical trials exploring their potential as disease-modifying therapies. (29) The concept of freezing of gait in Parkinson's disease, where patients experience sudden episodes of immobility, is thought to arise from impaired neural circuits involved in locomotion, and rehabilitative strategies such as rhythmic auditory cues are employed to overcome these episodes. (30) Functional MRI, fMRI, studies in Parkinson's disease reveal altered connectivity patterns in brain networks responsible for motor and cognitive function, offering insights into disease progression and potential targets for non-pharmacological interventions such as cognitive training. (31) Histone deacetylase (HDAC) inhibitors are being explored as potential therapeutic agents in Parkinson's disease, aiming to modulate gene expression and protect neurons from degeneration by promoting a neuroprotective histone acetylation state. (32) The link between sleep disturbances and Parkinson's disease progression is being scrutinized, with poor sleep quality exacerbating both motor and non-motor symptoms, and interventions targeting sleep hygiene and disorders are shown to improve overall patient outcomes. (3) Balance dysfunction and fall risk in Parkinson's disease are linked to alterations in proprioceptive feedback and postural control, prompting the development of balance training programs that incorporate elements such as Tai Chi and dance to improve stability and reduce falls. (34) The fascinating phenomenon of neuroplasticity in Parkinson's disease, where the brain adapts to changes brought about by neurodegeneration, is being harnessed through interventions like cognitive behavioral therapy and task-specific rehabilitation to enhance functional outcomes. (35) Advances in wearable technology provide real-time monitoring of Parkinson's disease symptoms, enabling clinicians to obtain objective data on movement patterns, medication effectiveness, and disease progression, thus paving the way for personalized management strategies. (36) Anosmia, or loss of smell, in Parkinson's disease is thought to result from early deposition of alpha-synuclein in the olfactory bulb, providing a unique diagnostic clue that combines clinical observation with pathophysiological insight into the disease's early manifestations. (37) Neurovascular dysfunction in Parkinson's disease, characterized by alterations in the blood-brain barrier and cerebral blood flow, is proposed as a contributing factor in disease pathogenesis, prompting research into therapeutic strategies that target vascular health. 38. Apomorphine, a potent dopamine agonist, is used in Parkinson's disease to manage sudden, off episodes where motor symptoms re-emerge due to fluctuating medication levels, administered either subcutaneously or via continuous infusion for rapid symptom relief. The role of iron accumulation and its interaction with alpha-synuclein in Parkinson's disease is garnering attention, as excess iron in the substantia nigra is thought to exacerbate oxidative stress and promote neurodegeneration, highlighting the potential for iron-targeted therapies. Gastrointestinal dysfunction in Parkinson's disease, such as constipation and gastroparesis, is prevalent due to autonomic nervous system involvement, necessitating comprehensive management including dietary adjustments, prokinetic agents, and fiber supplements to alleviate symptoms. 41. The concept of neuroinflammation in Parkinson's disease extends beyond microglial activation, encompassing the detrimental role of peripheral immune system alterations, which may contribute to the progression of neurodegeneration and provide new avenues for therapeutic intervention. 42. The phenomenon of neurogenesis, or the generation of new neurons, remains impaired in Parkinson's disease, particularly in regions such as the hippocampus, prompting exploration of pharmacological and lifestyle interventions designed to stimulate this process and support brain regeneration. 43. Disruption in calcium homeostasis is implicated in Parkinson's disease pathophysiology, as abnormalities in calcium signaling and mitochondrial calcium overload are associated with neuronal death, and calcium channel blockers are being investigated for their neuroprotective potential. 44. Sexual dysfunction in Parkinson's disease, affecting both men and women, can result from a combination of neurochemical imbalances, medication side effects, and psychological factors, warranting a multidisciplinary approach that encompasses medical, psychological, and relationship counseling. 45. The use of cannabis derivatives, such as CBD oil, is under study for Parkinson's disease symptom management, with anecdotal evidence suggesting potential benefits for alleviating motor symptoms and anxiety, though rigorous clinical trials are needed to validate efficacy and safety. 46. The phenomenon of anosognosia, where patients with Parkinson's disease exhibit a lack of awareness of their motor impairments, may stem from altered neural connectivity in self-monitoring networks, complicating disease management and underscoring the need for caregiver support. 47. The gut microbiota's role in Parkinson's disease is a burgeoning area of research, with associations between specific bacterial strains and symptom severity suggesting that modulating gut flora through diet or probiotics may influence disease trajectory and improve patient outcomes. 48. Agonists targeting the adenosine A2A receptor are being developed for Parkinson's disease to exert neuroprotective effects, showing promise in reducing neuroinflammation and improving motor symptoms, potentially complementing existing dopaminergic therapies. 49. The emergence of wearable exoskeletons provides an innovative approach to assisting individuals with Parkinson's disease in maintaining mobility and independence, offering mechanical support and enhancing motor function through collaborative movement control. 50. Advances in precision medicine for Parkinson's disease focus on unraveling the individual genetic, environmental, and lifestyle factors contributing to disease variability, enabling the development of tailored treatment regimens that optimize therapeutic outcomes and mitigate side effects. 1. Liver cirrhosis is a chronic liver disease characterized by progressive fibrosis and regenerative nodule formation, leading to liver dysfunction, often resulting from chronic alcohol consumption, hepatitis B or C infections, and other chronic liver injuries, contributing to complications like portal hypertension, ascites, hepatic encephalopathy, and increased risk of hepatocellular carcinoma. 2. The diagnosis of liver cirrhosis is often based on clinical features, laboratory tests showing liver dysfunction, imaging studies like ultrasound or CT scans revealing nodular liver surface and altered architecture, and sometimes a liver biopsy confirming histological findings of fibrosis and nodular regeneration, particularly when the etiology is uncertain. 3. Ascites, the accumulation of fluid in the abdominal cavity, is a common complication of liver cirrhosis and results from portal hypertension and hypoalbuminemia, often diagnosed through physical examination, ultrasound confirming fluid presence, and analysis of acidic fluid regarding cell count and albumin concentration to rule out spontaneous bacterial peritonitis and malignant causes. Four. In liver cirrhosis, portal hypertension arises due to increased resistance to portal blood flow through the fibrotic liver, manifesting clinically as splenomegaly, variceal hemorrhage, ascites, and caput medusae, diagnosed through clinical examination, endoscopic findings of varices, and imaging modalities showing dilated portal system vessels. 5. Hepatic encephalopathy is a neuropsychiatric syndrome associated with liver cirrhosis, characterized by a spectrum from subtle cognitive dysfunction to coma, predominantly caused by elevated systemic ammonia levels due to impaired hepatic detoxification, and is often reversible with medical treatment and dietary protein modification. Six. Liver cirrhosis significantly alters pharmacokinetics and pharmacodynamics, resulting in enhanced drug adverse effects or reduced efficacy, necessitating careful drug choice and dosing due to compromised hepatic metabolism and altered plasma protein binding capabilities, requiring particular caution with drugs such as NSAIDs, sedatives, and anticoagulants. 7. Jaundice in liver cirrhosis results from the liver's inability to adequately conjugate and excrete bilirubin due to liver cell dysfunction, leading to elevated levels of unconjugated bilirubin, presenting with yellowish skin and scleral discoloration, dark-colored urine, and pale stools, serving as a marker of advanced liver disease. 8. Variceal hemorrhage is a life-threatening complication of liver cirrhosis caused by rupture of esophageal or gastric varices, a consequence of portal hypertension, presenting with hematemesis or melena, requiring urgent endoscopic assessment and possible intervention alongside pharmacological measures such as vasopressin analogs and prophylactic measures in high-risk patients. 9. Liver cirrhosis increases the risk of hepatorenal syndrome, a functional renal failure associated with portal hypertension and circulatory dysfunction, characterized by marked vasoconstriction of renal vessels leading to reduced glomerular filtration rate, and treated with volume expansion, vasoconstrictors, and ultimately bridging to liver transplantation. Ultrasound elastography is a non-invasive imaging technique used to assess liver stiffness and fibrosis severity in liver cirrhosis, providing a quantitative measure correlated with histopathological fibrosis stage, assisting in monitoring disease progression and guiding clinical decision-making regarding cirrhosis management without the need for repeat liver biopsies. 11. Spider angiomas, small, dilated blood vessels with a central red dot, frequently occur in liver cirrhosis due to hyperestrogenism from impaired estrogen metabolism, serving as a clinical hallmark observed on the upper body, often found alongside palmar erythema, both of which may signify advanced liver disease. 12. Serum to ascites albumin gradient, SAAG, is a diagnostic tool differentiating causes of ascites in patients with liver cirrhosis. A gradient greater than or equal to 1.1 grams per deciliter indicates portal hypertension-related ascites, helping to exclude non-cirrhotic causes such as peritoneal carcinomatosis or tuberculosis. 13. Nutritional deficits are prevalent in liver cirrhosis due to malabsorption, altered metabolism, and poor dietary intake, necessitating nutritional assessment and intervention focusing on ensuring adequate calorie intake, avoiding protein-energy malnutrition, and supplementing vitamins and minerals like zinc and vitamin D to improve clinical outcomes. 14. Thrombocytopenia in liver cirrhosis can stem from splenic sequestration of platelets secondary to portal hypertension or decreased thrombopoietin production by the liver, contributing to increased bleeding risk, and necessitating caution with invasive procedures and potential platelet transfusion prior to surgery. 15. The Child-Pugh score is an assessment tool used to evaluate the prognosis of chronic liver disease, incorporating clinical and laboratory parameters including bilirubin, albumin, prothrombin time, ascites, and hepatic encephalopathy, categorizing cirrhosis severity into classes A, B, or C, which helps guide therapeutic strategies and predict perioperative risk. 16. Alcoholic cirrhosis results from prolonged heavy alcohol intake leading to liver inflammation and scarring, and is often accompanied by steatosis and alcoholic hepatitis, requiring absolute abstinence from alcohol as the primary treatment, which can stabilize or ameliorate liver damage and improve overall prognosis. 17. Liver transplantation is a definitive treatment for end-stage liver cirrhosis, indicated when medical management fails or life-threatening complications ensue, involving replacing the diseased liver with a healthy donor liver, a procedure with careful recipient selection based on criteria such as MELD score predicting post-transplant survival. 18. Metabolic and physiological alterations in liver cirrhosis cause muscle wasting, known as sarcopenia, due to factors like systemic inflammation, hormonal imbalances, and altered amino acid catabolism, necessitating focused nutritional and physical rehabilitation strategies to improve patient mobility, quality of life, and survival outcomes. 19. Hepatopulmonary syndrome is a vascular complication of liver cirrhosis, characterized by hypoxemia due to intrapulmonary vascular dilation and shunting, presenting with dyspnea and platypnea orthodeoxia, requiring diagnosis through contrast-enhanced echocardiography and supplemental oxygen, with definitive treatment through liver transplantation. 20. The MELD, Model for End-Stage Liver Disease, score is an objective prognostic tool used to prioritize liver transplantation candidates based on a formula incorporating bilirubin, INR, and creatinine levels to predict 3-month mortality risk in cirrhotic patients, influencing the allocation of donor livers in liver transplant programs. 21. Non-alcoholic steatohepatitis, NASH, related cirrhosis is increasingly recognized due to the global rise of obesity and metabolic syndrome, presenting initially with fatty liver and progressing to inflammation and fibrosis, necessitating lifestyle modifications, with emerging pharmacological therapies targeting metabolic pathways in ongoing research phases. 22. Portal hypertensive gastropathy is a condition associated with liver cirrhosis, resulting in mucosal changes in the stomach and stomach bleeding due to portal hypertension, identified through endoscopy as mosaic-like patterns and treated with beta blockers to reduce portal pressure and prevent recurrent bleeding. 23. Biliary cirrhosis results from chronic injury and destruction of bile ducts, seen in conditions like primary biliary cholangitis, with subsequent fibrosis and cirrhosis development, presenting with cholestatic jaundice, pruritus, and elevated alkaline phosphatase levels, and treated with ursodeoxycholic acid to slow disease progression. 24. Autoimmune hepatitis can progress to liver cirrhosis if untreated, characterized by necroinflammatory liver damage, presence of autoantibodies, and elevated immunoglobulin G, necessitating immunosuppressive therapy as treatment, typically with corticosteroids and azathioprine to achieve remission and prevent cirrhotic progression. 25. Hepatorenal syndrome type 1 is a rapidly progressive form of renal failure seen in patients with advanced liver cirrhosis, associated with marked renal hypoperfusion and poor prognosis, necessitating urgent supportive measures such as albumin infusion and vasoconstrictors while awaiting liver transplantation as the definitive treatment. 26. Hyperestrogenemia in liver cirrhosis, due to impaired hepatic metabolism leading to elevated estrogen levels, causes clinical signs like gynecomastia, testicular atrophy, and red palms, and may contribute to vascular changes in coagulopathy, necessitating management of underlying liver dysfunction to alleviate these hormonal imbalances. (27) Coagulopathy in liver cirrhosis results from impaired liver synthesis of clotting factors and thrombocytopenia, leading to increased bleeding risks, requiring careful monitoring of coagulation parameters and cautious use of anticoagulants, as well as possible administration of clotting factor concentrates or platelet transfusions in bleeding episodes. (28) Portal vein thrombosis in liver cirrhosis can worsen portal hypertension and is often asymptomatic or presents with abdominal pain and gastrointestinal bleeding, requiring anticoagulation therapy balancing bleeding risks, and possibly interventional procedures like thrombectomy or shunt placement in refractory cases. (29) In liver cirrhosis, small intestinal bacterial overgrowth can occur due to altered gut motility and bile salt deficiency, contributing to further liver damage through bacterial translocation and endotoxemia, managed with a combination of antibiotics, probiotics, and dietary changes to restore balanced gut flora and reduce liver insults. (30) In advanced liver cirrhosis, patients may develop hepatopulmonary syndrome characterized by pulmonary vasodilation leading to hypoxemia and dyspnea, with a diagnosis supported by arterial blood gas analysis and contrast-enhanced echocardiography, managed with oxygen therapy and considering liver transplantation as a definitive cure. (31) Spontaneous bacterial peritonitis, SBP, is a severe and often recurrent infection of acidic fluid in patients with liver cirrhosis, frequently caused by gram-negative bacteria, diagnosed through acidic fluid analysis showing polymorphonuclear leukocytes count greater than 250 cells per cubic millimeter and treated urgently with antibiotics and albumin infusions. (32) Hyperdynamic circulation is a feature of advanced liver cirrhosis, characterized by increased cardiac output, decreased systemic vascular resistance, and compensatory mechanisms involving renin-angiotensin and sympathetic nervous systems, contributing to complications like variceal bleeding and requiring beta blockers for hemodynamic stabilization. (33) Patients with liver cirrhosis may develop a compensatory gastric ulcer due to altered gastric mucosal protection and increased portal pressure affecting gastric blood flow, necessitating regular endoscopic evaluation and preventive measures like proton pump inhibitors or treating Helicobacter pylori infection if present. (34) Hepatic hydrothorax in liver cirrhosis is the accumulation of pleural fluid typically on the right side due to transdiaphragmatic migration of acidic fluid in the presence of diaphragmatic defects, leading to respiratory distress and managed through therapeutic thoracentesis, dietary sodium restriction, and diuretics, with liver transplantation as curative. (35) Changes in dermal collagen composition and metabolism may occur in liver cirrhosis due to alterations in circulating cytokines and growth factors, leading to complications like Dupuytren's contracture, which is recognized by palmar fascia thickening and flexion contractures of fingers, managed conservatively or surgically if functional impairment arises. (36) Liver cirrhosis patients have an increased risk of osteopenia and osteoporosis due to malabsorption of fat-soluble vitamins, specifically vitamin D, and alterations in bone metabolism, necessitating regular bone density screening and calcium and vitamin D supplementation to prevent fractures and maintain bone health. (37) Cutaneous manifestations such as leukonychia, due to hypoalbuminemia, and Terry's nails, characterized by proximal nail whitening, are observed in liver cirrhosis, serving as non-invasive clinical indicators of chronic liver disease severity and necessitating management of underlying liver dysfunction for improvement. 38. Increased levels of cytokines and oxidative stress markers in liver cirrhosis contribute to systemic inflammation, and these are linked to disease progression and suppression of the immune system, which underlines the therapeutic focus on antioxidants and immunomodulatory strategies alongside traditional cirrhosis management. 39. Cholestasis in liver cirrhosis results from impaired bile flow due to bile duct obstruction or failure of bile excretion from hepatocytes, clinically presenting with jaundice, pruritus, and pale stools, and requires addressing the cirrhotic cause, with interventions like ursodeoxycholic acid or stent placement in biliary obstructions. 40. Hepatic artery buffer response, important for maintaining liver perfusion in cirrhosis, is a regulatory mechanism where hepatic artery flow increases to compensate for the reduction in portal flow, but becomes dysregulated in advanced cirrhosis, contributing to further hepatic hypoperfusion and necessitating medical management to optimize circulation. 41. Sepsis-induced acute on chronic liver failure is a condition where liver cirrhosis is exacerbated by systemic inflammation and infection, presenting with hepatic decompensation and multi-organ failure, underscoring the need for rapid identification and aggressive treatment of infections alongside supportive care measures. 42. Splenomegaly in patients with liver cirrhosis develops due to portal hypertension, leading to increased splenic venous pressure and resultant hyperplasia, often resulting in hypersplenism and cytopenias, and may require interventions like splenic embolization or partial splenectomy in severe symptomatic cases. 43. Hepatic stellate cells play a crucial role in cirrhosis pathophysiology, as they transform from quiescent vitamin A fat-storing cells into activated myofibroblasts, producing excessive extracellular matrix proteins leading to fibrosis, which highlights them as therapeutic targets for antifibrotic agents to halt or reverse liver cirrhosis progression. 44. Endoscopic band ligation is a treatment modality for esophageal varices in liver cirrhosis, performed to prevent variceal hemorrhage by placing rubber bands to induce thrombosis and fibrosis of variceal veins, effectively reducing variceal bleeding risk and often complemented by beta blocker therapy for long-term management. 45. Advanced liver cirrhosis impairs hormonal metabolism, leading to endocrine dysfunctions such as hypogonadism, insulin resistance, and feminization in men, necessitating multidisciplinary management including lifestyle modifications and hormonal therapies to mitigate reproductive and metabolic repercussions on patient health. 46. Lipopolysaccharide, LPS, endotoxin from gut-derived bacteria can exacerbate cirrhosis by enhancing systemic inflammation and hepatocyte injury, implicating the gut-liver axis as a target for therapeutic interventions such as probiotic therapy, antibiotics, and nutritional management to restore intestinal barrier function and reduce systemic endotoxemia. 47. Hepatic coagulopathy management in cirrhosis may involve recombinant factor VIIA in cases of significant bleeding, synthesizing coagulative deficiencies in the face of resistant bleeding, highlighting the complexity of balancing hemostasis with thrombosis risk, requiring individualized treatment strategies based on patient bleeding profiles. 48. Liver cirrhosis patients' dysregulated hormonal synthesis leads to mineralocorticoid excess with clinical features like edema, contributing to ascites and complicating diuretic therapy. Although reflecting reduced aldosterone metabolism, careful adjustment of diuretics and monitoring of electrolyte balance remains crucial in management. 49. Anemia in liver cirrhosis arises from multifactorial causes including hypersplenism, gastrointestinal bleeding, and anemia of chronic disease, necessitating diagnostic evaluation to direct management options such as transfusions, iron supplementation, or addressing underlying causes like gastric ulcers or variceal bleeding. 50. Rifaximin is an orally administered, gut-specific antibiotic used in the treatment of recurrent episodes of hepatic encephalopathy and liver cirrhosis. Acting by altering gut flora to reduce ammonia production, it complements lactulose therapy and has a favorable side effect profile due to minimal systemic absorption. 1. Breast cancer is the most common cancer among women worldwide, accounting for approximately 25% of all cancer cases, and it arises primarily from the lining of the ducts and lobules in the breast tissue, classified as ductal or lobular carcinoma respectively, and is often influenced by hormonal, genetic, and environmental factors. 2. The pathophysiology of breast cancer often involves the overexpression of the HER2 protein, which accelerates the growth of cancer cells, or mutations in the BRCA1 or BRCA2 genes, significantly increasing a woman's lifetime risk of developing breast cancer by altering the processes controlling normal cell growth and DNA repair mechanisms. 3. Early-stage breast cancer is commonly diagnosed using imaging techniques such as mammography, which can detect tumors that are asymptomatic and as small as a few millimeters, while MRI and ultrasound may be used to further evaluate suspicious areas, especially in dense breast tissue. 4. Treatment for breast cancer typically involves a multimodal approach, including surgery, which may be a lumpectomy or mastectomy, often followed by radiation therapy to reduce the risk of local recurrence, and systemic treatments such as chemotherapy, hormonal therapy, or targeted therapy, depending on the tumor's receptor status and molecular profile. 5. Hormonal therapy for breast cancer involves drugs like tamoxifen or aromatase inhibitors, which work by blocking estrogen receptors or decreasing estrogen production, respectively, and are particularly effective in estrogen receptor-positive, ER+ cancers, thereby preventing the recurrence of the disease, especially in postmenopausal women. 6. Triple-negative breast cancer, TNBC, which lacks estrogen, progesterone, and HER2 receptors, presents a significant clinical challenge due to its aggressive nature and limited treatment options, typically involving a combination of surgery and chemotherapy, as targeted treatments are currently not available for this subtype. 7. Sentinel lymph node biopsy is a procedure used to determine the extent of breast cancer spread by injecting a dye and/or radioactive tracer to identify the first few lymph nodes into which a tumor drains, minimizing the need for more extensive lymph node dissections and thereby reducing the risk of lymphedema. 8. Adjuvant chemotherapy is recommended for breast cancer patients with higher risk of recurrence, typically indicated by larger tumor size, lymph node involvement, or high-grade tumors, and consists of drugs such as doxorubicin and cyclophosphamide, which interfere with DNA replication in rapidly dividing cancer cells. 9. Breast cancer staging, classified from 0 to IV, is crucial in guiding treatment decisions and is based on the size of the tumor, involvement of nearby lymph nodes, and the presence of distant metastasis, with stage 0 indicating non-invasive cancer and stage 4 indicating metastatic disease with poorer prognosis. 10. Inflammatory breast cancer, a rare but aggressive form, is characterized by the diffuse redness and swelling resembling an infection, often without a palpable tumor, and is caused by cancer cells blocking lymph vessels in the skin. It requires prompt systemic therapy along with surgery and radiation. 11. Oncotype DX, a genomic test for early-stage, hormone receptor-positive breast cancer, evaluates the expression of 21 cancer-related genes to predict the risk of recurrence and likely benefit of chemotherapy, thereby assisting clinicians in personalizing treatment plans for individual patients. 12. Breast cancer in men, although rare, usually presents with symptoms such as a lump in the breast tissue, nipple discharge, or changes in the nipple or breast skin, and the treatment protocols are similar to those in women, often involving surgery, radiation, and systemic therapies. 13. The 5-year relative survival rate for localized breast cancer, detected before it has spread outside the breast tissue, exceeds 98%, highlighting the importance of regular screening and early detection, which significantly improve treatment outcomes and patient survival rates. HER2 positive breast cancer, characterized by the overexpression of the HER2 protein, is aggressive but shows improved outcomes with targeted therapies such as trastuzumab or pertuzumab, which inhibit the HER2 receptors, thereby slowing or stopping the growth of cancer cells. 15. Breast-conserving surgery, also known as a lumpectomy, aims to remove the cancerous tissue while sparing as much healthy breast tissue as possible, and is generally followed by radiation therapy to minimize the risk of cancer recurrence in the conserved breast. 16. Bone is a common site for breast cancer metastasis, and patients with bone metastasis may experience symptoms like bone pain or fractures. Treatment includes systemic therapies, bisphosphonates or denosumab to strengthen bone, and sometimes radiation therapy for pain relief. 17. Paget's disease of the breast, a rare form of cancer involving the nipple and areola, often presents with symptoms like redness, scaling, and itching, and is associated with underlying ductal carcinoma in situ or invasive breast cancer, necessitating prompt biopsy and treatment. 18. The Gale model is a risk assessment tool used to estimate a woman's risk of developing breast cancer over the next 5 years and lifetime by considering factors such as age, family history, reproductive history, and history of breast biopsies, aiding in individualized screening recommendations. 19. Breast cancer survivors may experience long-term side effects from treatment, including lymphedema, fatigue, cognitive changes, and increased risk of osteoporosis, necessitating ongoing multidisciplinary care and regular follow-up to monitor and manage these potential complications. 20. Microcalcifications on mammography, often seen as small white spots, can be an indication of early breast cancer, especially ductal carcinoma in situ, and typically warrant further evaluation with a magnified mammogram or biopsy to determine their nature and appropriate management. 21. The breast cancer subtype known as luminal A is estrogen receptor, positive and/or progesterone receptor, PR positive, HER2 negative, and typically presents with a favorable prognosis due to slower growth rates and responsiveness to hormone therapies. 22. Neoadjuvant therapy, administered before surgery, is used in certain breast cancer cases to shrink the tumor, making it operable or allowing breast-conserving surgery rather than mastectomy, and also provides the added benefit of assessing the tumor's response to systemic treatment. 23. The Nottingham Histologic Score, also known as the Bloom-Richardson score, grades invasive breast cancer based on tubule formation, nuclear pleomorphism, and meiotic count, providing a prognostic indicator that helps guide treatment decisions. 24. Carcinoma in situ, found in conditions like ductal carcinoma in situ, DCIS, or lobular carcinoma in situ, LCIS, represents an early form of breast cancer contained within the ducts or lobules without invasion into surrounding tissues, often requiring localized treatment and careful surveillance. 25. During breast cancer diagnosis, a core needle biopsy, guided by imaging techniques such as ultrasound or stereotactic mammography, is the preferred method for obtaining tissue samples to confirm cancer presence and subtype, as it provides adequate tissue for histological examination. 26. Radiation therapy for breast cancer is typically delivered postoperatively to eradicate residual microscopic cancer cells in the breast, chest wall, or regional lymph nodes, and it significantly reduces local recurrence rates, enhancing long-term survival outcomes for patients. 27. Aromatase inhibitors, such as anastrozole or letrozole, are often preferred for postmenopausal women with hormone receptor-positive breast cancer because they reduce estrogen production from peripheral tissues, thus lowering circulating estrogen levels that could stimulate tumor growth. 28. The use of prophylactic mastectomy, or preventative removal of breast tissue, may be considered for individuals with a very high risk of breast cancer, such as those with BRCA1 or BRCA2 mutations, as it significantly reduces the likelihood of developing breast cancer. 29. Breast cancer screening guidelines generally recommend women begin annual or biennial mammograms starting at age 40 or 50. But individualized screening strategies may be necessary for women with higher risk factors, such as family history or genetic predispositions. 30. HER2 testing is critical in breast cancer management, usually conducted through immunohistochemistry, IHC, or fluorescence in situ hybridization, FISH, upon biopsy or surgical specimens, as HER2 status determines the use of targeted therapies and influences treatment strategies. 31. Paraneoplastic syndromes are rare in breast cancer, but these immune-mediated or hormone-related effects, such as hypercalcemia or dermatomyositis, can complicate the clinical picture, requiring a high index of suspicion for timely diagnosis and treatment. 32. Breast cancer often metastasizes to the brain, and symptoms like headaches, seizures, or cognitive changes can indicate central nervous system involvement, often managed with surgery, stereotactic radiosurgery, or whole brain radiation, depending on the extent and location of lesions. 3. Breast density is a recognized risk factor for breast cancer, as seen on mammograms, with higher density indicating more glandular and connective tissue, which can mask tumors, thus necessitating advanced imaging techniques like 3D mammography or MRI for accurate screening. 34. Invasive lobular carcinoma, known for its distinctive growth pattern of small, non-cohesive cells, often presents with more insidious and diffuse growth, complicating detection and treatment, and sometimes requiring bilateral mammograms due to an increased risk of contralateral breast cancer. 35. Chemoprevention in breast cancer, utilizing medications like tamoxifen or raloxifene, is an option for women at increased risk, as these agents interfere with estrogen receptor pathways, effectively reducing the incidence of hormone receptor-positive breast cancers. 36. Phyllodes tumors of the breast, while rare, are distinct from other breast cancers because they arise from the stromal tissue and can be benign, borderline, or malignant, often requiring wide local excision due to their potential for local recurrence or, in malignant cases, metastasis. 37. Male breast cancer, accounting for less than 1% of all breast cancers, typically presents in older men with risk factors such as Klinefelter syndrome, BRCA2 mutations, or family history, and though rare, treatment parallels female breast cancer protocols, including surgery and adjuvant therapies. 38. Lobular carcinoma in situ, LCIS, is not considered a true cancer but an indicator of increased breast cancer risk, mostly involving both breasts, that often leads to intensified surveillance and sometimes chemoprevention to mitigate the risk of eventual invasive cancer development. 39. Breast-conserving surgery followed by radiation therapy provides equivalent survival outcomes to mastectomy in early-stage breast cancer, challenging the older notion that more extensive surgical procedures necessarily lead to better survival, thus enabling more personalized treatment approaches. 40. Invasive ductal carcinoma, the most common form of breast cancer, displays distinct microscopic features like duct-like structures on histology, emphasizing the heterogeneous nature of tumors, which guides the selection of systemic treatments depending on receptor status and genetic markers. 41. Breast cysts are fluid-filled sacs that can be mistaken for solid tumors during physical exams or imaging, often requiring aspiration under ultrasound guidance to relieve discomfort and confirm the cystic nature, while regular monitoring ensures they do not develop malignant features. Molecular subtyping of breast cancer through gene expression profiling helps in identifying specific biological characteristics of a tumor, categorizing it into subtypes such as basal-like, HER2 enriched, or luminal, each with unique prognostic implications and tailored treatment strategies. In breast cancer, circulating tumor cells, CTCs, and circulating tumor DNA, ctDNA, are emerging biomarkers that provide insights into the disease burden and dynamics, potentially guiding treatment decisions and monitoring response to therapy, though their clinical utility is still under investigation. Breast cancer-related lymphedema, resulting from lymph node removal or radiation, leads to arm or breast swelling and is managed with physical therapy, compression garments, and sometimes surgical interventions to restore lymphatic flow and prevent infection or functional impairment. Adolescent girls with a strong family history of breast cancer may benefit from genetic counseling and testing to assess for mutations like BRCA1 or BRCA2, which can significantly influence future screening practices and risk-reducing strategies, impacting their long-term healthcare plans. Tumor heterogeneity in breast cancer is a key challenge in treatment, as distinct genetic and phenotypic variations in cancer cells within the same tumor or between primary and metastatic sites can impact drug response and resistance, necessitating adaptive and personalized treatment approaches. The emergence of immunotherapy in breast cancer, which harnesses the body's immune system to attack cancer cells, has shown promise particularly in triple-negative subtypes through agents like checkpoint inhibitors, which are currently explored in clinical trials to broaden therapeutic options. Breast cancer survivors are at risk of developing secondary cancers due to shared risk factors like genetics or the effects of previous treatments, thus requiring continued vigilance in screening and preventive measures to detect and mitigate these risks effectively over the long term. Genetic testing for mutations such as PALB2 or ATM, alongside BRCA1 and BRCA2, can elucidate familial breast cancer risk, guiding decisions on enhanced screening and risk-reducing interventions like prophylactic surgeries or lifestyle modifications to lower cancer incidence or recurrence. Liquid biopsies, a non-invasive diagnostic tool for breast cancer, detect tumor-derived materials in the bloodstream, offering potential for early detection, monitoring treatment response, and identifying emerging resistance, although their integration into routine clinical practice requires further validation. Dyslipidemia, primarily characterized by abnormal lipid levels in the bloodstream, often involves elevated levels of low-density lipoprotein cholesterol, LDL-C, reduced high-density lipoprotein cholesterol, HDL-C, and increased triglycerides, fostering a conducive environment for atherosclerosis development, thus increasing the risk for coronary artery disease and cerebrovascular incidence. The pathophysiology of dyslipidemia largely involves the dysregulation of lipid metabolism, which is influenced by genetic predispositions, lifestyle factors, and underlying conditions such as obesity, insulin resistance, and chronic kidney disease, all contributing to an imbalance in lipid transport and synthesis. Clinical diagnosis of dyslipidemia typically requires a fasting lipid panel, assessing total cholesterol, LDL-C, HDL-C, and triglycerides, where variations suggest potential lipoprotein metabolism disorders, confirming a need for further investigation or intervention. 4. Statins, as HMG-CoA reductase inhibitors, represent the cornerstone of dyslipidemia treatment, effectively reducing LDL-C levels, stabilizing atherosclerotic plaques, and ultimately decreasing cardiovascular morbidity and mortality rates in patients with high cholesterol. 5. Lifestyle modifications, including a heart-healthy diet rich in omega-3 fatty acids, regular physical activity, maintenance of a healthy weight, and smoking cessation, are fundamental components of dyslipidemia management, aimed at enhancing lipid profiles and reducing associated cardiovascular risks. Six. Genetic factors play a critical role in dyslipidemia, with familial hypercholesterolemia being a notable genetic disorder characterized by mutations in the LDL receptor gene, leading to severely elevated LDL-C levels and an increased propensity for premature cardiovascular disease. 7. Emerging therapies for dyslipidemia, such as monoclonal antibodies targeting proprotein convertase subtilisin, Cushing type 9, PCSK9 inhibitors, provide a novel mechanism for dramatically lowering LDL-C levels by enhancing the liver's ability to clear circulating LDL particles. 8. The relationship between dyslipidemia and inflammation has been increasingly recognized, with studies suggesting that systemic inflammation, as measured by markers such as C-reactive protein, may exacerbate cholesterol-driven atherosclerosis and contribute to adverse cardiovascular events. 9. Non-alcoholic fatty liver disease, NAFLD, is frequently associated with dyslipidemia due to lipid accumulation in hepatocytes, which may further exacerbate insulin resistance, creating a vicious cycle that promotes metabolic syndrome and cardiovascular complications. 10. Dyslipidemia is not limited to adult populations, as children and adolescents are increasingly diagnosed with lipid disorders, often linked to obesity, sedentary lifestyles, and poor dietary habits, warranting early intervention to prevent lifelong cardiovascular disease risk. Apolipoproteins, such as ApoB and ApoAI, play critical roles in lipoprotein structure and function, where ApoB is associated with atherogenic particles like LDL, while ApoAI is the primary apolipoprotein of HDL, highlighting the significance of apolipoprotein ratios in evaluating dyslipidemia's cardiovascular risk. The role of lipoprotein A or Lp(a) in dyslipidemia and cardiovascular disease is gaining attention, as elevated levels are genetically determined and contribute to atherogenesis and thrombosis, making it a challenging target for therapeutic intervention. Advanced lipid testing, which includes assessment of lipoprotein particle size and number, can offer additional insights into cardiovascular risk by differentiating between small, dense LDL particles known to be more atherogenic and larger, less harmful ones. Diabetes mellitus significantly augments the risk of dyslipidemia, often characterized by a triad of elevated triglycerides, low HDL-C, and predominance of small dense LDL particles, necessitating aggressive lipid management to mitigate cardiovascular risk. The interplay between hypothyroidism and dyslipidemia is well established, as reduced thyroid hormone levels can diminish lipid clearance, leading to elevated cholesterol and triglyceride levels, thereby necessitating thyroid function assessment in patients presenting with lipid abnormalities. Dyslipidemia in postmenopausal women is frequently observed due to hormonal changes, particularly reduced estrogen levels, which impact hepatic lipoprotein metabolism, leading to elevated LDL-C and decreased HDL-C levels, increasing cardiovascular disease incidence. The Mediterranean diet, characterized by high intake of fruits, vegetables, whole grains, and healthy fats such as olive oil, has been shown to significantly improve lipid profiles in individuals with dyslipidemia, thereby reducing cardiovascular disease risks. Secondary causes of dyslipidemia should always be considered, including conditions such as nephrotic syndrome, hypothyroidism, alcohol use, and medications like corticosteroids and beta blockers, as managing these underlying issues can improve lipid levels. Dyslipidemia is often a silent condition, lacking obvious symptoms until the occurrence of significant cardiovascular events such as myocardial infarction or stroke, underscoring the importance of regular screening and proactive management in at-risk populations. Regular physical activity is one of the most effective lifestyle interventions in managing dyslipidemia, as aerobic exercise helps increase HDL-C and decrease triglycerides, while also reducing visceral fat and improving overall cardiovascular health. Polyphenol-rich foods, such as berries, dark chocolate, and red wine, contain bioactive compounds that have been shown to favorably influence lipid levels by reducing cholesterol absorption and oxidative stress, providing adjunctive benefits in dyslipidemia management. Omega-3 fatty acids, abundant in fatty fish like salmon and mackerel, play a crucial role in reducing serum triglyceride levels and exerting cardiovascular protective effects, making them a beneficial dietary addition for individuals with hyperlipidemia. Dyslipidemia is a critical component of metabolic syndrome, a cluster of conditions that include hypertension, insulin resistance, and abdominal obesity, collectively elevating the risk of developing type 2 diabetes and cardiovascular diseases. Niacin, also known as vitamin B3, can significantly elevate HDL-C levels and lower triglycerides, although its use in clinical practice has declined due to the development of more effective and better tolerated lipid-lowering medications like statins and PCSK9 inhibitors. Dyslipidemia management in chronic kidney disease is challenging due to altered lipoprotein metabolism, with patients commonly exhibiting elevated triglycerides and low HDL-C, necessitating careful selection of lipid-lowering therapies to avoid further renal impairment. The role of coenzyme Q10 in dyslipidemia management remains controversial, as some studies suggest it may help mitigate the myalgic side effects of statin therapy, thereby potentially enhancing patient adherence to lipid-lowering medications. Phytosterols, naturally occurring compounds found in plant-based foods, effectively lower LDL-C levels by competing with cholesterol absorption in the intestinal tract, offering a natural adjunct to conventional dyslipidemia therapies. Dyslipidemia in pregnancy can be physiologically normal due to hormonal changes. However, severely elevated lipid levels may require intervention, especially if they pose additional risks such as gestational diabetes or preeclampsia. Clinicians should consider the atherogenic index of plasma, AIP, calculated as the logarithm of the ratio between plasma triglycerides and HDL-C, as a predictive marker for cardiovascular risk assessment in patients with dyslipidemia. Dyslipidemia is a prevalent comorbidity in chronic inflammatory conditions, such as rheumatoid arthritis and psoriasis, where systemic inflammation exacerbates lipid abnormalities, prompting integrated approaches for cardiovascular risk reduction in these populations. Statin intolerance, whether due to muscle-related side effects or biochemical abnormalities, remains a significant barrier in dyslipidemia management, necessitating alternative therapies such as ezetimibe, bile acid sequestrants, or PCSK9 inhibitors to achieve lipid targets. Monoclonal antibodies against PCSK9 represent a breakthrough in dyslipidemia treatment, especially for familial hypercholesterolemia patients unable to achieve target LDL-C levels despite maximal statin therapy, highlighting personalized approaches in lipid management. The liver plays a central role in lipid regulation, and conditions such as cirrhosis or hepatitis can drastically alter lipid profiles, often resulting in atypical presentations of dyslipidemia that require specialized diagnostic and therapeutic strategies. Investigations into the gut microbiome's impact on lipid metabolism suggest that specific microbial compositions can influence lipid levels, opening novel avenues for dyslipidemia treatment through probiotics or dietary modifications aimed at beneficial gut flora alterations. Bempedoic acid offers a non-statin alternative for dyslipidemia management, particularly beneficial for patients intolerant to statins, as it lowers LDL-C by inhibiting ATP citrate lyase, an enzyme involved in the biosynthesis of cholesterol and fatty acids. Alcohol consumption impacts lipid profiles, where moderate intake of certain types, like red wine with resveratrol, may confer cardiovascular benefits, while excessive alcohol can exacerbate dyslipidemia by raising triglyceride levels and contributing to hepatic steatosis. Proprotein convertase subtilisin Cushing type 9, PCSK9 inhibitors have revolutionized the treatment landscape for dyslipidemia, providing a powerful option for significantly reducing LDL cholesterol levels, especially in patients with genetic lipid disorders like familial hypercholesterolemia. Dyslipidemia plays a critical role in cerebrovascular disease pathogenesis, where elevated cholesterol levels contribute to the formation and progression of carotid artery plaques, increasing the risk for ischemic stroke and necessitating aggressive lipid management. Hemoglobin A1c, traditionally used for diabetes management, can be a useful additional marker in assessing cardiovascular risk in patients with dyslipidemia, as hyperglycemia exacerbates lipid abnormalities and accelerates atherogenesis. Lipid-lowering therapies in elderly patients with dyslipidemia require careful consideration of comorbidities and potential polypharmacy, balancing the benefits of cardiovascular risk reduction with the risks of adverse drug interactions and side effects. Lipoprotein-lowering strategies targeting very low-density lipoprotein, VLDL, are crucial in managing dyslipidemia associated with hypertriglyceridemia, given VLDL's role in triglyceride transport and its contribution to atherogenic remnant particle formation. Dyslipidemia is intricately linked with hypertension, as elevated cholesterol levels contribute to endothelial dysfunction and arterial stiffness, further exacerbating cardiovascular risk and necessitating integrated management approaches. Recent advancements in genetic testing allow for more precise identification of dyslipidemia subtypes, particularly in familial hypercholesterolemia, enabling personalized treatment plans and enhanced risk stratification for patients and their families. Comprehensive cardiovascular disease prevention in patients with dyslipidemia includes optimizing other risk factors such as hypertension and diabetes management, reinforcing the importance of a holistic approach to reduce overall cardiovascular morbidity and mortality. 45. Psychological factors, including stress, have been shown to impact lipid profiles adversely, potentially aggravating dyslipidemia through increased cortisol levels and promoting unhealthy lifestyle behaviors, highlighting the need for stress management interventions. (46) Dyslipidemia influences the pathogenesis of chronic endothelial injury, wherein excess circulating lipids lead to oxidative stress and endothelial cell dysfunction, forming the initial step in atherogenesis and necessitating interventions aimed at restoring vascular health. (47) Vitamin D's potential role in dyslipidemia management continues to be explored, given its involvement in various metabolic processes, although evidence remains mixed regarding its ability to significantly alter lipid profiles or improve cardiovascular outcomes. (48) The pharmacogenomics of statin therapy in dyslipidemia is an evolving field, providing insights into genetic factors that may influence statin metabolism and response, guiding personalized medication strategies to optimize efficacy and minimize adverse effects. (49) Dyslipidemia is an important modifiable risk factor in cancer development, as elevated lipid levels contribute to chronic inflammation and oxidative stress, fostering an environment conducive to oncogenesis, thereby necessitating integrated preventive efforts in high-risk populations. (50) The concept of residual cardiovascular risk in dyslipidemia management emphasizes that despite achieving optimal LDL-C levels, patients may still suffer cardiovascular events, prompting research into other potential targets, such as triglycerides and lipoprotein (A), for comprehensive risk reduction. (1) A cerebral aneurysm is a localized dilation in a blood vessel within the brain, often forming at artery junctions due to intrinsic weaknesses in the vessel wall that can be exacerbated by conditions like hypertension and atherosclerosis, raising the risk of rupture, which can lead to a potentially life-threatening hemorrhagic stroke. 2. The rupture of a cerebral aneurysm results in a subarachnoid hemorrhage, characterized by a sudden, severe headache often described as a thunderclap, or worst headache of life, due to the rapid increase in intracranial pressure, with symptoms potentially including neck stiffness, photophobia, nausea, vomiting, and impaired consciousness. (3) Many cerebral aneurysms remain asymptomatic until rupture, but unruptured aneurysms may occasionally cause symptoms by pressing on surrounding brain tissue or nerves, potentially leading to focal neurological deficits such as vision changes, pain above or behind an eye, or numbness on one side of the face. (4) The pathophysiology of cerebral aneurysms involves a complex interplay of genetic factors, hemodynamic stress, inflammation, and extracellular matrix remodeling that weakens the blood vessel wall, primarily affecting the internal elastic lamina and media layers, making the vessel more prone to dilation and rupture. (5) The gold standard for diagnosing cerebral aneurysms non-invasively is magnetic resonance angiography, MRA, or computed tomography angiography, CTA, which provides detailed images of blood vessels in the brain, allowing clinicians to identify even small aneurysms and assess their size, shape, and location. (6) Risk factors for the development and rupture of cerebral aneurysms include smoking, hypertension, family history, age over 40, female gender, alcohol abuse, and certain genetic disorders such as polycystic kidney disease or Ehlers-Danlos syndrome, which can contribute to connective tissue weaknesses. (7) Management of unruptured cerebral aneurysms involves a careful balance between regular monitoring and surgical intervention, with decisions influenced by the size, location, morphology of the aneurysm, and patient-related factors such as age, health status, and risk tolerance, to minimize potential rupture complications. 8. Endovascular coiling is a minimally invasive procedure commonly used to treat cerebral aneurysms by inserting a catheter through the blood vessels to the site of the aneurysm, where detachable coils are placed to induce clotting, effectively sealing off the aneurysm and reducing the likelihood of rupture. 9. Surgical clipping of a cerebral aneurysm involves an open craniotomy to access the aneurysm directly, allowing a neurosurgeon to place a metal clip at the neck of the aneurysm, thereby isolating it from the parent vessel, which is a more invasive but often definitive treatment compared to endovascular techniques. The choice between coiling and clipping may depend on various factors, such as the aneurysm's size, shape, and location, as well as the patient's overall health and the availability of experienced surgical and endovascular teams, with both methods having their unique risks and benefits in terms of efficacy and recovery. 11. Cerebral vasospasm is a potential complication following the rupture of a cerebral aneurysm, where the sudden release of blood into the subarachnoid space leads to narrowing of cerebral arteries, which can significantly reduce blood flow and cause further brain injury, often peaking 3 to 14 days after the initial hemorrhage. 12. Nimodipine, a calcium channel blocker, is routinely administered orally in the acute management of subarachnoid hemorrhage from a ruptured cerebral aneurysm to prevent or mitigate the effects of cerebral vasospasm and associated ischemic deficits, despite its hypotensive effect requiring cautious monitoring of blood pressure. 13. The Hunt and Hess scale and the World Federation of Neurosurgical Societies (WFNS) scale are clinical grading systems used to assess the severity of aneurysmal subarachnoid hemorrhage, helping to predict outcomes by evaluating factors like the patient's level of consciousness, presence of focal neurological deficits, and overall clinical condition. 14. The Fisher scale, based on the amount and distribution of blood seen on initial CT scans, is used to grade subarachnoid hemorrhage from a ruptured cerebral aneurysm, offering prognostic information regarding the likelihood of vasospasm, with higher grades indicating an increased risk and need for vigilant monitoring and intervention. 15. Seizures may occur after the rupture of a cerebral aneurysm due to the acute brain injury and cortical irritation caused by subarachnoid hemorrhage or increased intracranial pressure, necessitating prophylactic or therapeutic anticonvulsant medication in some patients to manage and prevent further neurological complications. 16. Genetic testing for individuals with familial history of cerebral aneurysms may help identify underlying hereditary factors, especially in cases of connective tissue disorders like Marfan syndrome, providing insights into potential predispositions and enabling proactive monitoring or early intervention to manage increased rupture risks. 17. Acute management of a ruptured cerebral aneurysm focuses on stabilizing the patient's condition through airway management, blood pressure control, intracranial pressure monitoring, and potentially early surgical intervention to prevent rebleeding and manage complications that could worsen patient outcomes. 18. Secondary complications like hydrocephalus, an accumulation of cerebrospinal fluid due to impaired reabsorption following subarachnoid hemorrhage, may require the placement of a temporary external ventricular drain or a permanent ventriculoperitoneal shunt to alleviate pressure in the ventricles, preventing further damage to brain tissue. 19. Lifestyle modifications, including smoking cessation, alcohol moderation, regular blood pressure monitoring, and a heart-healthy diet, are recommended for individuals at risk of cerebral aneurysms to reduce modifiable risk factors associated with aneurysm development and rupture, contributing to improved long-term outcomes. 20. High-resolution vessel wall imaging using MRI can provide insights into the morphology and histopathology of cerebral aneurysms, allowing the visualization of intraluminal thrombus, aneurysm wall inflammation, or instability, thus helping in the stratification of rupture risk and guiding clinical management decisions. 21. Computational fluid dynamics is an emerging tool that allows the assessment of hemodynamic forces at play within and around cerebral aneurysms, providing valuable data on flow patterns that may influence aneurysm growth and rupture risk, and can aid in the customization of treatment approaches or the development of new interventions. 22. The role of inflammation in cerebral aneurysm pathogenesis is under active research, with evidence suggesting that an inflammatory response within the aneurysm wall contributes to wall degeneration and rupture, highlighting potential therapeutic targets for anti-inflammatory agents that could stabilize aneurysms or slow their progression. 23. In the acute phase of cerebral aneurysm rupture, managing intracranial pressure is paramount, often requiring sedation, hyperosmolar therapy, and careful ventilation strategies to ensure adequate cerebral perfusion, while avoiding interventions that could exacerbate swelling or lead to secondary brain injury. 24. Advances in endovascular technology, such as flow-diverting stents, provide alternatives for treating wide-necked or complex cerebral aneurysms, working by redirecting blood flow away from the aneurysm sac, promoting healing and vessel remodeling, and broadening the options for minimally invasive treatment. 25. The size and shape of a cerebral aneurysm are critical determinants in assessing rupture risk, with large greater than 7 mm, and irregularly shaped aneurysms are those exhibiting daughter sacs, carrying a higher propensity for rupture compared to small, smooth-walled aneurysms, which may warrant closer monitoring or more immediate intervention. 1. Alzheimer's disease, a progressive neurodegenerative disorder, primarily affects the elderly, leading to memory loss and cognitive decline, and is characterized by the accumulation of amyloid beta plaques and tau tangles in the brain, which disrupt neural communication and lead to cell death, distinguishing it from other forms of dementia and necessitating comprehensive clinical evaluation for accurate diagnosis and management involving pharmacological and non-pharmacological strategies. 2. One of the first and most recognizable symptoms of Alzheimer's disease is short-term memory loss, often starting subtly with the affected individual frequently forgetting recent events or newly acquired information, and may eventually lead to more serious cognitive impairments, underscoring the importance of early detection strategies that can help manage symptoms and potentially slow disease progression before significant cognitive decline sets in. 3. Although Alzheimer's disease affects both sexes, women appear to be at a higher risk than men, which might be attributed to differences in life expectancy, hormonal influences, or genetic factors such as the differential impact of APOE4 allele, suggesting the need for gender-tailored approaches in risk assessment, prevention, and therapeutic interventions tailored specifically for women. 4. The diagnosis of Alzheimer's disease is primarily clinical based on detailed patient history, cognitive testing, and neuroimaging techniques such as MRI or PET scans that may reveal characteristic brain changes like hippocampal atrophy and decreased glucose metabolism in specific areas, confirming the presence of the disease and aiding in differentiating it from other cognitive disorders. 5. Alzheimer's disease is thought to have a substantial genetic component, with mutations in genes such as APP, PSEN1, and PSEN2 leading to familial forms of the disease, while the presence of the APOE4 allele increases the risk of sporadic Alzheimer's, highlighting the complex interplay between genetic predisposition and environmental factors in the etiology of the disorder. 6. Interest in biomarkers for Alzheimer's disease is growing, with cerebrospinal fluid (CSF) levels of amyloid beta and tau proteins showing promise in reflecting pathological changes, alongside novel blood tests currently under investigation, which aim to provide less invasive, cost-effective options for early detection, tracking disease progression, and evaluating responses to therapeutic interventions. 7. Neuroinflammation is increasingly recognized as a significant factor in the pathophysiology of Alzheimer's disease, with microglial activation contributing to neuronal damage, supporting the idea that targeting inflammatory pathways could be a potential therapeutic strategy to slow or modify disease progression, which research is actively investigating through varied pharmacological approaches. 8. Cholinesterase inhibitors, such as donepezil, rivastigmine, and galantamine, constitute a primary treatment for mild to moderate Alzheimer's disease by enhancing the levels of acetylcholine in the brain, which helps alleviate symptoms related to neurotransmitter deficiencies, although their effects may be modest and decline as the disease progresses, requiring ongoing evaluation and adjustment of therapeutic strategies. 9. Recent advancements in positron emission tomography (PET) scans utilizing specific tracers like Pittsburgh Compound B (PIB) have allowed for visualization and quantification of amyloid plaques in the living brain, providing a powerful tool not only in improving diagnostic accuracy of Alzheimer's disease but also in the development and assessment of new anti-amyloid therapies. 10. Alzheimer's disease presents with a wide range of symptoms that gradually worsen over time, starting from mild cognitive impairments and advancing to more severe impairments including language difficulties, disorientation, mood swings, behavioral changes, and ultimately the loss of the ability to carry out everyday activities, requiring comprehensive care strategies that address both cognitive and non-cognitive symptoms for effective management. 11. Vascular factors like hypertension, diabetes, and hyperlipidemia are considered potential risk factors for Alzheimer's disease, suggesting that optimal control of these conditions through lifestyle modifications and appropriate pharmacotherapy might reduce the risk of cognitive decline or slow its progression, though more research is needed to confirm these associations. 12. Oxidative stress is thought to play a critical role in the pathogenesis of Alzheimer's disease by damaging cell membranes, proteins, and DNA, thus contributing to neuronal dysfunction and death, and understanding these oxidative mechanisms has spurred research into antioxidants and other compounds that could potentially ameliorate such damage as part of therapeutic efforts. 13. Alzheimer's disease is clinically divided into several stages: preclinical, mild cognitive impairment, MCI, due to Alzheimer's, and dementia due to Alzheimer's disease, with each stage characterized by its own set of cognitive and functional impairments, which inform the prognosis, management decisions, and provide guidance for planning care and support tailored to the needs of patients at each stage. 14. The role of lifestyle factors such as diet, physical activity, and cognitive engagement in possibly lowering the risk of Alzheimer's has garnered attention, with studies suggesting that adherence to a Mediterranean diet, regular exercise, and mental stimulation may contribute to maintaining cognitive health and potentially delay the onset or progression of Alzheimer's disease, although direct causal relationships remain under investigation. 15. Bilingualism has been proposed to offer a protective cognitive reserve that may delay the onset of Alzheimer's disease symptoms, with research suggesting that the lifelong practice of managing two linguistic systems enhances neural networks and cognitive flexibility, potentially serving as a non-pharmacological intervention to reduce the risk of cognitive decline. 16. In patients with advanced Alzheimer's disease, sundowning, a phenomenon where symptoms such as confusion, anxiety, agitation, and disorientation worsen during the late afternoon and evening hours, poses significant challenges for caregivers, highlighting the importance of structured routines, environmental adjustments, and potentially pharmacological interventions in managing this behavioral aspect. 17. Although there is yet no cure for Alzheimer's disease, ongoing research is exploring several novel therapeutic approaches, including monoclonal antibodies targeting amyloid beta and tau proteins, small molecule inhibitors, gene therapy, and neuroprotective strategies, which aim to modify disease progression, improve symptoms, and enhance the quality of life for affected individuals. 18. Environmental factors, such as exposure to heavy metals, pesticides, and air pollution, have been investigated for their potential roles in the pathogenesis of Alzheimer's disease, underscoring the need for further research to understand these influences and develop public health initiatives aimed at reducing potential environmental risks associated with cognitive decline. 19. Frontal lobe dysfunction in Alzheimer's disease can lead to a variety of symptoms including decision-making difficulties, changes in personality, impaired judgment, and social behavior alterations, which complicate the care of affected individuals and necessitate tailored interventions to address these deficits and improve overall functional outcomes. 20. Alzheimer's patients are at a heightened risk of epilepsy, with seizures commonly appearing in the later stages of the disease, likely due to increased neuronal hyperexcitability resulting from neurodegenerative processes, emphasizing the need for awareness among clinicians to ensure timely diagnosis and management of seizures to improve patient safety and quality of life. 21. The use of assistive technology and adaptive strategies, such as memory aids, simplified communication devices, and environmental modifications, plays a crucial role in enhancing the quality of life and independence of individuals with Alzheimer's disease, allowing them to maintain functional abilities longer and providing essential support for caregivers in managing daily challenges. 22. Neuropsychological testing in Alzheimer's disease serves as a vital tool for assessing the breadth and depth of cognitive impairments, differentiating it from other dementias or psychiatric conditions, and establishing baselines for tracking disease progression, guiding treatment decisions, and evaluating the effectiveness of therapeutic interventions over time. 23. The concept of cognitive reserve implies that individuals with higher educational attainment, mentally stimulating occupations, or active engagement in complex environments may exhibit a delay in the onset of Alzheimer's symptoms, as they can better compensate for neurodegenerative changes, underlining the importance of lifelong learning and intellectual engagement in potentially mitigating cognitive decline. 24. The gut-brain axis is an emerging area of research in Alzheimer's disease, with studies investigating how alterations in the gut microbiota may influence neuroinflammation and amyloid plaque formation, suggesting potential new avenues for intervention through diet, probiotics, and microbiome-modulating therapies as part of a comprehensive approach to treatment. 25. Brain-derived neurotrophic factor, BDNF, levels have been implicated in the cognitive decline observed in Alzheimer's disease, with reduced levels associated with weak synaptic plasticity and neuronal survival. This insight supports the exploration of BDNF-enhancing strategies, possibly through pharmacological agents, lifestyle changes, and exercise, to promote cognitive health and slow disease progression. 26. Sleep disturbances, including insomnia and altered sleep-wake cycles, are common in Alzheimer's disease and can exacerbate cognitive symptoms, increase caregiver stress, and affect overall health, making sleep assessment and management an essential component in the comprehensive care and quality of life improvement of individuals with this condition. 27. The potential role of cholesterol metabolism in Alzheimer's disease has drawn interest given its effect on amyloid beta production and clearance, suggesting a possible link between dyslipidemias and increased disease risk, with ongoing studies exploring the impact of statin use and other lipid-modifying therapies as part of a multifaceted approach to disease management and prevention. 28. Advanced neuroimaging techniques, such as diffusion tensor imaging, DTI, and functional MRI, fMRI, provide deeper insights into structural and functional changes within the brains of Alzheimer's patients, allowing for a more detailed understanding of neural connectivity disturbances and the development of biomarkers for early disease detection and monitoring therapy responses. 29. Individuals with Down syndrome have a significantly increased risk of developing Alzheimer's disease, typically at an earlier age, due in part to the presence of an extra copy of chromosome 21, which harbors the gene for amyloid precursor protein, AP, highlighting the importance of targeted surveillance and early intervention strategies in this high-risk population. Systemic inflammation, such as that resulting from chronic infections or autoimmune conditions, has been implicated in the progression of Alzheimer's disease, suggesting that managing systemic inflammatory processes might hold potential as a therapeutic approach to delaying or mitigating neurodegenerative changes associated with this condition. 31. The role of synaptic dysfunction in Alzheimer's disease is pivotal, with the loss of synapses considered a primary driver of cognitive decline, focusing research interest on synaptic repair and protection strategies, including the development of neurotrophic factors and modulators of synaptic plasticity, aiming to restore cognitive functions and halt disease progression. 32. Recent research into Alzheimer's has highlighted the potential of neurotrophins, such as nerve growth factor and brain-derived neurotrophic factor, which support neuronal growth and survival. Targeting these molecules could lead to novel therapeutic interventions aimed at promoting neuroregeneration and functional recovery in patients affected by the disease. 3. The use of multi-domain lifestyle interventions, encompassing diet, exercise, cognitive training, and social engagement, as observed in the FINGER study and subsequent trials, shows promise in reducing the risk of cognitive decline and preserving cognitive function in at-risk populations, suggesting the importance of a holistic approach to Alzheimer's disease prevention. 34. Metal homeostasis, particularly the interactions of copper, zinc, and iron, is an area of increasing interest in Alzheimer's research, given the role these metals play in amyloid beta aggregation and tau phosphorylation, raising the prospect of metal-modulating therapies as a means to alter disease course and improve patient outcomes. 35. The presence of neurofibrillary tangles, composed of hyperphosphorylated tau protein, is a hallmark of Alzheimer's disease, disrupting intracellular transport and contributing to neuronal death, with ongoing research exploring tau-directed therapies to prevent tangle formation and spread, thereby offering potential for disease-modifying treatments. 36. Alzheimer's disease is associated with alterations in neurotransmitter systems beyond acetylcholine, including glutamate, gamma-aminobutyric acid, GABA, and serotonin pathways. Understanding these changes informs the development of new pharmacological treatments aiming to restore neurotransmitter balance and alleviate cognitive and behavioral symptoms. 37. While age remains the most significant risk factor for Alzheimer's disease, other modifiable risk factors like physical inactivity, smoking, obesity, and midlife hypertension offer opportunities for preventive interventions, underscoring the importance of public health strategies focusing on lifestyle modification to reduce disease burden and enhance longevity. 38. The proteinopathy hypothesis postulates that misfolded proteins, such as amyloid beta and tau, propagate through neural networks via prion-like mechanisms, contributing to the progression of Alzheimer's disease, driving research into therapies that target these propagation pathways to halt or slow the spread of neuropathological changes across brain regions. 39. Recent trials with monoclonal antibodies like aducanumab have provided insights into the feasibility and challenges of amyloid-targeted therapies, showing potential in reducing amyloid plaque burden. Yet the clinical significance regarding cognitive benefits remains under debate, necessitating continued evaluation in larger and more diverse patient populations. 40. The cholinergic hypothesis of Alzheimer's disease proposes that a deficiency in acetylcholine contributes to cognitive deficits and memory loss, providing the rationale for the development of cholinesterase inhibitors as symptomatic treatments and stimulating ongoing research into novel therapies aiming to enhance cholinergic function in the brain. 41. Depression and anxiety are common comorbidities in Alzheimer's patients, complicating the clinical picture and impacting quality of life. Recognizing and addressing these mood disorders through pharmacological and non-pharmacological means is crucial for comprehensive care and improving patient and caregiver well-being. 42. Autophagy, the cellular process of degrading and recycling damaged components, has been implicated in Alzheimer's disease, with research suggesting disruptions in autophagic flux may lead to the accumulation of misfolded proteins. This highlights the potential for therapies aimed at enhancing autophagy as a strategy to clear amyloid beta and tau aggregates. 43. Understanding the interplay between cerebrovascular changes and Alzheimer's disease has led to the concept of mixed dementia, where vascular pathology coexists with neurodegenerative changes, stressing the need for integrated diagnostic approaches and interventions addressing both vascular health and neurodegeneration for optimal patient outcomes. 44. The phenomenon of anosognosia, or lack of awareness of one's cognitive deficits, is frequently observed in Alzheimer's patients, presenting challenges for diagnosis, management, and patient care, and necessitating the development of supportive strategies that involve caregivers in decision-making and care planning to address safety concerns and enhance quality of life. 45. Amyloid beta oligomers are considered highly neurotoxic entities contributing to synaptic dysfunction and neurodegeneration in Alzheimer's disease, focusing therapeutic research on targeting these soluble assemblies to prevent synaptic impairment and promote cognitive preservation, expanding potential avenues for disease-modifying interventions. 46. Alzheimer's disease-related amyloid angiopathy involves the deposition of amyloid beta in cerebral blood vessels, leading to increased risk of microbleeds and hemorrhagic stroke, highlighting the importance of vascular health monitoring and management of cerebrovascular risk factors as part of comprehensive care strategies for affected individuals. 47. The role of mitochondrial dysfunction in Alzheimer's disease pathogenesis has gained attention, with evidence suggesting that impaired energy dynamics and increased oxidative stress contribute significantly to neuronal death, driving research into mitochondrial-targeted therapies aiming to restore energy balance and protect against neurodegeneration. 48. The APOE4 allele is the most common genetic risk factor associated with sporadic Alzheimer's disease, increasing the likelihood of developing the condition and influencing age of onset, but ongoing research is exploring gene editing technologies and other novel strategies that could alter APOE expression or function to modify disease risk. 49. The selection of potential therapeutic targets in Alzheimer's disease often relies on preclinical models, including transgenic animals engineered to develop amyloid plaques and tau tangles, which provide critical insights into disease mechanisms and facilitate the evaluation of disease-modifying treatments, though translating findings from models to human patients remains a challenge. 50. Multimodal intervention trials highlight the potential benefits of combining pharmacological treatments with lifestyle modifications and cognitive training to optimize care for Alzheimer's patients, underscoring the significance of early intervention and individualized care plans that address both the biological and environmental aspects of disease management. 1. Cardiac arrhythmia refers to any disruption in the heart's normal rhythm, commonly resulting from chaotic electrical impulses within the heart muscle, which can lead to various symptoms such as palpitations, dizziness, syncope, or in severe cases, sudden cardiac death, emphasizing the importance of comprehensive cardiovascular examination and electrocardiogram (ECG) evaluation as part of the diagnostic process. 2. The pathophysiology of cardiac arrhythmias often involves alterations in ion channel function, which can be attributed to genetic mutations, myocardial ischemia, or structural heart changes, leading to the development of conditions like atrial fibrillation, ventricular tachycardia, and other conduction disorders that necessitate tailored therapeutic strategies to mitigate risks and manage symptoms. Three. Atrial fibrillation, the most prevalent form of cardiac arrhythmia, is characterized by rapid, irregular beating of the atrial chambers and can increase the risk of stroke and heart failure, making anticoagulation therapy an essential component of management alongside rate control medications like beta blockers or calcium channel blockers to improve patient outcomes. 4. Ventricular fibrillation is a life-threatening cardiac arrhythmia caused by disorganized electrical activity in the ventricles, leading to cardiac arrest if not promptly treated with immediate defibrillation and advanced cardiac life support measures, underscoring the critical need for emergency response and intervention. 5. The diagnostic approach for cardiac arrhythmias often involves Holter monitoring or event monitors, which provide continuous ECG recordings over 24 hours or longer, enabling clinicians to capture transient episodes of arrhythmia, correlating them with symptoms and aiding in the accurate identification of both the type and cause of arrhythmia. 6. Supraventricular tachycardia, SVT, is a common arrhythmia originating above the ventricles, characterized by an abnormally fast heartbeat, often exceeding 150 beats per minute, which can be managed acutely with vagal maneuvers, adenosine, or, in recurrent cases, catheter ablation, highlighting the importance of individualized patient care. 7. Long QT syndrome is a potentially dangerous arrhythmia disorder that prolongs ventricular repolarization, predisposing individuals to torsades de pointes, a form of polymorphic ventricular tachycardia, necessitating regular monitoring, avoidance of QT prolonging medications, and possibly the use of beta blockers or implantable cardioverter defibrillators, ICDs, in high-risk patients. 8. Bradycardia is an arrhythmic condition defined by a heart rate of fewer than 60 beats per minute, which can be physiological or pathological, requiring thorough assessment to determine if management with pacemaker implantation is required to prevent symptoms like fatigue, dizziness, or syncope associated with insufficient cardiac output. 9. Wolff-Parkinson-White syndrome is an arrhythmia condition caused by an accessory pathway that allows electrical impulses to bypass the heart's normal conduction system, leading to episodes of tachycardia that can be effectively treated with catheter ablation to prevent recurrence and improve quality of life. 10. Premature ventricular contractions, PVCs, are early heartbeats originating in the ventricles, and while often benign, frequent PVCs should be evaluated with an electrocardiogram and echocardiogram to rule out underlying structural heart disease. Beta blockers may be considered if symptomatic or if there is an associated cardiomyopathy. 11. Carotid sinus hypersensitivity, a cause of bradyarrhythmia, results from exaggerated response to stimulation of the carotid sinus, leading to episodes of syncope or presyncope that can impact quality of life and require head-up tilt testing for diagnosis, with dual-chamber pacemaker implantation being an effective treatment for recurrent symptomatic cases. 12. The ventricular tachycardia storm, characterized by frequent episodes of ventricular tachycardia requiring repeated interventions within a short period, is a critical arrhythmic emergency demanding aggressive treatment, including antiarrhythmic drugs, catheter ablation, and in some cases, sympathetic blockade, highlighting the importance of prompt therapy to prevent cardiomyopathy. 13. Sinus tachycardia, a common arrhythmic condition where the heart rate exceeds 100 beats per minute, can result from physiological responses to exercise or stress, but requires assessment to exclude underlying cardiac or systemic pathology, with management focusing on treating the root causes, reducing anxiety, and avoiding stimulants. 14. Atrioventricular nodal reentrant tachycardia, AVNRT, is a type of reentrant supraventricular tachycardia that can cause palpitations and lightheadedness, often diagnosed through characteristic ECG findings and effectively managed with the use of adenosine, rate-controlling medications, or radiofrequency catheter ablation for definitive treatment. Atrial flutter, an arrhythmia characterized by a rapid and regular atrial rate, typically presents with a sawtooth pattern on ECG and can lead to rapid ventricular responses, necessitating rate control or rhythm control strategies similar to those used in atrial fibrillation, including electrical cardioversion, antiarrhythmic drugs, and potentially catheter ablation. The Brugada syndrome is an inherited arrhythmic disorder with a distinct ECG pattern predisposing individuals to sudden cardiac death, particularly at rest or during sleep, where risk stratification is critical, and patients may benefit from ICD implantation to prevent life-threatening arrhythmic events despite being often asymptomatic. Junctional rhythm refers to an arrhythmic condition where the heart's electrical activity originates in or near the atrioventricular node, leading to slower heart rates and occasionally retrograde atrial conduction, necessitating evaluation for causes such as digitalis toxicity or intrinsic conduction system disease with management tailored to the underlying etiology. The multifocal atrial tachycardia, typically associated with underlying lung disease or metabolic disturbances, presents as an irregular rhythm with at least 3 different P-wave morphologies on ECG, requiring a multifaceted approach to treatment that includes correction of underlying conditions and the cautious use of rate-controlling agents. Antiarrhythmic drugs play a pivotal role in the management of various arrhythmias, classified into different classes based on their electrophysiological properties, necessitating careful selection and monitoring due to potential proarrhythmic effects and interactions with other medications, emphasizing their use in conjunction with non-pharmacological methods when appropriate. A V-block, or atrioventricular block, is a type of heart block where the electrical conduction between the atria and ventricles is impaired, which can range from first-degree blocks with delayed conduction to third-degree blocks with complete dissociation, requiring pacemaker intervention in symptomatic high-grade blocks to maintain adequate hemodynamic stability. Sick sinus syndrome, involving dysfunction of the sinus node, can result in episodes of bradycardia, sinus arrest, or alternating bradycardia-tachycardia syndrome, with symptomatic patients often requiring the implantation of a permanent pacemaker to alleviate symptoms and improve heart rate responses during daily activities. Catecholaminergic polymorphic ventricular tachycardia is an inherited condition where adrenergic stress can trigger life-threatening arrhythmias in structurally normal hearts, mandating a combination of lifestyle modifications, beta blockers for arrhythmia prevention, and ICDs for high-risk patients to prevent sudden cardiac events during emotional or physical stress. Digoxin, a cardiac glycoside used in the management of certain arrhythmias and heart failure, works by increasing vagal tone and improving heart contractility. However, it demands careful dose adjustment and monitoring to avoid toxicity characterized by gastrointestinal disturbances, visual changes, and potentially life-threatening arrhythmias due to its narrow therapeutic window. Transvenous pacemaker insertion is a standard intervention for symptomatic bradyarrhythmias, involving the placement of pacing electrodes through the venous system to the heart, providing reliable electrical stimulation to correct slow heart rates, with advancements in technology offering options for dual-chamber or even leadless pacemakers tailored to patient-specific needs. 25. Idiopathic ventricular fibrillation refers to VF occurring in the absence of identifiable structural heart disease or known trigger factors, necessitating comprehensive evaluation to exclude reversible causes or genetic predispositions, with ICD therapy often being the cornerstone of prevention against recurrence and sudden cardiac death. 26. The tilt table test is a diagnostic tool used to evaluate unexplained episodes of syncope or presyncope, designed to provoke symptoms through postural changes, allowing assessment of autonomic function and vasoactive responses, with results guiding treatment options like lifestyle changes, medical therapies, or pacemaker implantation, particularly in neurally mediated syncope. 27. Atrial tachycardia, resulting from an abnormal focus of impulse generation outside the sinus node, often appears as regular narrow complex tachycardia on ECG, and management may involve pharmacological agents like calcium channel blockers or beta blockers and consider non-pharmacological approaches like catheter ablation for long-term control. 28. Amiodarone is a broad-spectrum antiarrhythmic agent effective against a wide range of arrhythmias, including atrial fibrillation and ventricular tachycardia, although its use may be limited by side effects such as thyroid dysfunction, pulmonary fibrosis, and liver toxicity, demanding vigilant long-term monitoring and consideration of risk-benefit balance. 29. AVRT, or atrioventricular reciprocating tachycardia, commonly results from an accessory pathway like in Wolff-Parkinson-White syndrome, presenting on ECG with delta waves, and treatment options include vagal maneuvers, pharmacological interventions, or catheter ablation to sever the accessory pathway for definitive resolution of the arrhythmia. 30. The Maze procedure, a surgical intervention for atrial fibrillation, involves creating a series of strategically placed incisions or ablations in the atria to disrupt reentrant circuits and restore sinus rhythm, typically reserved for patients undergoing cardiac surgery. For other indications or those who have failed catheter-based therapies. 31. Beta blockers, often used in the management of various arrhythmias, work by blocking beta-adrenergic receptors, reducing heart rate, and decreasing myocardial oxygen demand, proving effective in rate control for atrial fibrillation and preventing recurrent ventricular arrhythmias, with the selection of specific agents guided by patient comorbidities and cardiovascular risk. 32. Lown-Ganon-Levine syndrome is characterized by a short PR interval without the presence of delta waves on the ECG, resulting from accelerated atrioventricular conduction, with management focusing on symptom alleviation through the use of medications like verapamil or catheter ablation, tailored to individual patient presentation and pathway determination. 3. Electrolyte imbalances, such as hypokalemia and hypomagnesemia, are common reversible causes of arrhythmias, leading to increased cardiac excitability and the risk of ventricular tachyarrhythmias, necessitating prompt correction of deficiencies through oral or intravenous supplementation alongside continuous cardiac monitoring for patients at risk. 34. The physiological basis of reentry arrhythmias, a frequent mechanism in conditions like atrial flutter and ventricular tachycardia, involves the presence of anatomical or functional circuit pathways that allow a reentrant current of electrical activity, perpetuating tachycardia, and is typically managed through targeted ablation therapy to interrupt these circuits. 35. Sinus node dysfunction is often implicated in nocturnal bradycardia, resulting from an interplay of autonomic factors and sleep-disordered breathing, highlighting the importance of assessing for conditions like obstructive sleep apnea which may exacerbate this arrhythmia, with therapeutic approaches including positive airway pressure therapy and pacemaker considerations for persistent symptoms. 36. In atrial fibrillation management, novel oral anticoagulants, NOACs, play a key role in stroke prevention, offering alternatives to traditional warfarin therapy free from frequent INR monitoring, with choices of dabigatran, rivaroxaban, apixaban, or edoxaban being driven by patient renal function, bleeding risks, and individual patient preferences. (37) Familial atrial fibrillation, a heritable form of arrhythmia, highlights the role of genetic predisposition in arrhythmogenesis, necessitating genetic counseling and consideration of vigilance in family members, with treatment strategies paralleling those of sporadic atrial fibrillation, emphasizing the balance of rate versus rhythm control approaches. 38. The implantable cardioverter defibrillator (ICD) remains a cornerstone in preventing sudden cardiac death in high-risk population segments like those with ischemic cardiomyopathy or inherited channelopathies, capable of delivering life-saving shocks or antitachycardia pacing to terminate ventricular tachyarrhythmias and restore sinus rhythm. (39) Premature atrial contractions (PACs). Frequent ectopic beats originating in the atria are usually benign but can serve as a precursor to more significant arrhythmias like atrial fibrillation, with lifestyle modifications being advised if symptomatic and consideration of beta blockers or calcium channel blockers for suppression. (40) The vagal maneuvers, simple physical techniques aimed at stimulating the vagus nerve, can induce reflexive slowing of heart rate, proving advantageous in terminating reentrant arrhythmias like supraventricular tachycardia, and should be included in initial therapeutic instruction for patients at risk of acute episodes alongside medical therapies. (41) QT interval prolongation, an ECG finding indicative of delayed cardiac repolarization, poses a significant arrhythmia risk for developing torsades de pointes, requiring careful evaluation and avoidance of QT prolonging substances, with therapeutic correction focusing on withdrawal of offending agents, electrolyte repletion, or use of specific antiarrhythmics. (42) The Holter monitor, a portable device providing continuous ECG recording over a day or more, plays a vital role in uncovering paroxysmal arrhythmias difficult to detect with standard examinations, guiding diagnosis and therapeutic decisions by correlating symptomatic episodes with underlying cardiac rhythm abnormalities. (43) Dopamine receptor agonists, sometimes involved in the management of Parkinson's disease or prolactinomas, carry the potential for inducing arrhythmic events through disturbance of sympathetic and parasympathetic balance, underscoring the need for baseline cardiac assessment and ongoing ECG monitoring to prevent adverse cardiac outcomes. (44) Accessory pathways in the heart predispose to arrhythmias by allowing electrical impulses to bypass normal conduction, creating scenarios like Wolff-Parkinson-White syndrome, with catheter ablation offering definitive management by selectively destroying the pathway, leading to permanent resolution and prevention of recurrence. (45) Recurrence of atrial fibrillation post-cardioversion is common and often necessitates the use of antiarrhythmic medications for rhythm maintenance, underscoring the need for consideration of rate control, lifestyle interventions, and assessment of secondary causes to sustain sinus rhythm and improve patient quality of life. (46) Ventricular premature beats, VPBs, or extrasystoles are isolated electrical impulses originating in the ventricles, commonly detected on routine ECGs, and while often benign, warrant evaluation for possible underlying heart disease in symptomatic patients or those with frequent VPBs, utilizing treatment strategies like beta blockers if deemed necessary. (47) The electrophysiological study, EPS, serves as a diagnostic tool for elucidating complex arrhythmia mechanisms, guiding therapeutic interventions by mapping cardiac electrical activity, and determining the exact location of aberrant pathways, forming a basis for decisions regarding catheter ablation or device therapy in refractory cases. 48. Respiratory sinus arrhythmia, a benign variation of heart rate with breathing, reflects the normal interaction between the respiratory cycle and the parasympathetic nervous system, often more pronounced in younger individuals and athletes, representing a physiological, non-pathological finding with no need for clinical intervention. (49) QRS widening on ECG signifies impaired conduction through the ventricles, seen commonly in bundle branch blocks, electrolyte imbalances, or drug effects, requiring assessment to determine if chronic or acute changes necessitate further cardiac workup, with specific treatment guided by underlying etiology and associated symptoms. (50) The Has-Bled score is a clinical tool used to estimate bleeding risk in patients with atrial fibrillation undergoing anticoagulation therapy, aiding in individualized risk assessment and optimization of therapeutic strategies, balancing the benefits of stroke mitigation against the potential for major bleeding complications. (1) Ischemic heart disease, primarily caused by atherosclerosis, reduces blood flow to myocardial tissues, often resulting in angina pectoris and increasing the risk of myocardial infarction, thus necessitating prompt clinical intervention to prevent irreversible myocardial damage. 2. Understanding the pathophysiology of ischemic heart disease involves recognizing the complex interplay of endothelial dysfunction, lipid accumulation, inflammation, and thrombosis that ultimately compromises coronary artery blood flow and myocardial perfusion. (3) The diagnostic process for ischemic heart disease involves tools such as electrocardiograms to detect street segment changes, stress tests for evaluating exercise-induced ischemia, and coronary angiography, which provides direct visualization of coronary artery obstruction. (4) Medical management of ischemic heart disease often includes antiplatelet agents like aspirin, which reduce thrombotic events, statins to lower LDL cholesterol and stabilize atherosclerotic plaques, and nitrates to alleviate chest pain by dilating coronary vasculature. (5) Lifestyle modifications, such as smoking cessation, dietary changes to reduce saturated fats, and regular aerobic exercise, play a crucial role in managing ischemic heart disease by mitigating risk factors and supporting cardiovascular health. 6. Coronary artery bypass grafting presents a surgical option for patients with severe ischemic heart disease, creating alternative pathways for blood to reach the myocardium by grafting veins or arteries to bypass occluded coronary vessels. 7. Percutaneous coronary intervention, often involving the placement of a stent, is a minimally invasive procedure that reopens narrowed coronary arteries, restoring adequate blood flow and reducing the incidence of angina in ischemic heart disease patients. (8) Advanced imaging modalities, such as cardiac MRI and CT angiography, provide detailed anatomical and functional assessment of coronary arteries, myocardial tissue, and perfusion deficits, enhancing diagnostic accuracy in ischemic heart disease. (9) Ischemic preconditioning, where brief episodes of ischemia make myocardial tissue more resistant to subsequent ischemic episodes, offers a fascinating area of research with potential therapeutic implications for ischemic heart disease management. 10. The role of inflammation in ischemic heart disease is increasingly recognized, with biomarkers like C-reactive protein serving as indicators of systemic inflammation and potential targets for therapeutic intervention to reduce cardiovascular risk. (11) Despite the predominance of atherosclerosis in ischemic heart disease, coronary microvascular dysfunction also contributes significantly, particularly in women, highlighting the need for gender-specific diagnostic and therapeutic approaches. (12) Silent ischemia presents a diagnostic challenge in ischemic heart disease, as patients exhibit myocardial ischemia without typical anginal symptoms, necessitating vigilance and regular monitoring in high-risk patient populations. (13) Genetic factors contribute to an individual's susceptibility to ischemic heart disease, with polygenic risk scores and family history aiding in risk stratification and personalized preventive strategies tailored to genetic profiles. (14) The phenomenon of coronary artery spasm, wherein transient vasoconstriction leads to ischemic events, underscores the importance of identifying and managing triggers such as stress, cold exposure, and vasoconstrictive drugs in ischemic heart disease. (15) Ischemic heart disease disproportionately affects individuals with comorbid conditions like diabetes mellitus, which accelerates atherosclerosis through mechanisms such as glycation and oxidative stress, necessitating rigorous glycemic control. (16) Heart rate variability analysis provides insights into autonomic dysfunction in ischemic heart disease, where reduced variability signals sympathetic predominance and heightened risk for adverse cardiovascular events. (17) Advances in regenerative medicine, such as stem cell therapy, hold promise for repairing ischemic damage in the heart by regenerating myocardial tissue and improving cardiac function post-myocardial infarction. (18) The role of mental health in ischemic heart disease is gaining attention, with conditions such as depression and anxiety linked to increased cardiovascular risk through stress-related pathophysiological mechanisms like hypercortisolemia. (19) Hyperhomocystinemia, an elevated blood level of homocysteine, is a modifiable risk factor for ischemic heart disease, emphasizing the importance of dietary interventions and supplementation with folic acid and B vitamins for cardiovascular prevention. (20) The potential cardioprotective effects of omega-3 fatty acids in ischemic heart disease are attributed to their anti-inflammatory properties, which help reduce plaque formation, improve endothelial function, and lower triglyceride levels. (21) Remote ischemic conditioning, involving repetitive episodes of limb ischemia to confer organ protection against ischemic injury, represents a novel non-invasive intervention with potential applicability in ischemic heart disease. (22) The use of ambulatory blood pressure monitoring in ischemic heart disease patients provides valuable insights into nocturnal hypertension and blood pressure variability, correlating with cardiovascular outcomes and guiding antihypertensive therapy. (23) Pulmonary hypertension can complicate ischemic heart disease, impairing right ventricular function and exacerbating heart failure symptoms, necessitating vigilant assessment and management of both pulmonary and cardiac components. (24) The phenomenon of hibernating myocardium, where myocardial contractility is reversibly impaired due to chronic ischemia, highlights the importance of revascularization in restoring myocardial function and optimizing heart performance. (25) Cardiac rehabilitation programs, combining supervised exercise, nutritional guidance, and psychological support, enhance recovery and quality of life for ischemic heart disease patients, reducing recurrent cardiovascular events. (26) The endothelial glycocalyx, a protective layer lining blood vessels, plays a crucial role in maintaining vascular health, and its disruption in ischemic heart disease contributes to atherogenesis and endothelial dysfunction. (27) Myocardial stunning refers to the transient post-ischemic dysfunction of myocardial tissue, despite restored blood flow, necessitating careful differential diagnosis from irreversible myocardial damage in ischemic heart disease cases. 28. The gut-heart axis explores the interplay between gut microbiota and cardiovascular health, where dysbiosis may contribute to ischemic heart disease via inflammatory pathways and microbial metabolites such as TMAO. '29. Identifying and managing obstructive sleep apnea is essential in ischemic heart disease, as untreated apnea exacerbates hypertension, sympathetic activation, and inflammation, further elevating cardiovascular risk. 30. Antianginal medications like beta blockers and calcium channel blockers not only alleviate ischemic symptoms but also provide prognostic benefits by reducing myocardial oxygen demand and preventing arrhythmias. '31. Utilization of dual antiplatelet therapy, particularly after percutaneous coronary intervention, is critical in ischemic heart disease to prevent stent thrombosis and ensure sustained patency of revascularized vessels. '32. Oxidative stress, characterized by an imbalance between reactive oxygen species and antioxidants, accelerates atherosclerosis and endothelial dysfunction in ischemic heart disease, supporting the exploration of antioxidant therapies. '33. Early intervention with fibrinolytic therapy in acute myocardial infarction, particularly in settings without percutaneous coronary intervention availability, saves myocardium by rapidly dissolving thrombi, restoring coronary perfusion. '34. Cardiac troponin levels serve as a pivotal biomarker in diagnosing acute coronary syndromes, with high-sensitivity assays providing early detection and risk stratification in ischemic heart disease emergencies. '35. Systemic lupus erythematosus and other autoimmune conditions increase ischemic heart disease risk due to accelerated atherosclerosis linked to chronic inflammation, necessitating vigilant cardiovascular monitoring in autoimmune populations. '36. The concept of residual inflammatory risk in ischemic heart disease, despite optimal lipid management, highlights the ongoing quest for therapies targeting persistent inflammation in plaque stabilization and event reduction. '37. Platelet hyperreactivity in ischemic heart disease contributes to thrombotic complications, with pharmacogenomics guiding personalized antiplatelet strategies to prevent adverse outcomes and optimize dual antiplatelet therapy. '38. The interplay between hypercoagulability and ischemic heart disease necessitates consideration of anticoagulant therapy, especially in patients with concomitant atrial fibrillation, to balance thrombosis prevention with bleeding risk. '39. Investigating the impact of systemic nitric oxide availability in ischemic heart disease reveals its crucial role in vasodilation and endothelial function, with therapeutic implications for enhancing nitric oxide pathways. '40. The metabolic syndrome synergistically amplifies ischemic heart disease risk through interconnected components like abdominal obesity, insulin resistance, dyslipidemia, and hypertension, requiring a comprehensive approach to management. '41. Emerging research on the Klotho protein suggests a protective role against cardiovascular aging and ischemic heart disease, highlighting potential therapeutic avenues for promoting longevity and vascular health. '42. Heat shock proteins, induced by stressors, serve protective roles in myocardial cells by preventing protein aggregation and enhancing survival pathways during ischemic events, with potential therapeutic exploitation in cardioprotection. '43. Chronic kidney disease exacerbates ischemic heart disease through mechanisms such as hypertension, mineral metabolism disturbances, and uremic toxins, necessitating joint nephrological and cardiovascular management strategies. 44. Advances in nanotechnology aim to revolutionize ischemic heart disease treatment through targeted drug delivery systems, enhancing therapeutic efficacy and minimizing off-target effects in the cardiovascular system. '45. The association between migraines and ischemic heart disease underscores shared pathophysiological pathways like endothelial dysfunction, auguring the need for integrated care in patients presenting with both conditions. '46. Exploring proteomics in ischemic heart disease can unveil novel biomarkers and therapeutic targets, offering insights into disease mechanisms and individualized treatment approaches tailored to proteomic profiles. '47. Cardiac amyloidosis complicates ischemic heart disease by infiltrating and stiffening myocardial tissue, posing diagnostic and therapeutic challenges in distinguishing from primary ischemic cardiomyopathies. '48. Transthoracic echocardiography remains a non-invasive cornerstone in assessing cardiac structure and function in ischemic heart disease, aiding in evaluation of ventricular size, wall motion abnormalities, and ejection fraction. '49. The promise of gene editing technologies, such as CRISPR-Cas9, beckons an era of precision medicine for ischemic heart disease, potentially correcting genetic predispositions and ushering tailored therapeutic interventions. '50. Understanding the circadian patterns of ischemic heart disease events, where peak incidence occurs in the morning, informs timing of medication administration and lifestyle modifications to align with biological rhythms for optimal outcomes. '1. Brain tumors, particularly gliomas, can disrupt the blood-brain barrier, altering its permeability and potentially making the brain environment more susceptible to the influx of macromolecules and peripheral inflammatory cells, which can exacerbate cerebral edema and influence the tumor's microenvironment, requiring tailored therapeutic strategies to manage these effects alongside the primary treatment. '2. The distinction between primary and secondary brain tumors is critical, as primary brain tumors originate within the brain itself and may include glioblastomas or meningiomas, while secondary brain tumors, or brain metastasis, result from cancer spreading from another part of the body, such as the lungs, emphasizing the need for comprehensive systemic cancer management. '3. Advances in neuroimaging, including functional MRI and PET scans, enable not only the precise localization of brain tumors but also the assessment of tumor metabolism and potential malignancy, thereby refining preoperative planning and post-treatment monitoring, which enhances surgical outcomes and minimizes damage to critical brain areas. '4. The application of precision medicine in the treatment of brain tumors involves utilizing genetic and molecular profiling of tumors, which allows clinicians to tailor therapies based on specific mutations, such as IDH1 and IDH2 in gliomas, potentially improving response rates and minimizing unnecessary exposure to broader chemotherapeutic agents. '5. Tumor Treating Fields, TT fields, are an innovative non-invasive treatment modality for glioblastoma that employs alternating electric fields to disrupt cancer cell division by targeting the meiotic spindle, offering an additional therapeutic option that can be combined with surgery, radiation, and chemotherapy for comprehensive multimodal treatment. '6. The role of the tumor microenvironment in brain tumor pathophysiology is significant, with components such as hypoxia, immune cell infiltration, and extracellular matrix modulation influencing tumor growth, angiogenesis, and resistance to therapy, making it a focal area for developing novel therapeutic agents that can alter these pathways. '7. The utilization of stereotactic radiosurgery, SRS, such as Gamma Knife or CyberKnife, provides a highly precise irradiation method that delivers concentrated doses to brain tumors while sparing surrounding healthy tissue, making it particularly beneficial for small to medium-sized tumors or those located in surgically challenging areas. 8. Brain tumors can cause neurocognitive deficits, including memory impairment and executive dysfunction, due to direct neural disruption and indirect effects of treatments such as radiation and chemotherapy, necessitating cognitive evaluations and rehabilitation programs as integral components of comprehensive patient management. 9. The growing field of oncolytic virotherapy explores the use of genetically engineered viruses to selectively infect and kill brain tumor cells while sparing healthy cells, combining direct oncolytic effects with immune-mediated tumor suppression, holding promise as a novel approach especially in immunoresponsive tumors. Dexamethasone is commonly utilized in brain tumor management to reduce vasogenic edema and improve neurological symptoms by decreasing capillary permeability and stabilizing the blood-brain barrier, yet its long-term use requires careful monitoring for side effects such as hyperglycemia and immunosuppression. Bevacizumab, an anti-angiogenic monoclonal antibody targeting vascular endothelial growth factor, VEGF, is utilized in recurrent glioblastoma to hinder abnormal blood vessel formation, thereby reducing tumor vascularity and edema, although its use requires consideration of potential adverse effects and the development of resistance. Neuro-oncology has witnessed the promising advancement of immunotherapy, including checkpoint inhibitors and CAR T-cell therapies, that harness the body's immune system to recognize and eradicate tumor cells, although challenges remain in overcoming the immunosuppressive environment inherent to brain tumors. The integration of artificial intelligence in brain tumor diagnosis allows for the automation and enhancement of imaging interpretation through machine learning algorithms, improving accuracy and consistency in identifying tumor characteristics, predicting outcomes, and aiding in the early detection of subtle tumor changes. Enhancing the delivery of chemotherapeutic agents in brain tumor therapy involves various strategies, such as the development of nanoparticles and liposomal formulations, which can cross the blood-brain barrier more effectively, increase drug concentrations at the tumor site, and reduce systemic toxicity. In molecular pathology, the detection of 1p19q co-deletion in oligodendrogliomas not only serves as an essential diagnostic marker distinguishing them from other types but also indicates a favorable response to chemotherapy, highlighting the necessity of genetic testing in establishing a precise diagnosis and treatment plan. Diffusion tensor imaging, DTI, is a specialized MRI technique that enables visualization and mapping of white matter tracts in the brain, assisting neurosurgeons in assessing tumor infiltration and preserving vital neural pathways during surgical resection, thus optimizing functional outcomes for patients. Chordomas, rare malignant tumors arising from embryonic notochord remnants, predominantly occur at the skull base or spinal column and require meticulous surgical excision, often followed by proton beam therapy for radiation-sensitive tissues, underscoring the need for specialized multidisciplinary care. Seizures are commonly associated symptoms in patients with brain tumors due to epileptogenic changes within the cerebral cortex, often managed with anti-epileptic drugs such as levetiracetam, although careful titration and monitoring are necessary to avoid adverse effects and interactions with other cancer therapies. The discovery of EGFR mutations and amplifications in certain glioblastomas has opened avenues for targeted therapies using tyrosine kinase inhibitors, although resistance mechanisms and heterogeneity within tumors present ongoing challenges that require the development of combination therapeutic strategies. 20. The blood-brain barrier, BBB, poses a significant obstacle in the delivery of effective chemotherapy for brain tumors, prompting research into methods to transiently and safely disrupt the BBB using focused ultrasound or osmotic agents without compromising the protection it affords the central nervous system. 21. Understanding the progression of brain tumors from low-grade to high-grade malignancies is crucial, as it often involves distinct molecular pathways and genetic alterations, necessitating vigilant monitoring and potential intervention to halt or delay malignant transformation and improve long-term outcomes. 22. Integrating palliative care early in the treatment of brain tumors focuses on optimizing quality of life by addressing symptoms, psychosocial support, and patient and family education, ensuring that holistic care is provided alongside curative or life-prolonging treatments for a balanced approach to the disease. 23. Tumor heterogeneity within brain tumors contributes to variable responses to treatment and recurrence rates, emphasizing the importance of obtaining tissue biopsies from multiple tumor areas and employing comprehensive genomic profiling to guide personalized therapeutic interventions effectively. 24. The incidence of pituitary adenoma, generally benign tumors, can lead to hormonal imbalances and pressure effects on nearby structures such as the optic chiasm, requiring a combination of endocrinological management and surgical intervention via transsphenoidal resection when indicated. 25. Optic gliomas, associated with neurofibromatosis type 1, can lead to progressive visual loss in children and are managed through a combination of observation, chemotherapy, and in some cases, radiation therapy, with ongoing research into targeted molecular treatments aimed at preserving vision and stabilizing tumor growth. 26. Recognizing the signs and symptoms of increased intracranial pressure, such as headache, nausea, and papilledema, is vital in patients with brain tumors, prompting immediate intervention with measures like shunt placement or craniotomy to relieve pressure and prevent further neurological deterioration. 27. Novel techniques in intraoperative visualization and navigation, such as intraoperative MRI and fluorescence-guided surgery using 5-ALA, have enhanced the precision of tumor resection, allowing surgeons to distinguish neoplastic tissue more reliably, thereby improving surgical margins and patient outcomes. 28. Studying the role of microRNAs in brain tumor biology has unveiled their functions in regulating gene expression, tumor growth, and metastasis, paving the way for therapeutic targeting of these small non-coding RNAs to disrupt oncogenic pathways and improve the efficacy of existing treatments. 29. The exploration of epigenetic modifications, such as DNA methylation and histone acetylation, in brain tumors has revealed their influence on gene expression and tumor behavior, leading to the potential for developing epigenetic drugs that can reverse aberrant changes and restore normal cellular functions. 30. The prognostic significance of MGMT promoter methylation in glioblastoma lies in its correlation with improved response to alkylating agents like temozolomide, offering insight into personalized treatment planning and highlighting the critical role of molecular profiling in guiding therapeutic decisions. 31. Cerebellar tumors, such as medulloblastomas, primarily affecting children, can disrupt coordination and balance, requiring a combination of surgical resection, craniospinal irradiation, and chemotherapy, with ongoing research into molecular subtyping aiming to optimize treatment strategies and reduce long-term side effects. 32. Unveiling the potential of chimeric antigen receptor, CAR T-cell therapy for targeting specific antigens expressed on brain tumors represents a promising frontier, but challenges remain in ensuring T-cell penetration into the central nervous system and sustaining durable responses in patients. 3. Assessment of tumor-associated epilepsy in brain tumor patients involves distinguishing between seizure types and understanding the complex relationship between epileptogenic networks and tumor pathology, highlighting the necessity for individualized anti-epileptic regimens and neurosurgical consultation when refractory seizures persist. 34. Recognizing the role of neuroinflammation in the progression and treatment resistance of brain tumors opens avenues for therapeutic targeting of inflammatory pathways, with agents such as COX-2 inhibitors and immune modulators being explored for potential anti-tumor efficacy and symptom relief. 35. Pseudoprogression in brain tumor imaging, often seen after radiation therapy and characterized by transient inflammatory changes rather than true tumor growth, poses diagnostic challenges requiring differentiation from actual progression through serial imaging studies and potentially utilizing advanced metabolic imaging techniques. 36. Ethical considerations in brain tumor clinical trials encompass informed consent, balancing innovation with patient safety, and equitable access to experimental treatments, necessitating robust ethical frameworks and communication strategies to ensure patients and families make informed decisions regarding participation. 37. Managing the neurocognitive side effects of radiation therapy for brain tumors involves implementing strategies such as hippocampal sparing techniques, cognitive rehabilitation, and pharmacological interventions aimed at reducing the risk of long-term intellectual impairment and ensuring sustained quality of life. 38. The potential use of ketogenic diets in brain tumor management explores the hypothesis that reducing glucose availability may affect tumor metabolism and growth, although this requires rigorous clinical investigation to verify efficacy and ensure safety in combination with standard oncological treatments. 39. Glioma stem cells are implicated in tumor recurrence and resistance to therapy, highlighting the importance of targeting these cells specifically with treatments that can impede their self-renewal and differentiation capabilities, thereby improving long-term control and patient prognosis. 40. The exploration of biomarkers, such as circulating tumor DNA, ctDNA, in the blood of brain tumor patients, offers a non-invasive method for monitoring disease status, treatment response, and early detection of relapse, providing a valuable tool for precision medicine approaches in neuro-oncology. 41. Neurofibromatosis type 2, NF2, is characterized by the development of multiple nervous system tumors, including schwannomas and meningiomas, requiring vigilant surveillance and, when necessary, intervention with surgery or newer medical therapies such as VEGF inhibitors to manage tumor growth and maintain neurological function. 42. Differentiating between tumor recurrence and radiation necrosis in brain cancer patients involves evaluating clinical presentation and employing advanced imaging modalities such as perfusion MRI or PET scans, aiding in determining the appropriate management pathway and avoiding unnecessary interventions. 43. Innovative surgical techniques in skull-based tumor resection, utilizing endoscopic approaches, allow for minimally invasive access to complex regions while reducing patient morbidity, emphasizing the critical role of specialized multidisciplinary teams in achieving optimal surgical outcomes and preserving neurological function. 44. The neuropeptide Y, NPY, receptor system has been implicated in brain tumor growth and angiogenesis, presenting a potential target for therapeutic intervention with antagonists designed to disrupt these pathways and complement existing treatments aimed at brain tumor control. 45. Olfactory neuroblastomas, originating in the nasal cavity extending into the brain, demand a multidisciplinary approach involving surgery, radiation, and sometimes chemotherapy, highlighting the complexities and importance of specialized care in managing these rare and challenging tumors. 46. Understanding the epidemiology and risk factors associated with brain tumors, including genetic predispositions and environmental exposures, provides essential insights for public health strategies aimed at early detection, prevention, and improved patient education on potential risks and symptoms. 47. The intricate relationship between neural stem cells and brain tumor development suggests potential strategies for therapeutic targeting, as alterations in stem cell regulatory pathways may contribute to tumorigenicity, requiring an understanding of stem cell biology in the context of oncogenesis and therapy. 48. Intracranial germ cell tumors, though rare, often present in pediatric patients and typically respond well to chemotherapy and radiation, depending on the type and location, underscoring the need for age-appropriate treatment protocols and long-term follow-up to monitor for potential late effects. 49. The role of metabolic reprogramming in brain tumor cells includes alterations in glucose and lipid metabolism to support rapid growth and survival, providing a potential target for novel therapies aimed at disrupting these pathways to reduce tumor proliferation and enhance treatment efficacy. 50. Exploring the potential of biodegradable polymer implants delivering localized chemotherapy directly to the site of brain tumor resection offers a method to maximize drug delivery while minimizing systemic toxicity, demonstrating a novel approach in the quest to improve patient outcomes and quality of life post-surgery. 1. Chronic obstructive pulmonary disease, COPD, is a progressive inflammatory lung disease characterized by obstructed airflow from the lungs due to emphysema and chronic bronchitis, which makes it a significant cause of morbidity and mortality worldwide, with smoking identified as the primary risk factor but also including genetic predispositions such as alpha-1 antitrypsin deficiency. 2. In COPD, the small airways become narrowed and the alveolar walls are destroyed, a phenomenon known as emphysema, which traps air during expiration and leads to hyperinflation of the lungs, making it hard for the patient to exhale completely, causing chronic airflow limitation and dramatically impairing quality of life. 3. COPD diagnosis is confirmed through spirometry, which measures the forced expiratory volume in 1 second, FEV1, and the forced vital capacity, FVC, resulting in a reduced FEV1-FVC ratio that is not significantly reversible with bronchodilators, indicating a persistent obstructive pattern. 4. The hallmark symptoms of COPD include chronic and progressive dyspnea, persistent cough often with sputum production, and wheezing, with exacerbations characterized by an increase in symptom intensity, often triggered by infections or environmental pollutants, thereby significantly impacting patient well-being. 5. Long-term exposure to noxious gases and particulate matter, primarily from cigarette smoke and occupational exposure to dust and chemicals, accounts for the majority of COPD cases, but recent research is exploring the role of indoor air pollution from biomass fuels used in cooking and heating, especially in developing countries. 6. Pulmonary rehabilitation is a cornerstone in the management of COPD, comprising of exercise training, education, and psychological support, which aims to improve the physical and emotional condition of people with respiratory diseases and empower them to better manage their symptoms. 7. Pharmacological treatments for COPD focus on relieving symptoms and preventing exacerbations, with bronchodilators like long-acting beta-agonists, LABAs, and long-acting muscarinic antagonists, LAMAs, being first-line therapies, often used in combination to maximize dilation of airways and improve lung function. 8. In COPD, systemic corticosteroids are used during acute exacerbations to reduce inflammation and improve lung function, although chronic use is limited due to potential side effects, so maintenance therapy often involves inhaled corticosteroids in conjunction with bronchodilators for patients with frequent exacerbations. 9. Emerging treatments for COPD include the use of phosphodiesterase 4 inhibitors such as roflumilast, which works by reducing inflammation in the airways and has been shown to decrease the frequency of exacerbations in patients with severe COPD and chronic bronchitis. 10. In COPD pathophysiology, the process of oxidative stress plays a pivotal role wherein the imbalance between oxidants and antioxidants within the lungs leads to tissue damage, ongoing inflammation, and further degradation of lung function, reinforcing the progression of the disease. 11. The destruction of elastic fibers in the alveolar walls in COPD is largely mediated by enzyme systems such as matrix metalloproteinases (MMPs) and neutrophil elastase, which become overactive due to chronic inflammation and contribute to the loss of lung elasticity and alveolar integrity. 12. Genetic factors in COPD play a crucial role, with the most well-documented being the deficiency of alpha-1 antitrypsin, a protein that protects lung tissue from enzyme-induced damage, and individuals with severe deficiency are at a much higher risk of developing COPD regardless of smoking status. 13. Imaging studies such as chest X-rays and computed tomography (CT) scans are used in COPD to assess for evidence of hyperinflation, increased lung volume, and possible complications like pneumothorax, with CT scans providing greater detail in visualizing emphysematous changes and bulli in the lungs. 14. The chronic inflammation in COPD is predominantly neutrophilic, contrasting with the eosinophilic inflammation commonly seen in asthma, which results in different pathophysiological mechanisms and therapeutic responses, highlighting the intricate immune dysregulation present in COPD. 15. Comorbidities frequently associated with COPD include cardiovascular diseases, osteoporosis, metabolic syndrome, anxiety, and depression, all of which severely affect the health status and quality of life of patients, warranting a comprehensive and multidisciplinary approach to management. 16. The Global Initiative for Chronic Obstructive Lung Disease (GOLD) guidelines provide a framework for the diagnosis, management, and prevention of COPD by categorizing the disease based on the severity of airflow limitation, symptom burden, and frequency of exacerbations, offering a personalized approach to treatment. 17. Oxygen therapy is a life-saving intervention for COPD patients with chronic respiratory failure, particularly those with resting hypoxemia, as it improves survival by preventing the harmful effects of chronic hypoxia and relieving some of the physiological stress on the cardiovascular system. 18. Smoking cessation remains the most effective strategy in slowing the progression of COPD, and nicotine replacement therapy, varenicline, and bupropion have been shown in clinical trials to increase the rates of sustained abstinence from smoking, thereby preserving lung function and improving long-term outcomes. 19. Lung volume reduction surgery, LVRS, can be considered for selected patients with severe emphysema-dominant COPD, as it reduces hyperinflation and improves lung mechanics, leading to better respiratory function and quality of life, although careful patient selection is crucial due to the associated surgical risks. 20. The impact of air pollution on COPD exacerbations is significant, with exposure to pollutants such as nitrogen dioxide, sulfur dioxide, and particulate matter leading to increased hospital admissions and mortality rates among COPD patients, emphasizing the importance of improving air quality through public health initiatives. 21. The use of non-invasive ventilation, NIV, during acute COPD exacerbations with hypercapnic respiratory failure can significantly reduce the need for intubation, improve gas exchange, and decrease mortality, making it an essential tool in the acute management of severe exacerbations. 22. Patients with COPD often experience muscle wasting and weakness, particularly in the lower limbs, which is attributed to a combination of systemic inflammation, inactivity, altered muscle metabolism, and nutritional deficits, necessitating targeted interventions such as strength training and nutritional support. 23. Advanced COPD often leads to pulmonary hypertension due to chronic hypoxic vasoconstriction, which results in remodeling of the pulmonary vasculature and increased pressure in the pulmonary arteries, eventually leading to right-sided heart failure or cor pulmonale. 24. In the progression of COPD, the concept of the phenotypic approach is gaining traction, recognizing that patients might have differing prevalent symptoms and pathophysiological characteristics, such as asthma-COPD overlap, ACO, which requires specific diagnostic and therapeutic strategies. 25. Exacerbation prevention in COPD relies heavily on vaccination, with annual influenza vaccination and pneumococcal vaccines being recommended as they significantly reduce hospitalization rates and improve survival by protecting against respiratory infections that can precipitate exacerbations. 26. In COPD, the mucus hypersecretion seen in chronic bronchitis results from an overproduction of mucus by enlarged goblet cells and submucosal glands in response to chronic irritation and inflammation, which contributes to airway obstruction and chronic cough in affected individuals. 27. Regular physical activity is associated with improved exercise tolerance and quality of life in people with COPD, as well as reduced risk of hospital readmissions after exacerbations, underscoring the importance of incorporating physical activity into the routine management plan for these patients. 28. Bronchoscopic lung volume reduction is a minimally invasive alternative to surgical interventions in COPD, using devices such as endobronchial valves to occlude airways in targeted areas of emphysematous lungs, achieving volume reduction and improved ventilatory efficiency. 29. Hospital-at-home programs for managing COPD exacerbations have shown to be as effective as hospital care in appropriately selected patients, providing benefits such as reduced healthcare costs, improved patient satisfaction, and a lower risk of acquiring hospital-associated infections. 30. Digital health technologies, including telemedicine, remote monitoring, and wearable devices, are increasingly being integrated into the management of COPD, offering opportunities for continuous monitoring of physiological parameters, patient education, and timely intervention, potentially reducing exacerbation rates. 31. The role of long-term antibiotics in preventing COPD exacerbations is being explored through the use of agents such as macrolides, which have anti-inflammatory properties and have been shown to reduce exacerbation frequency in certain patients with frequent and severe exacerbations. 32. Dysregulated repair mechanisms in COPD lead to structural changes in the airways and alveoli, including airway wall thickening and fibrosis, which contribute to the disease's chronic and progressive nature, highlighting the need for therapies targeting these underlying pathological processes. 3. Recognition of the single nucleotide polymorphisms, SNPs, associated with COPD susceptibility has opened the door to personalized medicine approaches and could lead to tailored preventive and therapeutic strategies specific to individual genetic profiles in the future. 34. COPD profoundly affects the systemic circulation, leading to extrapulmonary manifestations such as atherosclerosis and an increased risk of cardiovascular events, mediated by systemic inflammation, oxidative stress, and alterations in lipid metabolism, requiring cardiovascular risk assessment in COPD management. 35. Bacterial colonization of the lower airways is common in COPD due to compromised host defenses, contributing to chronic inflammation and exacerbations, with common colonizers including Haemophilus influenzae, Streptococcus pneumoniae, and Moraxella catarrhalis. 36. Cognitive impairment, including deficits in attention, memory, and executive function, has been observed in patients with COPD, possibly due to chronic hypoxia, systemic inflammation, and the presence of comorbid depression, impacting daily functioning and quality of life. '37. The economic burden of COPD is substantial, with direct costs related to medical visits, hospitalizations, and medications, while indirect costs arise from lost productivity and premature mortality, making it imperative to implement cost-effective preventive and management strategies. 38. Mitochondrial dysfunction is implicated in COPD pathogenesis, where oxidative stress and inflammation lead to impaired energy metabolism and cell death in pulmonary tissues, suggesting potential therapeutic targets focusing on mitochondrial health to slow disease progression. 39. In COPD, breathlessness is exacerbated by dynamic hyperinflation, where the increased end expiratory lung volume due to expiratory flow limitation and gas trapping during physical activity leads to increased respiratory workload and early onset of dyspnea. 40. The use of biomarkers in COPD, such as blood eosinophil counts and exhaled nitric oxide levels, is being researched to better stratify patients in personalized therapy, as they may help predict response to inhaled corticosteroids and other targeted treatments. 41. The development of fibrosis in the small airways in COPD contributes to fixed airflow obstruction, complicating the disease and limiting reversibility with bronchodilators, as the fibrotic tissue causes airway narrowing and impaired ventilation. 42. COPD complications include pneumothorax, particularly in patients with emphysema, where ruptured lung bulli can lead to air escaping into the pleural space, causing the lung to collapse and necessitating emergency medical intervention. 43. End-stage COPD may require considerations for lung transplantation in eligible patients when medical therapies fail to provide sufficient symptomatic relief, with indicators for transplantation including severe airflow obstruction, hypercapnia, and frequent exacerbations despite maximal treatment. 44. Anxiety and panic attacks are prevalent in COPD patients, often exacerbated by breathlessness, leading to a vicious cycle of avoidance, deconditioning, and worsening symptoms that necessitates psychological interventions alongside pulmonary rehabilitation. 45. The heterogeneity of COPD is reflected in various phenotypes characterized by differing emphysema and bronchitis components, smoking history, and genetic factors, necessitating individualized treatment plans that cater to the specificities of each patient's disease presentation. 46. The use of statins in COPD patients is being investigated for their potential to reduce inflammation and improve outcomes beyond their lipid-lowering effects, as observational studies have suggested a possible reduction in all-cause mortality and exacerbations. 47. Sleep disturbances are common in COPD, with studies indicating increased occurrence of insomnia, nocturnal hypoxia, restless leg syndrome, and sleep apnea, further contributing to impaired daytime functioning and required specialized management to improve sleep quality. 48. The relationship between COPD and malnutrition is complex, as the increased work of breathing, systemic inflammation, and metabolic changes can lead to weight loss and muscle wasting, highlighting the need for nutritional assessment and intervention as part of comprehensive COPD care. 49. The role of endothelin in COPD is being explored, with increased levels associated with vascular remodeling and pulmonary hypertension in COPD patients, representing a potential therapeutic target to address cardiovascular complications associated with the disease. Bronchiectasis can coexist with COPD, particularly in those with recurrent infections and mucus hypersecretion, characterized by permanent dilation and thickening of the bronchi, necessitating specific management strategies to address the overlapping disease presentations and optimize patient outcomes. 1. Non-alcoholic fatty liver disease, NAFLD. The hepatic manifestation of metabolic syndrome is characterized by excessive fat accumulation in liver cells, often due to insulin resistance, and is the most common cause of chronic liver disease worldwide, affecting nearly 1 billion individuals and potentially leading to more severe liver conditions such as non-alcoholic steatohepatitis, NASH, fibrosis, cirrhosis, or hepatocellular carcinoma if left unchecked over the years. Two. The pathophysiology of fatty liver disease involves a two-hit hypothesis where the first hit is the accumulation of triglycerides in the hepatocytes, creating a state vulnerable to lipotoxicity, and the second hit involves oxidative stress, cytokines, and mitochondrial dysfunction that progress hepatic inflammation and fibrosis, emphasizing the complexity and multifactorial nature of this condition. 3. Magnetic resonance imaging, MRI, proton density fat fraction, PDFF, is emerging as a non-invasive gold standard for quantifying hepatic steatosis in NAFLD, providing a comprehensive assessment of liver fat content that is more precise than ultrasound and CT and lacking the invasiveness and risks associated with liver biopsy, thus contributing to better disease management and monitoring of therapeutic responses. 4. The primary treatment approach for non-alcoholic fatty liver disease focuses on lifestyle interventions, primarily weight loss through dietary modifications and increased physical activity, with evidence showing that a modest reduction of 5 to 10% in body weight can significantly reduce liver fat, ameliorate inflammation and fibrosis, and improve overall liver function, often reversing fatty liver changes. 5. The use of vitamin E as a therapeutic agent in non-alcoholic steatohepatitis has gained traction due to its antioxidant properties, with studies demonstrating that high-dose vitamin E supplementation can improve liver histology, reduce hepatic inflammation, and increase indices of liver function in non-diabetic NASH patients, although caution is advised regarding long-term use and potential cardiovascular risks. 6. In NAFLD, the liver enzyme alanine aminotransferase, ALT, is often elevated. However, normal ALT levels do not exclude the presence of significant liver damage, emphasizing the importance of considering a full panel of liver function tests alongside imaging techniques and histological assessment when diagnosing and monitoring this stealthy and often silent hepatic condition. 7. Advances in our understanding of gut-liver axis dysregulation in NAFLD have highlighted the role of dysbiosis and intestinal permeability in promoting hepatic fat accumulation and inflammation, pointing to the therapeutic potential of probiotics, prebiotics, and fecal microbiota transplantation in modulating gut microbiota composition and function as a novel avenue for treatment. 8. Insulin resistance is a crucial player in the pathogenesis of non-alcoholic fatty liver disease, where excessive lipolysis and increased free fatty acid influx into the liver, driven by hyperinsulinemia, play a pivotal role in hepatic fat deposition, reinforcing the interconnectivity between metabolic disturbances and liver health, and supporting the utilization of insulin-sensitizing agents like metformin in some patient populations. 9. Hepatocyte apoptosis, mediated by pathways involving endoplasmic reticulum stress and death receptor activation, is a significant contributor to liver injury and progression in NAFLD, suggesting that agents targeting these apoptotic pathways could offer novel therapeutic benefits by interrupting this self-perpetuating cycle of liver cell death and fibrogenesis. 10. Detection of genetic polymorphisms such as in the PNPLA3 gene highlights a genetic predisposition that significantly influences individual susceptibility to fatty liver disease in its progression, thus directing research towards personalized medicine approaches where genetic screening could inform risk assessment, prognosis, and tailored therapeutic strategies. Bariatric surgery, particularly Roux-en-Y gastric bypass, has emerged as a highly effective treatment for morbidly obese patients with NAFLD, resulting in substantial and sustained weight loss, resolution of hepatic steatosis, and regression of fibrosis, positioning it as a viable option in severe cases where conservative management has failed and the risk of progression is high. The mitochondrial dysfunction observed in NAFLD stems from impaired oxidative phosphorylation and an increase in reactive oxygen species, which contribute to steatosis, cellular damage, and fibrosis, indicating a potential therapeutic role for agents aimed at enhancing mitochondrial function and protecting against oxidative stress in the treatment landscape. Obstructive sleep apnea, OSA, has been identified as a contributing factor to the progression of NAFLD through mechanisms involving intermittent hypoxia and sympathetic activation, making the treatment of OSA with continuous positive airway pressure, CPAP, a potentially beneficial adjunct in slowing disease progression and improving liver health. Although traditionally associated with alcohol, steatohepatitis can develop in non-drinkers who consume excessive fructose, which is metabolized in the liver, resulting in de novo lipogenesis and increased triglyceride synthesis, underlining the impact of dietary choices on liver health and the importance of reducing fructose intake for NAFLD patients. The concept of metabolic-associated fatty liver disease, MAFLD, has been proposed to more accurately reflect the metabolic underpinnings and multisystem involvement of fatty liver disease, emphasizing the transition towards a diagnostic approach that integrates metabolic risk factors, allowing for better stratification and management in clinical practice. Emerging evidence suggests that certain medications, such as statins and SGLT2 inhibitors, not only manage associated metabolic conditions but also provide ancillary benefits for liver health, including reductions in liver fat and fibrosis, showcasing the potential of repurposing existing cardiometabolic medications to tackle the hepatic sequelae of metabolic syndrome. Choline, an essential nutrient found in eggs, meat, and fish, plays an important role in preventing liver steatosis by assisting in lipoprotein assembly and VLDL secretion, reinforcing the nutritional importance of adequate choline intake and the potential consequences of deficiency in exacerbating fatty liver conditions. Hepatic macrophages, or Kupffer cells, are key drivers of inflammation in fatty liver disease through the production of pro-inflammatory cytokines, which contribute to the exacerbation of liver injury and fibrosis. Thus, modulating the activity of these immune cells represents a promising therapeutic avenue to mitigate liver inflammation and progression. Ethnic variations in the prevalence and severity of NAFLD suggest that genetic, lifestyle, and environmental factors intersect to influence disease distribution, with studies demonstrating higher susceptibility among Hispanic individuals, highlighting the need for culturally tailored interventions and awareness campaigns that address specific risks and misconceptions. Omega-3 fatty acids, abundant in fish oils, have been shown to reduce liver fat, inflammation, and triglyceride levels, indicating their potential as a supportive therapy in NAFLD management, especially for individuals who may not respond adequately to lifestyle changes alone, and underscoring the importance of dietary management in liver health. The endocannabinoid system is increasingly recognized as a crucial modulator of hepatic energy storage, inflammation, and fibrosis in NAFLD, thus emerging as a potential target for treatment. cannabinoid receptor antagonists, despite controversy, offer exciting possibilities for intervening in this pathway and controlling disease progression. 22. The presence of liver fibrosis in NAFLD significantly increases the risk of adverse outcomes, making fibrosis staging vital in risk stratification and management decisions, with non-invasive biomarkers and elastography techniques offering reliable alternatives to liver biopsy, providing accessible and safer methods for assessing fibrosis risk. 23. Identifying and managing comorbid conditions such as type 2 diabetes, hypertension, and dyslipidemia is crucial in NAFLD management, as these conditions share underlying pathophysiological links with liver disease and can exacerbate NAFLD progression, necessitating a comprehensive and multidisciplinary approach for optimal outcomes. 24. Alcoholic fatty liver disease and non-alcoholic fatty liver disease share similar histological features, making clinical distinction based on history and risk factors essential for diagnosis, with alcohol abstinence serving as a critical and effective intervention for those with alcohol-related liver disease, whereas lifestyle changes remain foundational for NAFLD. 25. Given the silent nature of early-stage NAFLD, routine screening for fatty liver in patients with obesity, metabolic syndrome, or type 2 diabetes is recommended to facilitate early diagnosis and intervention, underscoring the importance of awareness and vigilance in primary care and the potential benefit of periodic liver assessments in at-risk populations. 26. Leptin resistance, often noted in individuals with obesity, contributes to steatosis by impairing the regulation of appetite and energy expenditure and promoting pro-inflammatory cytokines that exacerbate liver inflammation and fibrosis, presenting a target for novel therapies aimed at restoring leptin sensitivity and breaking the cycle of metabolic dysregulation. 27. The prevalence of pediatric NAFLD is rising alarmingly, mirroring the increase in childhood obesity, with studies indicating that early onset of fatty liver can predispose youth to severe liver complications in adulthood, highlighting the urgency for public health interventions focusing on diet, physical activity, and lifestyle in childhood and adolescence. 28. The gut-derived hormone fibroblast growth factor 19, FGF19, is implicated in the regulation of bile acid synthesis and glucose metabolism. Its therapeutic modulation offers intriguing prospects for correcting metabolic dysfunction and reducing liver fat content in patients with NAFLD, representing a promising area for novel therapeutic development. 29. Studies on liver fat quantification techniques have illuminated the efficacy of controlled attenuation parameter, CAP, via transient elastography, which provides a reliable, non-invasive, and widely accessible method for assessing hepatic steatosis, facilitating early diagnosis and monitoring while circumventing the risks and discomfort of liver biopsy. 30. Gender differences in NAFLD reveal that men tend to develop the disease earlier, while women, particularly postmenopausal women, face a higher risk of disease progression, suggesting the influence of hormonal factors in disease dynamics and underlining the importance of gender-specific research and treatment approaches. 31. Pharmacological interventions targeting the insulin pathway, such as thiazolidinediones, are undergoing investigation to address insulin resistance in NAFLD patients, offering potential benefits in reducing liver fat, inflammation, and fibrosis, although balanced against potential side effects such as weight gain and cardiovascular risk. 32. Ectopic fat deposition, not only in the liver but also in muscles and the pancreas, constitutes an important aspect of the metabolic disturbances associated with NAFLD, highlighting the interconnected nature of metabolic health and the necessity for interventions that address overall body composition and systemic insulin sensitivity. 33. 3.3. Oxidative stress biomarkers such as melandialdehyde and 8-isoprostane provide valuable insights into the oxidative damage occurring in NAFLD, serving as potential diagnostic and prognostic tools for assessing the severity and progression of the disease and guiding antioxidant-based therapeutic strategies. (34) Emerging research into the role of bile acids and the farnesoid X receptor, FXR, in NAFLD pathogenesis underscores their influence on lipid metabolism, hepatic inflammation, and fibrosis, identifying FXR agonists as promising candidates in the development of targeted therapeutics aimed at mitigating disease progression. 35. The utilization of artificial intelligence and machine learning in analyzing electronic health records and imaging data holds great promise for enhancing the accuracy of NAFLD diagnosis and risk stratification, expediting the identification of high-risk individuals, and optimizing personalized treatment plans in a rapidly evolving healthcare landscape. (36) The increase in lipotoxic intermediates such as diacylglycerol and ceramides in the liver has been linked to insulin resistance and hepatic inflammation, pointing to these lipid species as potential therapeutic targets in efforts to reduce liver fat accumulation and improve insulin sensitivity in patients with NAFLD. (37) Advanced glycation end products, AGEs, accumulate in NAFLD due to high blood sugar levels and oxidative stress, contributing to liver inflammation and fibrosis, and emphasizing the importance of managing glycemic control and reducing dietary AGE intake as part of a comprehensive liver health strategy. (38) Studies indicate a pivotal shift in lipid droplet biology and homeostasis within hepatocytes during NAFLD, with proteins involved in droplet formation and breakdown offering insights into novel therapeutic targets focused on normalizing lipid storage and mobilization processes within the liver. (39) Visceral adiposity is closely linked to NAFLD, with evidence suggesting that reduction of visceral fat through targeted interventions such as aerobic and resistance exercise significantly diminishes liver fat and inflammation, reinforcing the importance of managing central obesity as a cornerstone of NAFLD prevention and treatment. (40) Various cellular types within the liver, including hepatic stellate cells and ductular reaction cells, contribute to fibrogenesis in NAFLD through the secretion of extracellular matrix proteins, highlighting the diverse cellular contributions to liver fibrosis and the need for therapies targeting multiple cellular and molecular pathways. (41) Plasma biomarkers like cytokeratin 18 fragments offer non-invasive means of diagnosing steatohepatitis in NAFLD patients by reflecting hepatocyte apoptosis, providing an important diagnostic alternative that may guide treatment decisions and evaluate responses without resorting to invasive liver biopsy techniques. (42) Disruption of circadian rhythms, often due to modern lifestyle patterns like shift work and poor sleep hygiene, can exacerbate metabolic disorders such as NAFLD by altering hepatic glucose and lipid metabolism, underlining the potential benefits of chronotherapeutic approaches that align treatment and lifestyle modifications with natural circadian rhythms. (43) Using dietary supplements like berberine, an alkaloid derived from plants, has shown promise in improving insulin sensitivity, reducing hepatic steatosis, and exerting overall beneficial metabolic effects, suggesting an additional, complementary role in managing NAFLD when combined with lifestyle interventions. (44) Iron overload, often detected through elevated serum ferritin levels in NAFLD patients, has been associated with increased hepatic inflammation and fibrosis, advocating for the assessment of iron status in NAFLD management and considering therapeutic phlebotomy or iron chelation as potential interventions in cases of significant iron burden. (45) The inconspicuous clinical course of NAFLD contrasts with its potential for serious complications, necessitating vigilant, regular follow-ups, including metabolic health assessments and liver function tests, to promptly identify transitions to more advanced liver disease and initiate timely interventions. '46. Genetic studies of NAFLD have also identified contributions from variants like TM6SF2 and GCKR, further elucidating the complex heritability and genetic risk factors involved in susceptibility and progression, reinforcing the potential for future genetic screening approaches to personalize and optimize patient management. '47. Pharmacological advances in the form of dual peroxisome proliferator activated receptor, PPAR, agonists are currently under investigation as potential NAFLD treatments due to their capacity to modulate lipid metabolism, reduce inflammation, and improve insulin sensitivity, offering a promising multifaceted approach to care. '48. Inflammation in NAFLD is driven not just by classic cytokines like TNF-alpha but also by novel mediators like TGF-beta and IL-1-beta, highlighting the importance of targeted anti-inflammatory strategies that can halt the progressive nature of this disease and address underlying molecular inflammations. '49. The measurement of liver stiffness via elastography provides an indirect yet valuable assessment of liver fibrosis in NAFLD patients, offering a non-invasive diagnostic tool that stratifies fibrosis risk and guides clinical decision-making in managing the disease without the need for invasive procedures. '50. Emerging therapeutic strategies for NAFLD include targeting microRNAs, which regulate gene expression involved in lipid metabolism, fibrogenesis, and inflammation, representing a new frontier in the molecular treatment of NAFLD and offering exciting possibilities for future pharmacologic development. '1. Prostate cancer, most frequently diagnosed in men over 65, often begins its insidious course when normal prostate cells mutate their DNA, leading to uncontrolled growth influenced by male hormones like testosterone, creating a local lesion that can sometimes remain asymptomatic for years until peripheral nerves are affected, causing characteristic lower back pain or radical changes in urinary patterns. '2. The prostate-specific antigen, PSA, test, although controversial due to its potential for false positives, remains a crucial tool in the early detection of prostate cancer, with elevated levels suggesting the need for further investigative procedures such as a digital rectal exam, DRE, or magnetic resonance imaging, MRI, to visualize suspect areas within the gland. '3. One innovative area in prostate cancer treatment is the use of high-intensity focused ultrasound, HIFU, which precisely targets cancerous tissues via sound waves, thereby minimizing damage to surrounding healthy tissues, an advantage that is especially palpable in situations where traditional radiation therapy would pose a higher risk to neighboring structures. '4. In understanding the pathophysiology of prostate cancer, it's crucial to recognize the role of genetic alterations, such as PTEN loss or TMPRSS2-ERG fusion, which can drive aggressive phenotypes and underlie castration-resistant pathways, often necessitating the subsequent use of androgen receptor pathway inhibitors like enzalutamide. '5. The concept of active surveillance in prostate cancer acknowledges that many tumors grow so slowly that immediate treatment might be unnecessary. Thus, the patient undergoes regular monitoring for any indication of progression, often reserved for those with low-risk profiles to avoid the morbidities associated with premature intervention. '6. Multiparametric MRI has revolutionized the diagnostic landscape of prostate cancer, providing detailed images that not only help in defining the tumor's size and extent, but also direct targeted biopsies, offering greater accuracy over traditional random biopsy approaches, especially in distinguishing significant cancers from indolent ones. 7. The genetic landscape of prostate cancer is varied, with tumors often exhibiting a stable genome compared to other malignancies, yet exhibiting mutations in BRCA1 and BRCA2 genes that confer heightened aggressiveness and poorer outcomes, necessitating careful consideration of family history in the clinical context. 8. Prostate cancer pathophysiology can involve transitions from androgen-dependent to androgen-independent states, a conundrum that complicates treatment, enhancing the importance of novel therapies like PARP inhibitors, which exploit DNA repair vulnerabilities specific to cancer cells, thereby increasing the sensitivity of the tumors to subsequent therapies. 9. Proton beam therapy offers a cutting-edge approach for treating prostate cancer, using proton particles that deposit most of their energy directly in the tumor, sparing surrounding tissues with remarkable precision and reducing common side effects like urinary or bowel dysfunction compared to more conventional photon-based radiotherapy. 10. Understanding prostate cancer metastasis requires an appreciation for the molecular changes that allow tumor cells to detach and traverse bodily systems, particularly the lymphatic pathways leading to nearby lymph nodes and bones, where they establish secondary growths, often necessitating systemic treatment modalities beyond localized therapy. 11. The Gleason scoring system remains a cornerstone in predicting prostate cancer behavior, assigning a score based on glandular patterns observed under a microscope, where higher scores indicate a greater degree of aberration, aiding in tailoring management strategies to individual patient risk levels. 12. Androgen deprivation therapy, ADT, has long been a mainstay in the management of advanced prostate cancer, aiming to reduce circulating testosterone through either surgical orchiectomy or pharmaceutical agents such as GnRH agonists, which ultimately starve the cancer of its growth-promoting hormones. 13. Immunotherapy, such as the use of sipuleucel T, represents a novel frontier in prostate cancer treatment, whereby a patient's immune cells are engineered to recognize and combat prostate cancer cells, offering a personalized approach that can extend survival in select patients with advanced disease. 14. There is growing evidence that the microbiome, particularly within the gut, may play an influential role in prostate cancer development and progression, with certain microbial compositions potentially modulating systemic inflammation and hormonal balances that encourage or suppress oncogenic pathways. 15. Radioligand therapy, targeting prostate-specific membrane antigen, PSMA, provides a promising avenue for metastatic prostate cancer, leveraging radioactive isotopes bound to molecules that selectively attach to cancer cells, delivering lethal doses of radiation while sparing healthy tissue to a greater extent than traditional methods. 16. Transperineal prostate biopsy, performed under ultrasound guidance, minimizes infection risk compared to transrectal approaches, and provides more comprehensive sampling of the prostate, enhancing diagnostic precision especially in previously biopsied individuals with persistently elevated PSA levels. 17. Obesity has been implicated in the pathogenesis of more aggressive prostate cancer forms, potentially due to increased levels of inflammatory cytokines and insulin-like growth factors, which may promote tumor growth, highlighting the importance of lifestyle interventions as adjuncts in the prevention and management of prostate cancer. 18. The influence of dietary patterns on prostate cancer risk and progression has gained attention, with studies suggesting that diets rich in tomatoes, due to their lycopene content, and polyphenol-rich foods like green tea, may confer protective effects through their antioxidant and anti-inflammatory properties. 19. Focal therapy, including cryoablation and laser thermal therapy, targets prostate cancer lesions with precision, potentially offering a middle ground between active surveillance and radical treatments, aiming to eradicate cancerous tissues while preserving prostate function and patient quality of life. 20. Circulating tumor cells, CTCs, and DNA, ctDNA, are emerging biomarkers in the blood that may offer real-time insights into prostate cancer dynamics, potentially guiding treatment decisions and prognostication by reflecting tumor burden and molecular changes in response to therapy. 21. Radiotherapy advancements now permit hypofractionated regimens for prostate cancer, where higher doses per session shorten treatment duration, maintaining efficacy while offering greater convenience and reducing time spent by patients undergoing therapy, demonstrating comparable side effect profiles to conventional schedules. 22. The phenomenon of neuroendocrine differentiation in prostate cancer, often occurring in the setting of advanced, treatment-resistant disease, represents a shift in tumor phenotype, where cells acquire neuroendocrine-like features that are less reliant on androgen receptors, complicating therapeutic approaches, and often indicating a poorer prognosis. 23. Dietary supplementation with vitamin D has been investigated for its potential role in reducing prostate cancer risk and progression, given that this nutrient is thought to influence cellular differentiation and proliferation. Yet evidence remains mixed, warranting further study to elucidate its impact fully. 24. Magnetic resonance imaging ultrasound (MRI-US) fusion biopsy technology allows for the precise targeting of suspicious areas within the prostate identified on MRI, providing increased accuracy over traditional biopsy techniques, potentially reducing the number of necessary samples and improving cancer detection rates. 25. The advent of genomic profiling in prostate cancer has facilitated the identification of actionable mutations, enabling targeted therapies such as those aimed at the PI3K, AKT, mTOR pathway, which are currently being explored in clinical trials to determine their efficacy in improving outcomes in certain genetic subpopulations. 26. Early-stage prostate cancer may be asymptomatic, but as the disease progresses, symptoms such as difficulty urinating, blood in urine or semen, and erectile dysfunction can develop, emphasizing the importance of regular screening and early intervention to mitigate the impact on quality of life. 27. Hormone-refractory prostate cancer, also known as castration-resistant prostate cancer, CRPC, occurs when the disease progresses despite androgen deprivation, necessitating the use of additional therapies such as chemotherapy with docetaxel or cabazitaxel, which target rapidly dividing cancer cells through distinct cytotoxic mechanisms. 28. The relationship between chronic inflammation and prostate cancer has been a focal point in research, with inflammatory conditions potentially leading to genetic mutations over time, thus providing a fertile ground for cancer development, encouraging explorations into anti-inflammatory compounds as preventive measures. 29. Prostate cancer risk is significantly augmented by family history, with men having a first-degree relative diagnosed with prostate cancer being about twice as likely to develop the disease themselves, suggesting a substantial genetic component that could inform personalized screening strategies. 30. The use of 5-alpha reductase inhibitors in prostate cancer prevention is predicated on their ability to block the conversion of testosterone to dihydrotestosterone, a potent androgen that drives prostatic growth, though these medications are typically reserved for specific cases due to potential side effects. 31. The complexity of the tumor microenvironment in prostate cancer, including interactions between cancer cells, stromal cells, and extracellular matrix components, plays a crucial role in disease progression, influencing tumor growth, resistance to treatment, and metastatic potential, thus providing a rich target for novel therapeutic strategies. 32. Bone-targeted therapies such as bisphosphonates and denosumab play a pivotal role in managing bone metastasis in prostate cancer, working to reduce skeletal-related events by inhibiting osteoclast-mediated bone resorption, thereby enhancing patient quality of life and potentially extending survival. Epidural spinal cord compression is a critical complication of metastatic prostate cancer that requires immediate medical intervention, often involving steroids, radiotherapy, or surgery to alleviate pressure on the spinal cord, thus preventing irreversible neurological damage and preserving functional status. Prostate cancer staging with radiolabeled tracers like choline, or more recently PSMA, in positron emission tomography, PET, scanning, significantly improves detection of both local and distant metastasis, providing a comprehensive picture of disease burden that informs subsequent treatment planning. Contemporary surgical techniques, such as robotic-assisted laparoscopic prostatectomy, have revolutionized prostate cancer surgery by offering enhanced dexterity and visualization, thereby improving outcomes related to oncological control, continence, and erectile function compared to traditional open procedures. Chemoprevention trials in prostate cancer are exploring the use of dietary agents such as soy isoflavones and selenium, hypothesized to exert protective effects through modulation of hormonal and inflammatory pathways, though findings to date remain inconclusive and warrant further investigation. Prostate cancer cell dormancy represents a significant clinical challenge, as disseminated tumor cells may remain quiescent for years before reactivation, complicating treatment strategies and necessitating ongoing research into the triggers of dormancy and potential interventions to eliminate dormant cells. In the landscape of personalized medicine, molecular subtyping of prostate cancer is becoming increasingly important, with classification systems identifying distinct subsets of the disease based on genetic and molecular signatures, which can guide targeted therapeutic interventions and prognostic assessments. The impact of psychosocial factors on prostate cancer outcomes is profound, with stress, depression, and lack of social support been associated with poorer survival, reinforcing the importance of holistic approaches that incorporate mental health and well-being support alongside traditional clinical care. The risk stratification of prostate cancer recurrence post-treatment is enhanced by tools such as the Cancer of the Prostate Risk Assessment (CAPRA) score, which evaluates pre- and post-treatment variables to predict the likelihood of biochemical recurrence, thereby informing ongoing patient monitoring and management decisions. In the exploration of resistance mechanisms, prostate cancer research has unveiled the role of aberrant CRIP signaling and DNA repair processes in conferring treatment resistance, emphasizing the need for combination regimens targeting multiple pathways to delay or overcome resistance in advanced cases. The role of somatic mutations in genes such as SPOP, FOXA1, and CHD1 is being elucidated in the context of prostate cancer, with these mutations associated with specific clinicopathological features and treatment responses, offering the potential for enriched patient stratification in clinical trials. In the realm of advanced imaging, 3D histological reconstruction from biopsy samples provides a deeper insight into the spatial arrangement of cancerous tissues within the prostate, offering potential improvements in understanding tumor biology and enhancing the precision of treatment planning. Genetic counseling and testing for hereditary prostate cancer syndromes, particularly in families with BRCA mutations, are crucial components of risk assessment and management, enabling tailored screening protocols and consideration of prophylactic measures in high-risk individuals. 45. The use of metabolism-targeted therapies, such as inhibitors of fatty acid synthase or those impacting mitochondrial function, represents a burgeoning frontier in prostate cancer treatment, aiming to exploit the metabolic adaptations that cancer cells undergo to support rapid proliferation. (46) Tracking therapeutic responses in prostate cancer through advanced biomarkers, such as changes in circulating microRNA profiles, provides a non-invasive tool to monitor disease dynamics in real time, enabling adjustments to therapeutic regimens in response to detected changes. 47. In assessing and managing the side effects of prostate cancer treatments, integrative approaches combining conventional medical treatment with complementary methods such as acupuncture or yoga may offer relief from therapy-related symptoms, such as fatigue and anxiety, enhancing overall quality of life. 48. Ongoing research into the prostate cancer stem cell hypothesis suggests that tumorigenesis may be driven by a subset of stem-like cells capable of self-renewal and resistance to conventional therapies, presenting a profound challenge but also a potentially transformative target in the quest for more effective long-term treatments. 49. In the journey of a patient with prostate cancer, survivorship programs play an essential role in addressing long-term health outcomes, focusing on lifestyle modifications, routine health screenings, and psychological support as part of an integrated approach to life beyond cancer. 50. Advancements in cryobiopsy for prostate cancer allow for the preservation of tissue architecture and viability for extensive histopathological analyses, providing critical insights into tumor heterogeneity and molecular characterizations that guide personalized treatment plans and novel research directions. Asthma is a multifaceted chronic respiratory condition characterized by airway inflammation, heightened bronchial hyperresponsiveness, and reversible airway obstruction, typically managed through a precision-based approach involving inhaled corticosteroids which target specific inflammatory pathways, combined with beta agonists to dilate airways, alongside the use of personalized action plans and novel biologics that inhibit IgE or interleukin-5 to address severe and refractory cases. 2. Chronic obstructive pulmonary disease, COPD, a progressive and largely irreversible respiratory disorder marked by emphysema and chronic bronchitis, stems primarily from long-term exposure to tobacco smoke or environmental pollutants and necessitates a multifaceted management strategy comprising smoking cessation, pulmonary rehabilitation, long-acting muscarinic antagonists, and consideration of phosphodiesterase 4 inhibitors to reduce exacerbations. 3. Cystic fibrosis, a genetic disorder caused by mutations in the CFTR gene leading to thick, viscous secretions in the airways, requires diligent multidisciplinary management including the use of mucolytics, physiotherapy, and CFTR modulators that specifically address the underlying protein defect, along with vigilant monitoring for complications such as Pseudomonas infections and timely administration of broad-spectrum antibiotics. 4. Pulmonary embolism, a potentially life-threatening obstruction of the pulmonary arteries often resulting from deep vein thrombosis, demands prompt recognition and treatment with anticoagulants like low molecular weight heparin or novel oral anticoagulants to prevent further clot formation, and in severe cases, can necessitate thrombolytic therapy or surgical embolectomy to swiftly restore pulmonary perfusion. 5. Tuberculosis, an infectious disease caused by Mycobacterium tuberculosis primarily affecting the lungs, mandates a combination therapy of isoniazid, rifampin, pyrazinamide, and ethambutol for an extended period of up to 6 months, alongside drug susceptibility testing to address drug-resistant strains, complemented by public health measures to contain transmission. 6. Pneumonia, an inflammatory condition of the lung parenchyma frequently caused by bacteria such as Streptococcus pneumoniae or viruses, requires an astute clinical diagnosis often characterized by cough, fever, and infiltrates visible on chest X-rays. treated with antibiotics tailored to the suspected etiological agent and supportive care to ensure proper oxygenation. 7. Lung cancer, the leading cause of cancer death worldwide arising from uncontrolled cell proliferation in lung tissues, particularly requires individualized treatment approaches depending on histological type and molecular features, which may include surgical resection, chemotherapy, targeted therapies against mutations such as EGFR or ALK, and immunotherapy with checkpoint inhibitors like PD-1 antibodies. 8. Sarcoidosis is an enigmatic granulomatous disorder impacting the lungs in most cases, driven by an abnormal immune response to an unknown antigen, marked by non-caseating granulomas seen histologically, and often managed through glucocorticoids to alleviate symptoms, with methotrexate as an alternative for steroid-sparing purposes in chronic or refractory scenarios. 9. Idiopathic pulmonary fibrosis is a perplexing chronic lung disease characterized by progressive scarring of lung tissue, leading to diminished oxygen exchange and an inexorable decline in respiratory function, wherein pirfenidone and nintedanib have emerged as antifibrotic agents that can decelerate disease progression, alongside lung transplantation consideration in advanced stages. 10. Pleural effusion, the accumulation of excess fluid between the pleural layers, presents with dyspnea and diminished breath sounds on examination, often requires diagnostic thoracentesis to determine the etiology, be it transitive from heart failure or exudative from infections or malignancies, and necessitates targeted therapy to address the underlying cause to prevent recurrence. 11. Respiratory syncytial virus, RSV, a common viral respiratory pathogen causing severe bronchiolitis in infants and young children, requires prompt supportive management involving hydration and supplemental oxygen, with palivizumab providing passive immunization for high-risk populations, and novel investigational RSV vaccines currently explore preventing widespread seasonal outbreaks. 12. Obstructive sleep apnea, a disorder characterized by repetitive upper airway collapse during sleep leading to intermittent hypoxia, contributes to daytime sleepiness and cardiovascular comorbidities, managed with lifestyle interventions, continuous positive airway pressure, CPAP, therapy, and mandibular advancement devices, with occasional consideration of surgical approaches for anatomical obstructions. 13. Pulmonary arterial hypertension, defined by elevated pressures in the pulmonary artery leading to right heart strain, necessitates a comprehensive approach involving endothelin receptor antagonists, phosphodiesterase type 5 inhibitors, and prostacyclin analogs to decrease vascular resistance, combined with expert management of underlying conditions or potential for lung transplantation in severe cases. 14. Bronchiectasis, characterized by irreversible bronchial dilation and chronic productive cough due to repeated infections or inflammation, requires regular airway clearance techniques, inhaled antibiotics for frequent exacerbations, and attention to underlying conditions such as cystic fibrosis or primary ciliary dyskinesia to prevent further damage to respiratory structures. 15. Hypersensitivity pneumonitis is an inflammatory type of interstitial lung disease triggered by repeated inhalation of organic antigens, such as mold or bird proteins, leading to non-caseating granuloma formation, and managed by identifying and removing the offending antigen, alongside the use of corticosteroids for acute symptoms or persistent inflammation. 16. Alpha-1 antitrypsin deficiency, a genetic condition leading to early-onset emphysema due to unopposed neutrophil elastase activity, benefits from augmentation therapy with intravenous purified alpha-1 antitrypsin to slow lung function decline, supported by smoking avoidance and vigilant monitoring for liver involvement, which may necessitate transplantation in severe cases. 17. Laryngeal papillomatosis, caused by HPV and characterized by recurrent respiratory papillomas, presents with progressive hoarseness and may necessitate surgical intervention using laser surgical techniques to debulk lesions, complemented by adjuvant therapies including cidofovir injections or bevacizumab to reduce recurrence, with evolving research into immunotherapeutic options. 18. Pneumothorax, the presence of air in the pleural space causing lung collapse, presents acutely with sudden onset chest pain and dyspnea, frequently requires intervention based on size and patient stability, ranging from needle aspiration to chest tube insertion, and for recurrent cases, surgical pleurodesis to prevent further episodes by promoting pleural surface adhesion. 19. Anthrax inhalation, a rare respiratory emergency caused by Bacillus anthracis spores becoming airborne, necessitates prompt recognition due to rapid progression to severe sepsis and shock, and requires antibiotic therapy initiated with ciprofloxacin or doxycycline, supported by antitoxin administration for systemic anthrax and prophylaxis in exposed individuals during bioterrorism threats. 20. Viral croup, a common cause of barking cough and stridor in young children due to subglottic airway inflammation, optimally managed with a single dose of oral dexamethasone to reduce airway edema, alongside nebulized epinephrine for more severe respiratory distress, ultimately ensuring airway patency and resolution of the acute episode without progression to respiratory failure. 21. Chronic thromboembolic pulmonary hypertension results from unresolved pulmonary emboli leading to persistent high pulmonary artery pressures, necessitates anticoagulation to halt further thrombus formation, and requires surgical pulmonary endarterectomy or balloon pulmonary angioplasty as definitive treatment options to restore normal hemodynamics and improve symptoms. 22. Alveolar proteinosis, a rare condition characterized by accumulation of lipoproteinaceous material within alveoli due to GM-CSF signaling disruption, typically presents with progressive dyspnea and cough, and benefits from whole lung lavage to physically remove surplus secretions, while emerging therapies involve recombinant GM-CSF to address the underlying pathophysiological defect. 23. Bronchiolitis obliterans, a fibrosing obliteration of small airways often following inhalational injury or as post-transplant complication, manifests as obstructive lung disease and is challenging to treat, requiring immunosuppressive therapy adjustment and attention to reversible causes, with investigational treatments exploring options like macrolides or novel agents to modulate inflammation. 24. Acquired tracheoesophageal fistula, an abnormal connection between the trachea and esophagus typically caused by prolonged intubation or malignancy, presents with coughing, recurrent aspiration, and pneumonias, necessitating prompt diagnosis via imaging and endoscopy, and surgical correction to prevent respiratory compromise or life-threatening infections. 25. Histoplasmosis is a fungal infection endemic in certain geographical areas that primarily affects the lungs following inhalation of Histoplasma capsulatum spores, often asymptomatic or presenting as mild respiratory illness, occasionally requiring antifungal therapy with itraconazole or amphotericin B for severe or disseminated disease to mitigate pulmonary complications. 26. Mediastinal masses, which could be neoplastic or cystic in origin, present with varied respiratory symptoms depending on size and location, requiring imaging for subtype differentiation, often necessitating biopsy for histological diagnosis, and managed through tailored approaches ranging from surgical resection to chemoradiation therapy depending on malignancy likelihood. 27. Tracheomalacia, characterized by dynamic airway collapse in the trachea, poses a significant challenge in both pediatric and adult populations, managed through conservative measures such as continuous positive airway pressure, surgical intervention like tracheal stenting in severe collapse, or tracheopexy, especially when associated with persistent respiratory distress or recurrent infections. 28. Bronchopulmonary dysplasia, a chronic neonatal lung disease arising predominantly in premature infants with prolonged mechanical ventilation, involves strategies to minimize ventilator-induced lung injury and oxygen toxicity, facilitate lung development through individualized respiratory support strategies, and consider diuretic or corticosteroid therapy in severe cases with long-standing oxygen dependency. 29. Spontaneous hemothorax, a rare emergency characterized by blood accumulation in the pleural cavity, occurs due to vessel rupture or chest wall vascular abnormalities presenting with hypovolemic shock and hypoxia, requiring urgent thoracostomy for drainage and stabilization, alongside imaging for underlying etiology identification, with surgical intervention in cases of continued bleeding. 30. Goodpasture syndrome, an autoimmune disease affecting kidneys and lungs, often presents with hemoptysis due to pulmonary capillaritis and requires a combination of plasma exchange to remove circulating antibodies, corticosteroids, and immunosuppressants like cyclophosphamide or rituximab to halt disease progression and preserve lung and renal function, along with careful monitoring for relapses. 31. Exercise-induced bronchoconstriction is a transient airway narrowing triggered by physical exertion, seen commonly in athletes and those with underlying atopy, diagnosed via provocation testing, managed preemptively with inhaled bronchodilators or anticholinergics, and requires comprehensive lung function monitoring to ensure endurance and performance are optimized without exacerbating symptoms. 32. Primary ciliary dyskinesia, a genetic disorder causing dysfunctional ciliary motility, leads to recurrent respiratory infections, chronic sinusitis, and laterality issues such as situs inversus, managed by airway clearance techniques and antibiotic prophylaxis, with specialist input from centers experienced in this rare condition to optimize outcomes through personalized care plans. 3.3. Bronchoscopy, a diagnostic and therapeutic tool for direct visualization of the airways, facilitates biopsy collection, foreign body removal, or resolving atelectasis and bleeding, increasingly enhanced by advanced techniques like endobronchial ultrasound for mediastinal lymph node sampling or therapeutic interventions such as valve placements in lung volume reduction strategies. 34. Wegener's granulomatosis, now termed granulomatosis with polyangiitis, is a rare vasculitic disorder presenting with granulomatous inflammation affecting the upper airways, lungs, and kidneys, requiring aggressive immunosuppressive therapy with agents like rituximab or cyclophosphamide alongside glucocorticoids for induction, and maintenance therapy often including methotrexate or azathioprine. 35. Lung transplantation remains a definitive surgical treatment for patients with end-stage lung diseases such as cystic fibrosis or idiopathic pulmonary fibrosis, involving a complex preoperative assessment, meticulous donor-recipient matching, and rigorous postoperative immunosuppression management to prevent rejection and optimize graft survival, with potential challenges posed by infection and chronic allograft dysfunction. 36. E-cigarette or vaping product use-associated lung injury, EVALI, emerged as a significant public health concern due to increasing reports of acute lung injury among young, previously healthy users, necessitating prompt cessation and management strategies focusing on supportive care, possibly incorporating corticosteroids for severe respiratory compromise, and highlighting the pivotal role of public awareness initiatives to curb usage. 37. High-altitude pulmonary edema, a life-threatening condition occurring at elevations typically above 2,500 meters, is characterized by non-cardiogenic pulmonary edema leading to respiratory distress, best prevented and managed through acclimatization strategies, descent as essential therapy, and adjunct treatments like supplemental oxygen and nifedipine or phosphodiesterase inhibitors for symptomatic relief. 38. Idiopathic interstitial pneumonia encompasses several distinct yet overlapping categories of diffuse parenchymal lung diseases, requiring high-resolution computed tomography imaging to differentiate subtypes such as usual interstitial pneumonia or nonspecific interstitial pneumonia, and therapeutic strategies focused on antifibrotic medications such as pirfenidone or nintedanib to slow disease progression and improve quality of life. (39) Respiratory distress syndrome in preterm infants results from surfactant deficiency, leading to alveolar collapse and impaired gas exchange, effectively managed with exogenous surfactant replacement therapy and minimized ventilation strategies to prevent further lung injury, aiming towards rapid respiratory stabilization and facilitating transition to normal postnatal respiratory adaptation. (40) Chronic sinusitis and its impact on respiratory health is an often overlooked factor contributing to persistent respiratory symptoms, requiring a thorough evaluation to identify anatomical or allergic causes, and managed with a combination of intranasal corticosteroids, saline irrigation, and antibiotics where indicated, with surgical intervention providing relief for patients with refractory or anatomically complex disease. (41) Viral pneumonitis in the context of pandemics such as COVID-19 presents significant diagnostic and therapeutic challenges, requiring rapid identification through nucleic acid amplification tests, symptomatic management, and antiviral therapies like remdesivir or monoclonal antibodies, alongside public health strategies to mitigate transmission and facilitate vaccine distribution to at-risk populations. (42) Adult respiratory distress syndrome, ARDS, represents a critical condition characterized by acute inflammatory lung injury leading to diffuse alveolar damage and hypoxemia, necessitating lung protective mechanical ventilation strategies, adjunctive therapies such as prone positioning or neuromuscular blockade, and investigational approaches focusing on modulating the inflammatory cascade to improve outcomes. (43) Chylothorax, the accumulation of lymphatic fluid within the pleural space, often associated with thoracic surgery or trauma, requires dietary modifications such as a fat-restricted diet or medium-chain triglycerides, and consideration of pleurodesis or surgical interventions like thoracic duct ligation in persistent cases, alongside vigilant monitoring for nutritional deficiencies and electrolyte imbalances. (44) Diffuse alveolar hemorrhage, a syndrome presenting with hemoptysis and alveolar infiltrates, demands an urgent diagnostic approach to identify underlying causes ranging from autoimmune diseases like lupus to vasculitis, managed with high-dose corticosteroids and cytotoxic or immunomodulatory agents tailored to the specific etiological condition, necessitating multidisciplinary coordination for optimal outcomes. (45) Tracheobronchomalacia, an uncommon condition characterized by airway wall weakness and collapse, leads to expiratory flow limitation and persistent cough, managed through conservative measures such as airway clearance techniques, non-invasive ventilatory support, or surgical interventions including stent placement or tracheobronchoplasty for those with significant symptomatic airway compromise. (46) Pneumoconiosis, a restrictive lung disease caused by inhalation of occupational dust such as silica or asbestos, leads to insidious onset of pulmonary fibrosis and increased risk for progressive disability or malignancies like mesothelioma, managed through cessation of exposure, symptomatic relief with respiratory therapies, and vigilant surveillance for disease progression or complicating malignancies. (47) Paradoxical vocal cord dysfunction, characterized by inappropriate vocal cord movement leading to airway obstruction and wheezing, often misdiagnosed as asthma, requires speech therapy interventions aimed at retraining breathing patterns, psychological support to address potential triggers, and occasionally pharmacological management with anticholinergics or anxiolytics for complex cases. (48) Pulmonary eosinophilia, marked by elevated eosinophils within lung tissue seen in conditions such as eosinophilic pneumonia or allergic bronchopulmonary aspergillosis, presents with respiratory symptoms and peripheral eosinophilia, typically managed with corticosteroids to rapidly alleviate inflammation, coupled with meticulous evaluation of possible causative agents and differential diagnosis exploration to prevent recurrence. (49) Foreign body aspiration poses a significant pediatric emergency with rapid onset of airway obstruction, necessitating prompt identification and removal via bronchoscopy to prevent significant respiratory compromise or infection, highlighting the importance of prevention strategies through parental education and child-proofing initiatives to minimize the incidence of such potentially life-threatening events. (50) Methemoglobinemia, a rare disorder characterized by oxidized hemoglobin in red blood cells impairing oxygen delivery, presents with cyanosis and reduced pulse oximetry saturation despite adequate oxygenation, treated effectively with methylene blue or ascorbic acid to reduce methemoglobin levels, alongside identifying and eliminating offending agents such as nitrates or local anesthetics to prevent recurrence. (1) Breast cancer is the most common cancer among women worldwide, accounting for approximately 25% of all cancer cases, and it arises primarily from the lining of the ducts and lobules in the breast tissue, classified as ductal or lobular carcinoma respectively, and is often influenced by hormonal, genetic, and environmental factors. (2) The pathophysiology of breast cancer often involves the overexpression of the HER2 protein, which accelerates the growth of cancer cells, or mutations in the BRCA1 or BRCA2 genes, significantly increasing a woman's lifetime risk of developing breast cancer by altering the processes controlling normal cell growth and DNA repair mechanisms. (3) Early-stage breast cancer is commonly diagnosed using imaging techniques such as mammography, which can detect tumors that are asymptomatic and as small as a few millimeters, while MRI and ultrasound may be used to further evaluate suspicious areas, especially in dense breast tissue. (4) Treatment for breast cancer typically involves a multimodal approach, including surgery, which may be a lumpectomy or mastectomy, often followed by radiation therapy to reduce the risk of local recurrence, and systemic treatments such as chemotherapy, hormonal therapy, or targeted therapy, depending on the tumor's receptor status and molecular profile. (5) Hormonal therapy for breast cancer involves drugs like tamoxifen or aromatase inhibitors, which work by blocking estrogen receptors or decreasing estrogen production, respectively, and are particularly effective in estrogen receptor positive, ER+ cancers, thereby preventing the recurrence of the disease, especially in postmenopausal women. (6) Triple-negative breast cancer, TNBC, which lacks estrogen, progesterone, and HER2 receptors, presents a significant clinical challenge due to its aggressive nature and limited treatment options, typically involving a combination of surgery and chemotherapy, as targeted treatments are currently not available for this subtype. (7) Sentinel lymph node biopsy is a procedure used to determine the extent of breast cancer spread by injecting a dye and/or radioactive tracer to identify the first few lymph nodes into which a tumor drains, minimizing the need for more extensive lymph node dissections and thereby reducing the risk of lymphedema. (8) Adjuvant chemotherapy is recommended for breast cancer patients with higher risk of recurrence, typically indicated by larger tumor size, lymph node involvement, or high-grade tumors, and consists of drugs such as doxorubicin and cyclophosphamide, which interfere with DNA replication in rapidly dividing cancer cells. (9) Breast cancer staging, classified from 0 to IV, is crucial in guiding treatment decisions and is based on the size of the tumor, involvement of nearby lymph nodes, and the presence of distant metastasis, with stage 0 indicating non-invasive cancer and stage 4 indicating metastatic disease with poorer prognosis. 10. Inflammatory breast cancer, a rare but aggressive form, is characterized by the diffuse redness and swelling resembling an infection, often without a palpable tumor, and is caused by cancer cells blocking lymph vessels in the skin. It requires prompt systemic therapy along with surgery and radiation. 11. Oncotype DX, a genomic test for early-stage, hormone receptor-positive breast cancer, evaluates the expression of 21 cancer-related genes to predict the risk of recurrence and likely benefit of chemotherapy, thereby assisting clinicians in personalizing treatment plans for individual patients. 12. Breast cancer in men, although rare, usually presents with symptoms such as a lump in the breast tissue, nipple discharge, or changes in the nipple or breast skin, and the treatment protocols are similar to those in women, often involving surgery, radiation, and systemic therapies. 13. The 5-year relative survival rate for localized breast cancer, detected before it has spread outside the breast tissue, exceeds 98%, highlighting the importance of regular screening and early detection, which significantly improve treatment outcomes and patient survival rates. 14. HER2-positive breast cancer, characterized by the overexpression of the HER2 protein, is aggressive but shows improved outcomes with targeted therapies such as trastuzumab or pertuzumab, which inhibit the HER2 receptors, thereby slowing or stopping the growth of cancer cells. 15. Breast-conserving surgery, also known as a lumpectomy, aims to remove the cancerous tissue while sparing as much healthy breast tissue as possible, and is generally followed by radiation therapy to minimize the risk of cancer recurrence in the conserved breast. 16. Bone is a common site for breast cancer metastasis, and patients with bone metastasis may experience symptoms like bone pain or fractures. Treatment includes systemic therapies, bisphosphonates or denosumab to strengthen bone, and sometimes radiation therapy for pain relief. 17. Paget's disease of the breast, a rare form of cancer involving the nipple and areola, often presents with symptoms like redness, scaling, and itching, and is associated with underlying ductal carcinoma in situ or invasive breast cancer, necessitating prompt biopsy and treatment. 18. The Gale model is a risk assessment tool used to estimate a woman's risk of developing breast cancer over the next 5 years and lifetime by considering factors such as age, family history, reproductive history, and history of breast biopsies, aiding in individualized screening recommendations. 19. Breast cancer survivors may experience long-term side effects from treatment, including lymphedema, fatigue, cognitive changes, and increased risk of osteoporosis, necessitating ongoing multidisciplinary care and regular follow-up to monitor and manage these potential complications. 20. Microcalcifications on mammography, often seen as small white spots, can be an indication of early breast cancer, especially ductal carcinoma in situ, and typically warrant further evaluation with a magnified mammogram or biopsy to determine their nature and appropriate management. 21. The breast cancer subtype known as luminal A is estrogen receptor, positive and/or progesterone receptor, PR positive, HER2 negative, and typically presents with a favorable prognosis due to slower growth rates and responsiveness to hormone therapies. 22. Neoadjuvant therapy, administered before surgery, is used in certain breast cancer cases to shrink the tumor, making it operable or allowing breast-conserving surgery rather than mastectomy, and also provides the added benefit of assessing the tumor's response to systemic treatment. 23. The Nottingham Histologic Score, also known as the Bloom-Richardson score, grades invasive breast cancer based on tubule formation, nuclear pleomorphism, and meiotic count, providing a prognostic indicator that helps guide treatment decisions. 24. Carcinoma in situ, found in conditions like ductal carcinoma in situ, DCIS, or lobular carcinoma in situ, LCIS, represents an early form of breast cancer contained within the ducts or lobules without invasion into surrounding tissues, often requiring localized treatment and careful surveillance. 25. During breast cancer diagnosis, a core needle biopsy, guided by imaging techniques such as ultrasound or stereotactic mammography, is the preferred method for obtaining tissue samples to confirm cancer presence and subtype, as it provides adequate tissue for histological examination. 26. Radiation therapy for breast cancer is typically delivered postoperatively to eradicate residual microscopic cancer cells in the breast, chest wall, or regional lymph nodes, and it significantly reduces local recurrence rates, enhancing long-term survival outcomes for patients. 27. Aromatase inhibitors, such as anastrozole or letrozole, are often preferred for postmenopausal women with hormone receptor-positive breast cancer because they reduce estrogen production from peripheral tissues, thus lowering circulating estrogen levels that could stimulate tumor growth. 28. The use of prophylactic mastectomy, or preventative removal of breast tissue, may be considered for individuals with a very high risk of breast cancer, such as those with BRCA1 or BRCA2 mutations, as it significantly reduces the likelihood of developing breast cancer. 29. Breast cancer screening guidelines generally recommend women begin annual or biennial mammograms starting at age 40 or 50, but individualized screening strategies may be necessary for women with higher risk factors, such as family history or genetic predispositions. 30. HER2 testing is critical in breast cancer management, usually conducted through immunohistochemistry, IHC, or fluorescence in situ hybridization, FISH, upon biopsy or surgical specimens, as HER2 status determines the use of targeted therapies and influences treatment strategies. 31. Paraneoplastic syndromes are rare in breast cancer, but these immune-mediated or hormone-related effects, such as hypercalcemia or dermatomyositis, can complicate the clinical picture, requiring a high index of suspicion for timely diagnosis and treatment. 32. Breast cancer often metastasizes to the brain, and symptoms like headaches, seizures, or cognitive changes can indicate central nervous system involvement, often managed with surgery, stereotactic radiosurgery, or whole brain radiation, depending on the extent and location of lesions. 3. Breast density is a recognized risk factor for breast cancer, as seen on mammograms, with higher density indicating more glandular and connective tissue, which can mask tumors, thus necessitating advanced imaging techniques like 3D mammography or MRI for accurate screening. 34. Invasive lobular carcinoma, known for its distinctive growth pattern of small, non-cohesive cells, often presents with more insidious and diffuse growth, complicating detection and treatment, and sometimes requiring bilateral mammograms due to an increased risk of contralateral breast cancer. 35. Chemoprevention in breast cancer, utilizing medications like tamoxifen or raloxifene, is an option for women at increased risk, as these agents interfere with estrogen receptor pathways, effectively reducing the incidence of hormone receptor-positive breast cancers. 36. Phyllodes tumors of the breast, while rare, are distinct from other breast cancers because they arise from the stromal tissue and can be benign, borderline, or malignant, often requiring wide local excision due to their potential for local recurrence or, in malignant cases, metastasis. 37. Male breast cancer, accounting for less than 1% of all breast cancers, typically presents in older men with risk factors such as Klinefelter syndrome, BRCA2 mutations, or family history, and though rare, treatment parallels female breast cancer protocols, including surgery and adjuvant therapies. 38. Lobular carcinoma in situ, LCIS, is not considered a true cancer but an indicator of increased breast cancer risk, mostly involving both breasts, that often leads to intensified surveillance and sometimes chemoprevention to mitigate the risk of eventual invasive cancer development. 39. Breast-conserving surgery followed by radiation therapy provides equivalent survival outcomes to mastectomy in early-stage breast cancer, challenging the older notion that more extensive surgical procedures necessarily lead to better survival, thus enabling more personalized treatment approaches. 40. Invasive ductal carcinoma, the most common form of breast cancer, displays distinct microscopic features like duct-like structures on histology, emphasizing the heterogeneous nature of tumors, which guides the selection of systemic treatments depending on receptor status and genetic markers. 41. Breast cysts are fluid-filled sacs that can be mistaken for solid tumors during physical exams or imaging, often requiring aspiration under ultrasound guidance to relieve discomfort and confirm the cystic nature, while regular monitoring ensures they do not develop malignant features. 42. Molecular subtyping of breast cancer through gene expression profiling helps in identifying specific biological characteristics of a tumor, categorizing it into subtypes such as basal-like, HER2 enriched, or luminal, each with unique prognostic implications and tailored treatment strategies. 43. In breast cancer, circulating tumor cells, CTCs, and circulating tumor DNA, ctDNA, are emerging biomarkers that provide insights into the disease burden and dynamics, potentially guiding treatment decisions and monitoring response to therapy, though their clinical utility is still under investigation. 44. Breast cancer-related lymphedema, resulting from lymph node removal or radiation, leads to arm or breast swelling and is managed with physical therapy, compression garments, and sometimes surgical interventions to restore lymphatic flow and prevent infection or functional impairment. 45. Adolescent girls with a strong family history of breast cancer may benefit from genetic counseling and testing to assess for mutations like BRCA1 or BRCA2, which can significantly influence future screening practices and risk-reducing strategies, impacting their long-term healthcare plans. 46. Tumor heterogeneity in breast cancer is a key challenge in treatment, as distinct genetic and phenotypic variations in cancer cells within the same tumor or between primary and metastatic sites can impact drug response and resistance, necessitating adaptive and personalized treatment approaches. 47. The emergence of immunotherapy in breast cancer, which harnesses the body's immune system to attack cancer cells, has shown promise particularly in triple-negative subtypes through agents like checkpoint inhibitors, which are currently explored in clinical trials to broaden therapeutic options. 48. Breast cancer survivors are at risk of developing secondary cancers due to shared risk factors like genetics or the effects of previous treatments, thus requiring continued vigilance in screening and preventive measures to detect and mitigate these risks effectively over the long term. 49. Genetic testing for mutations such as PALB2 or ATM, alongside BRCA1 and BRCA2, can elucidate familial breast cancer risk, guiding decisions on enhanced screening and risk-reducing interventions like prophylactic surgeries or lifestyle modifications to lower cancer incidence or recurrence. 50. Liquid biopsies, a non-invasive diagnostic tool for breast cancer, detect tumor-derived materials in the bloodstream, offering potential for early detection, monitoring treatment response, and identifying emerging resistance, although their integration into routine clinical practice requires further validation. 1. Ischemic heart disease, primarily caused by atherosclerosis, reduces blood flow to myocardial tissues, often resulting in angina pectoris and increasing the risk of myocardial infarction, thus necessitating prompt clinical intervention to prevent irreversible myocardial damage. Two, understanding the pathophysiology of ischemic heart disease involves recognizing the complex interplay of endothelial dysfunction, lipid accumulation, inflammation, and thrombosis that ultimately compromises coronary artery blood flow and myocardial perfusion. Three, the diagnostic process for ischemic heart disease involves tools such as electrocardiograms to detect street segment changes, stress tests for evaluating exercise-induced ischemia, and coronary angiography, which provides direct visualization of coronary artery obstruction. Four, medical management of ischemic heart disease often includes antiplatelet agents like aspirin, which reduce thrombotic events, statins to lower LDL cholesterol and stabilize atherosclerotic plaques, and nitrates to alleviate chest pain by dilating coronary vasculature. 5. Lifestyle modifications, such as smoking cessation, dietary changes to reduce saturated fats, and regular aerobic exercise, play a crucial role in managing ischemic heart disease by mitigating risk factors and supporting cardiovascular health. 6. Coronary artery bypass grafting presents a surgical option for patients with severe ischemic heart disease, creating alternative pathways for blood to reach the myocardium by grafting veins or arteries to bypass occluded coronary vessels. Seven. Percutaneous coronary intervention, often involving the placement of a stent, is a minimally invasive procedure that reopens narrowed coronary arteries, restoring adequate blood flow and reducing the incidence of angina in ischemic heart disease patients. 8. Advanced imaging modalities, such as cardiac MRI and CT angiography, provide detailed anatomical and functional assessment of coronary arteries, myocardial tissue, and perfusion deficits, enhancing diagnostic accuracy in ischemic heart disease. 9. Ischemic preconditioning, where brief episodes of ischemia make myocardial tissue more resistant to subsequent ischemic episodes, offers a fascinating area of research with potential therapeutic implications for ischemic heart disease management. 10. The role of inflammation in ischemic heart disease is increasingly recognized, with biomarkers like C-reactive protein serving as indicators of systemic inflammation and potential targets for therapeutic intervention to reduce cardiovascular risk. 11. Despite the predominance of atherosclerosis in ischemic heart disease, coronary microvascular dysfunction also contributes significantly, particularly in women, highlighting the need for gender-specific diagnostic and therapeutic approaches. 12. Silent ischemia presents a diagnostic challenge in ischemic heart disease, as patients exhibit myocardial ischemia without typical anginal symptoms, necessitating vigilance and regular monitoring in high-risk patient populations. 13. Genetic factors contribute to an individual's susceptibility to ischemic heart disease, with polygenic risk scores and family history aiding in risk stratification and personalized preventive strategies tailored to genetic profiles. 14. The phenomenon of coronary artery spasm, wherein transient vasoconstriction leads to ischemic events, underscores the importance of identifying and managing triggers such as stress, cold exposure, and vasoconstrictive drugs in ischemic heart disease. 15. Ischemic heart disease disproportionately affects individuals with comorbid conditions like diabetes mellitus, which accelerates atherosclerosis through mechanisms such as glycation and oxidative stress, necessitating rigorous glycemic control. 16. Heart rate variability analysis provides insights into autonomic dysfunction in ischemic heart disease, where reduced variability signals sympathetic predominance and heightened risk for adverse cardiovascular events. 17. Advances in regenerative medicine, such as stem cell therapy, hold promise for repairing ischemic damage in the heart by regenerating myocardial tissue and improving cardiac function post-myocardial infarction. 18. The role of mental health in ischemic heart disease is gaining attention, with conditions such as depression and anxiety linked to increased cardiovascular risk through stress-related pathophysiological mechanisms like hypercortisolemia. 19. Hyperhomocystinemia, an elevated blood level of homocysteine, is a modifiable risk factor for ischemic heart disease, emphasizing the importance of dietary interventions and supplementation with folic acid and B vitamins for cardiovascular prevention. 20. The potential cardioprotective effects of omega-3 fatty acids in ischemic heart disease are attributed to their anti-inflammatory properties, which help reduce plaque formation, improve endothelial function, and lower triglyceride levels. 21. Remote ischemic conditioning, involving repetitive episodes of limb ischemia to confer organ protection against ischemic injury, represents a novel non-invasive intervention with potential applicability in ischemic heart disease. 22. The use of ambulatory blood pressure monitoring in ischemic heart disease patients provides valuable insights into nocturnal hypertension and blood pressure variability, correlating with cardiovascular outcomes and guiding antihypertensive therapy. 23. Pulmonary hypertension can complicate ischemic heart disease, impairing right ventricular function and exacerbating heart failure symptoms, necessitating vigilant assessment and management of both pulmonary and cardiac components. 24. The phenomenon of hibernating myocardium, where myocardial contractility is reversibly impaired due to chronic ischemia, highlights the importance of revascularization in restoring myocardial function and optimizing heart performance. 25. Cardiac rehabilitation programs, combining supervised exercise, nutritional guidance, and psychological support, enhance recovery and quality of life for ischemic heart disease patients, reducing recurrent cardiovascular events. 26. The endothelial glycocalyx, a protective layer lining blood vessels, plays a crucial role in maintaining vascular health, and its disruption in ischemic heart disease contributes to atherogenesis and endothelial dysfunction. 27. Myocardial stunning refers to the transient post-ischemic dysfunction of myocardial tissue, despite restored blood flow, necessitating careful differential diagnosis from irreversible myocardial damage in ischemic heart disease cases. 28. The gut-heart axis explores the interplay between gut microbiota and cardiovascular health, where dysbiosis may contribute to ischemic heart disease via inflammatory pathways and microbial metabolites such as TMAO. 29. Identifying and managing obstructive sleep apnea is essential in ischemic heart disease, as untreated apnea exacerbates hypertension, sympathetic activation, and inflammation, further elevating cardiovascular risk. 30. Antianginal medications like beta blockers and calcium channel blockers not only alleviate ischemic symptoms but also provide prognostic benefits by reducing myocardial oxygen demand and preventing arrhythmias. 31. Utilization of dual antiplatelet therapy, particularly after percutaneous coronary intervention, is critical in ischemic heart disease to prevent stent thrombosis and ensure sustained patency of revascularized vessels. 32. Oxidative stress, characterized by an imbalance between reactive oxygen species and antioxidants, accelerates atherosclerosis and endothelial dysfunction in ischemic heart disease, supporting the exploration of antioxidant therapies. 3. Early intervention with fibrinolytic therapy in acute myocardial infarction, particularly in settings without percutaneous coronary intervention availability, saves myocardium by rapidly dissolving thrombi, restoring coronary perfusion. 34. Cardiac troponin levels serve as a pivotal biomarker in diagnosing acute coronary syndromes, with high-sensitivity assays providing early detection and risk stratification in ischemic heart disease emergencies. 35. Systemic lupus erythematosus and other autoimmune conditions increase ischemic heart disease risk due to accelerated atherosclerosis linked to chronic inflammation, necessitating vigilant cardiovascular monitoring in autoimmune populations. 36. The concept of residual inflammatory risk in ischemic heart disease, despite optimal lipid management, highlights the ongoing quest for therapies targeting persistent inflammation in plaque stabilization and event reduction. 37. Platelet hyperreactivity in ischemic heart disease contributes to thrombotic complications, with pharmacogenomics guiding personalized antiplatelet strategies to prevent adverse outcomes and optimize dual antiplatelet therapy. 38. The interplay between hypercoagulability and ischemic heart disease necessitates consideration of anticoagulant therapy, especially in patients with concomitant atrial fibrillation, to balance thrombosis prevention with bleeding risk. 39. Investigating the impact of systemic nitric oxide availability in ischemic heart disease reveals its crucial role in vasodilation and endothelial function, with therapeutic implications for enhancing nitric oxide pathways. 40. The metabolic syndrome synergistically amplifies ischemic heart disease risk through interconnected components like abdominal obesity, insulin resistance, dyslipidemia, and hypertension, requiring a comprehensive approach to management. 41. Emerging research on the Klotho protein suggests a protective role against cardiovascular aging and ischemic heart disease, highlighting potential therapeutic avenues for promoting longevity and vascular health. 42. Heat shock proteins, induced by stressors, serve protective roles in myocardial cells by preventing protein aggregation and enhancing survival pathways during ischemic events, with potential therapeutic exploitation in cardioprotection. 43. Chronic kidney disease exacerbates ischemic heart disease through mechanisms such as hypertension, mineral metabolism disturbances, and uremic toxins, necessitating joint nephrological and cardiovascular management strategies. 44. Advances in nanotechnology aim to revolutionize ischemic heart disease treatment through targeted drug delivery systems, enhancing therapeutic efficacy and minimizing off-target effects in the cardiovascular system. 45. The association between migraines and ischemic heart disease underscores shared pathophysiological pathways like endothelial dysfunction, auguring the need for integrated care in patients presenting with both conditions. 46. Exploring proteomics in ischemic heart disease can unveil novel biomarkers and therapeutic targets, offering insights into disease mechanisms and individualized treatment approaches tailored to proteomic profiles. 47. Cardiac amyloidosis complicates ischemic heart disease by infiltrating and stiffening myocardial tissue, posing diagnostic and therapeutic challenges in distinguishing from primary ischemic cardiomyopathies. 48. Transthoracic echocardiography remains a non-invasive cornerstone in assessing cardiac structure and function in ischemic heart disease, aiding in evaluation of ventricular size, wall motion abnormalities, and ejection fraction. 49. The promise of gene editing technologies, such as CRISPR-Cas9, beckons an era of precision medicine for ischemic heart disease, potentially correcting genetic predispositions and ushering tailored therapeutic interventions. 50. Understanding the circadian patterns of ischemic heart disease events, where peak incidence occurs in the morning, informs timing of medication administration and lifestyle modifications to align with biological rhythms for optimal outcomes. 1. Esophageal cancer primarily arises from the squamous cells lining the esophagus or from glandular cells in Barrett's esophagus, with adenocarcinoma more prevalent in Western countries, resulting from a chronic cycle of gastroesophageal reflux disease inducing metaplastic changes. 2. Diagnosing esophageal cancer often involves endoscopic ultrasonography combined with biopsy, aiming to accurately determine the tumor's depth and the involvement of surrounding lymph nodes, critical for effective staging and treatment planning. 3. The correlation between tobacco use and esophageal squamous cell carcinoma has been strongly established, with carcinogens within tobacco triggering genetic mutations that disrupt normal cellular machinery, promoting malignant transformation and proliferation. 4. Treatment modalities for esophageal cancer include neoadjuvant chemoradiotherapy, which seeks to downsize tumors before surgical resection, improving resection success rates and potentially enhancing overall survival. 5. Advances in molecular biology have illuminated the role of receptor tyrosine kinases such as HER2 in esophageal adenocarcinoma, paving the way for targeted therapies aimed at these aberrant signaling pathways to curb cancer progression. 6. Esophageal cancer symptoms often present late in the disease course, with progressive dysphagia being the most prominent sign, initially for solids and then liquids, as the esophageal lumen narrows due to tumor growth. 7. The prognosis for esophageal cancer remains grave, with a 5-year survival rate generally under 20%, heavily influenced by early-stage detection and the availability of comprehensive multimodal treatment strategies. 8. A significant advancement in the prevention of esophageal adenocarcinoma is the successful management of Barrett's esophagus with proton pump inhibitors or endoscopic ablative therapies, reducing dysplasia progression to invasive carcinoma. 9. Histopathological examination of resected esophageal cancer tissue often reveals key characteristics such as poorly differentiated cells in squamous cell carcinoma or glandular formation in adenocarcinoma that assist in confirming the cancer subtype. 10. Radiation therapy in esophageal cancer can be delivered via external beam methods or brachytherapy, targeting cancer cells while sparing the surrounding healthy tissue, thus managing symptoms such as pain and dysphagia effectively. 11. In the burgeoning field of immunotherapy for esophageal cancer, the use of checkpoint inhibitors targeting PD-1 and PD-L1 pathways has shown promise, leading to immune system engagement against tumor cells and eliciting durable responses. 12. Intriguingly, preventive measures against esophageal adenocarcinoma include rigorous lifestyle modification, like adopting a Mediterranean diet rich in fruits, vegetables, and omega-3 fatty acids, which may yield a protective anti-inflammatory benefit. 13. The phenomenon of field cancerization, where the entire esophageal mucosa exhibits precancerous changes, underscores the need for regular surveillance endoscopies in high-risk populations to catch potential malignancies at an actionable stage. 14. Endoscopic therapies, such as mucosal resection or submucosal dissection, have revolutionized the management of superficial esophageal cancer, offering a less invasive approach with lower complication rates compared to traditional esophagectomy. 15. Genomic studies have identified recurring mutations and amplifications in genes like TP53 and cyclin D1 in esophageal cancer, driving oncogenic pathways and presenting novel targets for future therapeutic interventions. 16. While squamous cell carcinoma of the esophagus has long been linked with nitrosamine-rich diets, ongoing epidemiological studies suggest that reducing such dietary components could contribute to a lower incidence of this cancer subtype. 17. For patients unable to tolerate surgery, definitive chemoradiotherapy remains a mainstay treatment for esophageal cancer, providing a non-operative cure potential while addressing both the local and systemic nature of the disease. 18. The role of minimally invasive esophagectomy in treating esophageal cancer is being increasingly recognized, offering comparable long-term outcomes to open procedures, with the potential for reduced post-operative morbidity and quicker recovery. 19. Emerging liquid biopsy techniques, such as the detection of circulating tumor DNA, hold promise for the non-invasive monitoring of esophageal cancer progression in response to treatment, allowing for more personalized therapy adjustments. 20. An exploration of microRNA profiles in esophageal cancer has revealed their significant involvement in tumorigenesis and metastasis, suggesting that these small non-coding RNAs could serve as biomarkers for earlier detection and novel therapeutic targets. 21. Despite chemotherapy being a cornerstone in treating locally advanced and metastatic esophageal cancer, resistance often develops through various mechanisms, including drug efflux pump expression and DNA repair pathway enhancement. 22. As alcohol consumption is a known risk factor for esophageal squamous cell carcinoma, public health initiatives focusing on reducing alcohol intake are essential components of comprehensive cancer prevention strategies. 23. In esophageal cancer, the intricate relationship between chronic inflammation and cancer development is highlighted by the molecular interplay between inflammatory cytokines and the nitrogen monofluoride Kb pathway, orchestrating a supportive microenvironment for tumor growth. 24. The development of organoids derived from esophageal cancer tissues presents a promising tool for personalized medicine, enabling drug testing and response prediction tailored to the patient's unique tumor biology. 25. Pioneering research into the esophageal cancer microbiome indicates that an altered bacterial composition might contribute to carcinogenesis, opening avenues for novel diagnostic markers and treatment adjuncts targeting microbial imbalances. 26. Nutritional challenges in esophageal cancer patients necessitate multidisciplinary care, with dietitians playing a critical role in ensuring adequate nutritional intake and managing cachexia, crucial for maintaining strength during aggressive treatment regimens. 27. The feasibility and efficacy of natural compounds, such as curcumin, are being evaluated in the context of esophageal cancer, postulating that their anti-inflammatory and apoptotic properties might harbor therapeutic significance when used alongside conventional treatments. 28. Integration of artificial intelligence in the analysis of endoscopic images is revolutionizing esophageal cancer diagnosis, enhancing the accuracy and speed of detecting lesions that might be missed by the human eye alone. 29. Factors such as obesity and metabolic syndrome contribute to the risk of esophageal adenocarcinoma through chronic inflammation and insulin resistance, signifying an intersection of metabolic health and cancer prevention strategies. 30. Studies on the epidemiology of esophageal cancer highlight a higher prevalence among males compared to females, with research exploring the mechanisms linked to hormones and environmental exposure differences responsible for this disparity. (31) Multidisciplinary tumor boards for esophageal cancer encourage collaboration among specialists, ensuring that each patient receives a comprehensive treatment plan optimized for both local control and systemic disease. (32) Vocal cord paralysis is a lesser-known complication of advanced esophageal cancer, arising from invasion or compression of the recurrent laryngeal nerve, which may necessitate speech therapy or surgical intervention to restore voice function. (33) An examination of disparities in esophageal cancer care reveals that socioeconomic factors significantly influence both access to early detection and advanced treatment options, necessitating policy reforms aimed at equitable healthcare delivery. (34) Recent trials focusing on the de-escalation of post-esophagectomy adjuvant therapy explore whether reduced treatment intensity can still deliver survival benefits, minimizing the burden of treatment-related toxicity. (35) Notably, the TREFS classification describes distinct anatomical and pathological characteristics of esophageal cancer, enabling a nuanced approach to understanding the disease's diverse presentations and informing surgical technique refinement. (36) Cirrhosis and chronic liver disease, through mechanisms involving portal hypertension and esophageal varices, can complicate the management of esophageal cancer, leading to increased treatment complexity and necessitating coordinated care. (37) The utilization of PET-CT imaging in staging esophageal cancer allows for sensitive detection of distant metastasis, providing critical information that impacts the treatment strategy and overall prognostic considerations. (38) Comparative studies analyzing the outcomes of robotic-assisted versus traditional open esophagectomy reveal potential advantages in reducing surgical trauma and postoperative complications, while ensuring oncological efficacy. (39) Emerging research into pro-inflammatory cytokines, such as IL-6, reveals their influential role in creating a tumor-permissive environment in esophageal cancer, highlighting potential therapeutic targets in inflammatory modulation. (40) An understanding of lymphatic spread patterns in esophageal cancer assists in precise staging and tailoring surgical and radiation fields, thereby potentially improving disease control and patient outcomes. (41) Cutting-edge advancements in photodynamic therapy for esophageal cancer harness the power of light-activated drugs, providing a focused approach to tumor ablation, particularly for palliative care where conventional options prove challenging. (42) Calcium channel blockers, typically used for cardiovascular conditions, are under investigation for their potential to modulate cancer cell growth and apoptosis in esophageal cancer, suggesting a possible repurposing as adjunctive therapy. (43) The adoption of patient-reported outcome measures in clinical trials for esophageal cancer underscores the importance of capturing the patient perspective in assessing treatment impact, thus enhancing care models focused on quality of life. (44) In-depth studies on esophageal cancer cell lines have revealed insights into their genetic heterogeneity, emphasizing the necessity for personalized therapeutic approaches that account for tumor-specific mutational landscapes. (45) The complex interplay between host immunity and tumor evasion in esophageal cancer emphasizes the critical role of the immune microenvironment, propelling research into immune-modulating therapies that can recalibrate this balance. (46) Colloidal gold nanoparticles are being explored for enhanced imaging and targeted drug delivery in esophageal cancer, capitalizing on their size, biodistribution, and ability to conjugate with molecular agents. '47. The impact of postoperative complications on long-term survival in esophageal cancer patients indicates that reducing surgical morbidity is integral to improving overall outcomes, necessitating refined techniques in perioperative care. '48. A notable preventive measure for esophageal cancer includes the avoidance of scalding hot beverages known to damage the esophageal lining, potentially contributing to corrosive esophagitis and facilitating carcinogenic processes. '49. The integration of palliative care early in the treatment of esophageal cancer addresses complex symptom management, psychological support, and advanced care planning, ensuring comprehensive care beyond tumor-focused treatments. '50. Surveillance strategies for individuals with familial Barrett's esophagus syndromes highlight the importance of genetic counseling and regular monitoring processes in intercepting esophageal cancer at its nascent stage, offering improved prognostic prospects. '1. Brain trauma, also known as traumatic brain injury, TBI, occurs when an external force injures the brain and can result in impairments to cognitive, physical, and emotional functioning, potentially causing lifelong disability or death if not promptly diagnosed and treated. 2. One primary aspect of diagnosing brain trauma involves imaging studies such as a CT scan, which can quickly reveal bleeding, skull fractures, and hematomas that may necessitate immediate surgical intervention to mitigate potential damage. 3. A Glasgow Coma Scale (GCS) score, ranging from 3 to 15, is a crucial clinical tool used to assess the conscious state of a patient after a brain injury, with lower scores indicating more severe injuries and informing urgent treatment decisions. 4. Brain trauma often triggers secondary injury pathways that exacerbate initial damage, including cerebral edema, ischemia, and inflammation, which require targeted medical interventions to stabilize intracranial pressure and maintain cerebral perfusion. 5. Concussion, a mild form of brain trauma, is characterized by temporary disruptions of brain function due to biomechanical forces, commonly seen in contact sports, and typically requires cognitive and physical rest for recovery. 6. In moderate to severe brain trauma cases, hematomas such as epidural and subdural may form, necessitating prompt surgical evacuation to prevent increased intracranial pressure and consequent brain herniation. 7. Post-traumatic amnesia, the loss of memory surrounding the event causing the trauma, is a common symptom that provides insight into the severity of the brain injury and helps guide rehabilitation strategies. 8. Contusions or bruises on the brain, resulting from brain trauma, can lead to focal neurological deficits, similar to stroke symptoms, depending on the location and severity of the impact. 9. Diffuse axonal injury, common in high-impact brain traumas such as motor vehicle accidents, involves widespread damage to the brain's white matter, which can lead to long-term deficits in consciousness and cognitive abilities. 10. Monitoring and controlling intracranial pressure is critical in managing severe brain trauma, as sustained high pressure can lead to brain herniation, compressing brain tissue and blood vessels, potentially resulting in irreversible damage or death. 11. Cerebral vasospasm, a potential complication following traumatic brain injury, can restrict blood flow to the brain and lead to secondary ischemic damage, requiring interventions such as pharmacological agents or endovascular techniques to restore normal circulation. 12. Neuroplasticity plays a fundamental role in the brain's ability to recover from trauma, as brain networks can reorganize and form new connections to compensate for damaged areas, facilitated by rehabilitation therapies. Skull fractures resulting from brain trauma can be classified into several types, including linear, depressed, and basilar, each with specific clinical implications and management strategies based on the risk of further complications. Pediatric brain trauma requires special consideration, as children may initially show subtle signs of injury, yet have a higher potential for delayed complications, necessitating vigilant observation and age-appropriate assessments. Anosmia, or the loss of the sense of smell, can result from frontal lobe or olfactory nerve damage in cases of brain trauma and may persist long-term, affecting quality of life and patient nutrition. Neuroimaging techniques such as MRI offer more detailed brain anatomy visualization than CT scans, aiding in the detection of brain contusions, microhemorrhages, and diffuse axonal injuries that may not be apparent on CT. Penetrating brain injuries, such as those caused by bullets or shrapnel, result in a breach of the dura mater, requiring surgical debridement and stabilization to prevent infection and other complications. Vegetative state, resulting from significant brain trauma, is characterized by wakefulness without awareness, where patients show sleep-wake cycles but lack conscious interaction with their environment, posing complex ethical and medical care challenges. Hypoxia, or oxygen deprivation resulting from traumatic brain injury, can exacerbate neuronal damage and brain swelling, necessitating prompt emergency airway management and supplemental oxygen to prevent further deterioration. Intracranial hematomas, blood collection within the skull, are classified according to location such as epidural, subdural, or intracerebral, each presenting unique clinical challenges and critical treatment decision routes. Corticosteroids, once commonly used to reduce cerebral edema in traumatic brain injury, are now generally avoided due to evidence suggesting they may worsen outcomes, highlighting the importance of evidence-based practice in medicine. Post-concussive syndrome can persist for weeks to months after a mild traumatic brain injury, presenting with symptoms like headaches, dizziness, and cognitive difficulties that often require a multidisciplinary approach for management. Hyperventilation therapy, used briefly to lower intracranial pressure in acute brain trauma, reduces CO2 levels causing cerebral vasoconstriction, but overuse can exacerbate cerebral ischemia, necessitating careful monitoring. Brain trauma can lead to pituitary gland dysfunction, causing hormonal imbalances in conditions such as diabetes insipidus or syndrome of inappropriate antidiuretic hormone secretion, SIADH, which require hormonal evaluation and management. Vestibular rehabilitation therapy can be beneficial for patients with balance disorders following brain trauma, using specialized exercises to improve balance, posture, and gaze stability through adaptive brain mechanisms. Agitation and confusion in brain trauma patients may result from frontal lobe injuries, necessitating individualized behavioral management strategies, often with neuropsychological support, to minimize risk and facilitate recovery. Hypothermia therapy, once explored as a neuroprotective strategy following traumatic brain injury, involves cooling the patient's body temperature to reduce cerebral metabolism and inflammation, but its routine use remains controversial due to mixed outcomes. Fatigue is a common and persistent issue for brain trauma survivors, often interfering with rehabilitation efforts and daily functioning, requiring comprehensive management including physical therapy and cognitive strategies to encourage energy conservation. 29. Second impact syndrome, a catastrophic condition resulting from a second concussion before full recovery from a previous one, can lead to rapid cerebral edema and has been linked to substantial permanent disability or death, emphasizing the need for cautious return-to-play protocols. 30. Neurogenic shock, a possible complication of traumatic brain injury affecting the autonomic nervous system, leads to hypotension and bradycardia, requiring careful cardiovascular monitoring and targeted therapies to stabilize hemodynamics. 31. Cognitive rehabilitation following brain trauma involves a structured set of therapeutic approaches aimed at improving attention, memory, problem solving, and executive function, tailored to individual patient deficits and rehabilitation goals. 32. Falls, motor vehicle accidents, and sports injuries are among the leading causes of brain trauma incidents, highlighting the role of prevention through public health initiatives such as helmet laws, fall prevention programs, and vehicle safety measures. 3. Dysphagia, or difficulty with language following brain trauma, often results from injuries to the brain's language centers, requiring specialized speech and language therapy to improve communication skills and quality of life. 34. Hyperosmolar therapy using agents like mannitol or hypertonic saline plays a critical role in managing cerebral edema in traumatic brain injury by drawing fluid out of the brain, thus reducing intracranial pressure and improving cerebral perfusion. 35. Seizures can occur in the acute or post-acute phase following brain trauma, necessitating monitoring and treatment with anticonvulsant medications to manage and prevent recurrent convulsive episodes. 36. Hemiparesis, or weakness on one side of the body, can result from unilateral brain trauma, affecting motor function and necessitating coordinated rehabilitation therapies such as physical and occupational therapy for recovery. 37. Damage to the brainstem from traumatic impacts can lead to severe outcomes such as loss of vital bodily functions or coma, as the brainstem controls essential functions like heart rate, breathing, and consciousness. 38. Emotional and personality changes after a traumatic brain injury can be profound, often presenting as depression, anxiety, or impulsivity, which requires psychological support and cognitive therapy for patient and family coping. 39. Swelling and inflammation following brain trauma are primarily managed through medical therapies aimed at stabilizing the blood-brain barrier, controlling the inflammatory response, and maintaining adequate cerebral perfusion pressure. 40. Prolonged disorientation, known as post-traumatic confusional state, is common following moderate to severe brain trauma and may include fluctuating awareness, requiring management through environmental modifications and supportive care. 41. Tinnitus, or ringing in the ears, can arise from traumatic brain injuries affecting the auditory system, presenting a challenge in symptomatic management with audiological interventions and reassurance. 42. Vestibular dysfunction, including vertigo and balance issues, can stem from brain trauma affecting the inner ear or brain structures involved in balance, necessitating assessment and therapy to improve spatial orientation and stability. 43. Post-traumatic stress disorder, PTSD, and anxiety can emerge after experiencing or witnessing a traumatic brain injury, necessitating timely psychological interventions to address persistent distressing symptoms and promote recovery. 44. Autonomic dysfunction following brain trauma can manifest as dysregulation of physiological processes like heart rate, blood pressure, or temperature control, potentially requiring specialized pharmacological treatments and monitoring. 45. Visual disturbances after brain trauma might result from ocular or cortical damage, presenting as blurriness, field cuts, or difficulties with depth perception, often managed with interventions such as corrective lenses or visual rehabilitation therapy. 46. Myasthenia gravis, an autoimmune neuromuscular disorder, may be exacerbated by brain trauma due to stress or secondary autoimmune responses, necessitating monitoring and potentially adjusting neuromuscular medications. 47. Nutritional deficits can occur in brain trauma patients due to altered metabolism and swallowing difficulties, requiring dietary assessments and potentially supplements or enteral feeding to ensure adequate intake and optimize healing. 48. Pressure sores are a risk in immobile or unconscious brain trauma patients, emphasizing the need for regular repositioning, skin assessments, and use of specialized mattresses to prevent skin breakdown and promote healing. 49. The development of a ventriculostomy, or drainage of cerebrospinal fluid from the ventricles, may be necessary in severe cases of brain trauma to manage hydrocephalus and relieve elevated intracranial pressure, often requiring careful monitoring. 50. Optokinetic responses, which involve tracking moving objects, can be impaired in brain trauma, leading to difficulties in processing visual stimuli and navigation, often identified through specialized testing and addressed in rehabilitation. 1. Hepatitis C is a liver infection caused by the hepatitis C virus, HCV, which primarily spreads through exposure to blood contaminated with the virus, often through sharing needles or medical equipment, making early detection crucial in preventing liver damage and complications. 2. The pathophysiology of hepatitis C involves the HCV triggering chronic inflammation in the liver, causing liver cells to die and be replaced with fibrous scar tissue, which can eventually lead to cirrhosis, impairing liver function and increasing the risk for liver cancer. 3. Direct-acting antivirals, DAAs, have revolutionized the treatment of hepatitis C, offering cure rates above 90% with typically few side effects, although the choice of a specific DAA regimen depends on the viral genotype and presence of liver disease complications. 4. Hepatitis C can remain asymptomatic for years, making routine screening for people at risk vital because early diagnosis allows for timely initiation of antiviral therapy to prevent progression to severe liver disease. 5. There are 6 genotypes of hepatitis C virus, each affecting treatment choices and duration, with genotype 1 being the most common in the United States and often requiring a different therapeutic approach compared to other genotypes. 6. The diagnosis of hepatitis C involves initial screening with an HCV antibody test, followed by a confirmatory HCV RNA test if antibodies are detected, to determine whether there is an active infection needing treatment. 7. Chronic hepatitis C infection is a leading cause of liver transplants globally due to its potential to cause cirrhosis or liver cancer, emphasizing the importance of antiviral treatment in preventing these severe outcomes. 8. Despite there being no vaccine for hepatitis C, preventive measures such as avoiding needle sharing and ensuring safe blood transfusion practices are crucial to reduce the transmission of this virus. 9. The liver damage from hepatitis C can cause complications like portal hypertension, characterized by increased blood pressure in the portal vein, leading to varices or ascites, highlighting the importance of regular monitoring in chronic cases. 10. Advanced hepatitis C with cirrhosis is a known risk factor for hepatocellular carcinoma, making regular liver ultrasounds and alpha-fetoprotein tests essential in the surveillance for liver cancer in these patients. Some patients with hepatitis C might experience extrahepatic manifestations such as mixed cryoglobulinemia, a condition causing systemic vasculitis, often requiring additional treatments like immunosuppressive therapy. Certain lifestyle modifications, like avoiding alcohol which can exacerbate liver damage, are crucial in managing hepatitis C, as alcohol consumption accelerates the progression to cirrhosis. A liver biopsy, though less commonly used now, can be helpful in assessing the extent of liver damage in hepatitis C, including the degree of inflammation and fibrosis, which can guide treatment decisions. While hepatitis C attacks liver cells preferentially, it can also affect organs outside the liver, potentially leading to complications such as renal disease or lymphomas, underscoring the need for comprehensive care. The sustained virologic response, SVR, is the goal of hepatitis C treatment, indicating that the virus remains undetectable in the blood 12 weeks after completing therapy, which is equated to a cure. In the era of DAAs, treatment regimens for hepatitis C have become shorter, typically ranging from 8 to 12 weeks, marking a significant advancement over prior treatments that could last up to a year with inferior outcomes. Hepatitis C virus can undergo genetic mutations, aiding its evasion from the immune system and the development of resistance to antiviral treatments, which necessitates the use of combination drug therapies. Blood donor screening and the introduction of direct-acting antivirals have significantly reduced new hepatitis C infections, yet public health efforts continue to bridge gaps in diagnosis and treatment accessibility. Hepatitis C is more infectious than HIV but less than hepatitis B in terms of blood-borne pathogens, stressing the importance of public health interventions to remain vigilant in controlling its spread. During acute hepatitis C infection, only a minority of people will exhibit symptoms such as jaundice, fatigue, or abdominal pain, which often resolve spontaneously but still require medical evaluation due to the risk of progression to a chronic state. Reinfection with hepatitis C is possible even after successful treatment, particularly in individuals who continue engaging in behaviors that expose them to the virus, emphasizing the importance of preventive education. During pregnancy, there is a low risk of mother-to-child transmission of hepatitis C, but women with chronic infection should be monitored and counseled accordingly to minimize risk and plan for management. In patients co-infected with HIV and hepatitis C, treating both conditions is crucial as they can exacerbate each other's progression, with newer direct-acting antivirals greatly improving cure rates for HCV in such cases. Certain rare genetic conditions might affect the progression and treatment outcomes in hepatitis C infection, with ongoing research aiming to better understand these genetic factors and their role in personalized medicine. The introduction of second-generation direct-acting antivirals marked a milestone in the management of hepatitis C, as these drugs target multiple stages of the viral life cycle, offering improved efficacy and tolerability compared to older treatments. The hepatitis C virus can survive outside the body for several weeks, which highlights the importance of environmental cleaning and sterilization procedures, particularly in settings like healthcare facilities. 27. Besides liver damage, patients with chronic hepatitis C may develop insulin resistance and type 2 diabetes, necessitating diligent monitoring and management of these metabolic disorders as part of comprehensive care. The global burden of hepatitis C is substantial, with millions affected across diverse geographies, necessitating international collaboration and tailored strategies to effectively manage and eliminate the disease. Recent advancements in blood testing technology allow for early detection of hepatitis C, including the use of rapid diagnostic tests, which enhance screening efforts particularly in resource-limited settings. Injection drug use remains the most significant risk factor for hepatitis C transmission in high-income countries, driving initiatives aimed at harm reduction, such as needle exchange programs to mitigate disease spread. Chronic hepatitis C infection can affect mental health, contributing to cognitive impairment or depression, which calls for an integrative treatment approach that includes psychosocial support services. Healthcare workers are at occupational risk for hepatitis C due to potential needle stick injuries, making adherence to standard precautions and the use of safety-engineered devices vital to prevent transmission. Antiviral resistance in hepatitis C treatment is rare but can occur in poorly adherent patients or those with prior treatment experience, making rigorous follow-up and education on adherence crucial for achieving optimal outcomes. Given that hepatitis C can lead to hepatic encephalopathy, a condition characterized by confusion and altered consciousness due to liver dysfunction, monitoring and preventive strategies, including supplemental treatment to manage ammonia levels, are critical. Exposure to hepatitis C does not confer protective immunity as seen in some other viral infections, thus individuals remain susceptible to future reinfections and should continue adopting preventive measures post-treatment. Hepatitis C virus belongs to the Flaviviridae family, possessing a single-stranded RNA genome, with its genotype and viral load influencing clinical manifestation, natural progression, and response to treatment. In patients with hepatitis C cirrhosis, careful management and regular monitoring of liver function are essential, as portal hypertension can lead to life-threatening variceal hemorrhage if not controlled properly. Direct-acting antivirals targeting protease, nucleotide polymerase, and NS5A proteins are the cornerstone of modern hepatitis C treatment regimens, disrupting viral replication at different stages to achieve sustained virologic response. Co-infection with hepatitis B and hepatitis C complicates clinical management as both viruses have the potential to cause liver damage, necessitating individualized treatment strategies and careful monitoring for reactivation. Hepatitis C testing is recommended for all individuals born between 1945 and 1965 in the United States, as this cohort, often termed baby boomers, demonstrates a significantly higher prevalence of the infection. Although previously thought incurable, advancements in hepatitis C research have highlighted the critical role of the host immune system, leading to innovative therapies exploiting both direct-acting antivirals and immunomodulatory effects. Individuals with advanced liver fibrosis from chronic hepatitis C are at an increased risk for cardiovascular diseases such as myocardial infarction, pointing to the need for comprehensive health monitoring beyond just liver function. 43. Adequate nutritional support is paramount in managing hepatitis C, with an emphasis on maintaining healthy body weight, optimizing liver function, and potentially reducing inflammation through a well-balanced diet. 44. In pediatric hepatitis C infections, though rare, early diagnosis and treatment are key to preventing disease progression and ensuring long-term liver health, as children generally respond well to direct-acting antiviral regimens. 45. Researchers continue to explore potential therapeutic vaccines for hepatitis C, focusing on stimulating the body's immune response to prevent infection or aiding in viral clearance in those already infected. 46. Hepatitis C treatment adherence remains crucial in achieving viral eradication, as missing doses or incomplete therapy can lead to suboptimal outcomes and increased risk of developing drug-resistant virus strains. 47. While telemedicine has expanded access to hepatitis C care, contributing to improved treatment uptake in remote or underserved areas, ongoing challenges include ensuring adequate patient follow-up and managing compliance. 48. The social stigma associated with hepatitis C can be a barrier to diagnosis and treatment. Therefore, public health initiatives must address misconceptions and educate communities to foster an environment conducive to seeking care. 49. Recent efforts in mapping the hepatitis C genome have provided insights into viral diversity and mechanisms of persistence, paving the way for more effective and targeted therapies that could potentially lead to the virus's eradication. 50. Understanding the role of liver stiffness measurement via transient elastography offers a non-invasive method to assess liver fibrosis in hepatitis C patients, aiding in diagnosis and monitoring disease progression without the need for liver biopsy. 1. Hepatitis C, a viral infection primarily affecting the liver, is caused by the hepatitis C virus, HCV, and can progress silently over decades, leading to chronic liver disease in approximately 50 to 80% of infected individuals due to the virus's ability to evade immune detection and establish a persistent infection. 2. The hepatitis C virus is predominantly transmitted through blood-to-blood contact, with intravenous drug use being the most common route, and despite substantial reductions in transmission rates thanks to blood screening, unsafe medical practices in some parts of the world remain a significant risk factor for new infections. 3. Diagnosis of hepatitis C involves both serological and molecular tests, where an initial enzyme immunoassay detects antibodies to the virus, followed by a confirmatory PCR test to measure the viral load and assess if the infection is active and requires treatment intervention. 4. Chronic hepatitis C infection can lead to complications such as cirrhosis and hepatocellular carcinoma due to ongoing liver inflammation and fibrosis, making regular screening and monitoring essential for those at risk or diagnosed, to ensure timely intervention and reduce the risk of severe liver damage. 5. Direct-acting antivirals, DAAs, have revolutionized the treatment of hepatitis C, offering over 90% cure rates with oral medications that target different stages of the viral life cycle, providing shorter, more effective treatment courses with fewer side effects compared to older interferon-based therapies. 6. Hepatitis C exhibits 6 different genotypes, with genotype 1 being the most prevalent worldwide, and identifying the genotype is crucial in the tailoring of antiviral treatment plans that consider genotype-specific efficacy, optimizing therapeutic outcomes for the patient. 7. The liver injury from hepatitis C is characterized by immune-mediated mechanisms where the virus persists within hepatocytes, evading immunity and creating an inflammatory state that drives progressive liver damage and potential fibrosis, ultimately affecting liver function and health. 8. Liver fibrosis staging is essential in managing hepatitis C, where non-invasive tests like elastography can assess liver stiffness, reducing the need for liver biopsies and helping to guide treatment decisions and predict progression to more severe liver disease, such as cirrhosis. Nine. Hepatitis C is not only a liver disease but also has systemic implications, with extrahepatic manifestations including type 2 diabetes, glomerulonephritis, and lymphoma, affecting multiple organ systems and significantly impacting the quality of life and prognosis of affected patients. The natural history of chronic hepatitis C infection varies greatly among individuals, with factors such as host genetics, viral genotype, and environmental influences like alcohol consumption playing critical roles in disease progression and liver damage severity over time. 11. Horizontal transmission of hepatitis C can occur through sexual contact, though it is less efficient than other routes, making it essential for patients and partners to take preventative measures, especially those with high-risk behaviors that increase exposure likelihood. 12. Effective public health strategies for hepatitis C control focus on harm reduction methods like needle exchange programs, safe blood supply practices, and awareness campaigns that aim to reduce transmission and promote early detection and treatment in high-risk populations. Hepatitis C infection can lead to an alteration in liver enzyme levels, commonly presenting as elevated aminotransferases on routine laboratory tests, which can trigger further investigation into the viral status when considered in conjunction with appropriate clinical risk factors. The introduction of universal hepatitis C screening guidelines for adults born between 1945 and 1965 significantly enhanced early detection of chronic infections within this cohort, who are believed to be at higher risk due to past healthcare practices that may have exposed them to the virus. While there is currently no vaccine for hepatitis C, ongoing research is focused on developing strategies to induce robust immune responses capable of protective immunity, with the hope of one day preventing HCV infections and reducing the global burden of this liver disease. In patients with chronic hepatitis C, co-infections with other blood-borne viruses, such as HIV or hepatitis B, can exacerbate liver injury, complicating management, and necessitating careful coordination of treatment regimens to address the interplay between these infections. Reinfection with hepatitis C is a concern, particularly in high-risk populations, as past infection or clearance does not confer immunity, underlining the importance of continuous preventive efforts even after successful treatment, to avoid relapse or new infections. Steatosis, or fatty liver, is a common histological feature in chronic hepatitis C, particularly with genotype 3 infections, and contributes to liver injury and progression of fibrosis by increasing hepatic inflammation and oxidative stress within the liver tissue. Autoimmune phenomena are associated with hepatitis C, as the virus can trigger immune dysregulation, leading to conditions such as mixed cryoglobulinemia, which presents with a triad of purpura, arthralgia, and weakness, requiring integrated management strategies. Despite universal precautions, occupational exposure to hepatitis C remains a calculated risk for healthcare workers, especially in situations involving needle stick injuries or direct contact with blood, highlighting the importance of post-exposure protocols and early intervention. FibroScan is a valuable non-invasive diagnostic tool in hepatitis C management, using transient elastography to provide an accurate measure of liver stiffness, facilitating the assessment of fibrosis without the need for invasive biopsies, which can be costly and painful. 22. In hepatitis C patients, alcohol consumption accelerates liver damage, promoting fibrosis and increasing the risk of cirrhosis, making abstinence from alcohol a critical recommendation for lifestyle modification to prevent complications and improve treatment outcomes. 23. Hepatitis C and pregnancy require special attention, as vertical transmission rates during childbirth are approximately 5%, with risk enhanced by high viral loads, necessitating strategies to minimize this transmission risk and ensure prompt evaluation of newborns. 24. Chronic hepatitis C has been linked to neurocognitive dysfunction, affecting memory, concentration, and mood, a condition known as hepatic encephalopathy, which can occur even in the absence of cirrhosis, impacting daily function and quality of life for patients. 25. Combination therapies for hepatitis C that utilize multiple direct-acting antiviral agents are designed to prevent viral resistance by targeting different viral proteins, ensuring a higher barrier to resistance and increasing the likelihood of treatment success. 26. The presence of hepatitis C antibodies in laboratory tests indicates exposure to the virus, but confirmatory RNA testing is required to distinguish between past, resolved infections and active infections that necessitate treatment to prevent liver damage. 27. The discovery of the hepatitis C virus in the late 1980s, a triumph of molecular biology, closed a historical gap in understanding non-A, non-B hepatitis, catalyzing research and development of diagnostics, treatment options, and a clearer understanding of transmission. 28. Chronic hepatitis C impacts glucose metabolism, increasing the risk of insulin resistance and development of type 2 diabetes, which contributes to liver fibrosis and further complicates the management of liver disease in affected individuals. 29. The Common Fibrosis 4, FIB4, score, calculated from routine lab data such as age, liver enzymes, and platelet count, serves as a useful and widely accessible tool for assessing liver fibrosis in hepatitis C infected individuals, guiding clinical decision-making. 30. Hepatitis C co-infection with HIV poses unique challenges, as both viruses share transmission pathways and exacerbate one another's effects on liver disease progression, requiring a cohesive treatment approach to address both infections effectively. 31. Successful eradication of hepatitis C with antiviral therapy has been shown to reduce the incidence of liver-related complications and improve survival rates, underscoring the importance of achieving a sustained virologic response as the primary goal of treatment. 32. Hepatitis C-associated mixed cryoglobulinemia can manifest as vasculitis, impacting the skin, kidneys, and peripheral nerves, driven by immune complexes and necessitating treatment that addresses both the viral cause and symptomatic relief of vasculitic symptoms. 3.3. Identifying liver histopathology, such as lymphoid aggregates or bile duct injury alongside steatosis and inflammation, helps refine the diagnosis of hepatitis C and its staging, offering critical insights into the degree of liver damage and guiding therapeutic strategies. 34. Hepatitis C genotype 3 confers an increased risk of hepatic steatosis and faster progression to cirrhosis compared to other genotypes, leading to tailored treatment regimens and vigilant monitoring for this subgroup to prevent rapid liver deterioration. 35. The global distribution of hepatitis C genotypes reflects historical and geographical patterns of human migration and behavior, influencing research strategies that focus on region-specific genotypic prevalence to optimize treatment efficacy and accessibility. 36. The advent of DAAs has changed the landscape of hepatitis C epidemiology, allowing for treatment plans that accommodate diverse populations with varying healthcare access, aiming to eliminate diagnostic and therapeutic disparities and reduce the overall disease burden. (37) In hepatitis C, advanced liver fibrosis correlates with increased risk of hepatocellular carcinoma, warranting surveillance strategies that include regular imaging and laboratory assessments post-therapy to catch any malignancy early and manage it effectively. (38) Host genetic factors, such as polymorphisms in the IL-28B gene, influence treatment response and spontaneous clearance rates of hepatitis C, providing personalized risk assessment and therapy customization that predict patient-specific therapeutic outcomes. (39) Chronic hepatitis C has complex effects on lipid metabolism, often resulting in dyslipidemia, which may contribute to cardiovascular risk profiles and necessitate a comprehensive approach to managing not only liver health but also associated systemic comorbidities. (40) Hepatitis C-related hepatic inflammation and fibrosis may be modulated by certain cytokines, such as TGF-beta, which promotes fibroblast activation and scar formation in the liver, offering potential targets for antifibrotic therapies under exploration. (41) Socioeconomic factors significantly impact hepatitis C outcomes, as populations with limited healthcare access or education may experience delayed diagnoses and inconsistent treatment adherence, challenging public health efforts to control and eliminate the virus. (42) The hepatitis C virus's ability to mutate rapidly aids its evasion of host immune responses, contributing to chronic infection and highlighting the need for multifaceted therapeutic approaches that target multiple viral elements to achieve sustained clearance. (43) While liver transplantation may be necessary for end-stage liver disease resulting from hepatitis C, recurrence of the virus in the new liver is common without successful viral clearance pre- or post-transplantation, informing the timing and strategies of antiviral regimens. (44) Understanding the natural reservoirs and evolutionary origins of hepatitis C involves studying related hepiciviruses in non-human primates, which may offer insights into viral transmission dynamics and inform future approaches to vaccine development and public health strategies. (45) The role of cellular apoptosis in hepatitis C-related liver injury involves both hepatocyte and immune cell pathways, emphasizing a complex interplay where therapeutic strategies aim to limit cell death and preserve liver health by mitigating ongoing immune-driven damage. (46) Hepatitis C can mediate changes in the gut-liver axis, impacting microbiome balance and cytokine release that contribute to systemic inflammation, necessitating strategies that consider gut health in the holistic management of chronic liver diseases. (47) Advances in biomarkers for hepatitis C have facilitated the classification of liver disease severity and response to treatment, enhancing patient management by allowing more personalized approaches to therapy based on dynamic, accessible, and non-invasive measurements. (48) With hepatitis C eradication being achievable in many patients, follow-up care remains pivotal to ensuring long-term health, as previously infected individuals may still face residual risks of liver disease complications or comorbid conditions that require ongoing monitoring. (49) The psychosocial aspects of living with hepatitis C include stigma and mental health challenges, underscoring the necessity of comprehensive care models that incorporate psychological support alongside medical treatment to support patient resilience and enhance quality of life. (50) The development of pangenotypic antivirals for hepatitis C has brought forth a new era of simplified treatment regimens that transcend genotypic boundaries, offering therapy options with wide-ranging efficacy across all genotypes and reducing the barriers to successful viral eradication. 1. Pancreatic cancer, predominantly adenocarcinomas, arising from the exocrine component, exhibits a notorious track record for poor prognosis due to its insidious onset, often presenting at an advanced stage when the tumor has already invaded surrounding structures or metastasized, emphasizing the potential for future diagnostic innovation in early molecular markers within ductal systems. 2. Clinicians must consider the high propensity for pancreatic cancer to involve neural invasion, a process by which neoplastic cells infiltrate perineural spaces, contributing significantly to severe abdominal and back pain seen in patients, as neurotropic behaviors differ among histological subtypes and offer potential therapeutic targets. 3. While risk factors such as smoking, chronic pancreatitis, obesity, and diabetes mellitus contribute significantly to the pathogenesis of pancreatic cancer, emerging data elucidates how genetic predispositions, specifically BRCA1 and BRCA2 mutations, underpin a subgroup of patients, enhancing the need for personalized genomic screening and tailored vigilance. 4. CT imaging remains a cornerstone in pancreatic cancer diagnosis, particularly multiphase contrast-enhanced scans, which reveal the characteristic hypovascular appearance of these tumors. Nevertheless, the advancement of functional MRI techniques presents an innovative means to assess tumor dynamics, offering critical insights into vascular and perfusion characteristics. 5. The tumor microenvironment in pancreatic cancer is a complex and hostile ecosystem primarily shaped by a dense desmoplastic stroma that not only impedes the delivery of chemotherapeutic agents but also contributes to the immunosuppressive milieu, thus making strategies targeting stromal remodeling an intriguing therapeutic frontier. 6. The clinical presentation of pancreatic cancer commonly includes obstructive jaundice caused by compression of the bile duct. However, an under-recognized manifestation is the new-onset diabetes mellitus, which often precedes cancer diagnosis by months to years, suggesting an intricate relationship between pancreatic beta cell function and carcinogenesis. 7. Innovative therapeutics in the treatment of pancreatic cancer are gradually emerging, with immune checkpoint inhibitors and novel monoclonal antibodies offering measurable yet modest successes, prompting investigational pursuits into combination regimens that could potentially overcome the tumor's notorious resistance mechanisms. 8. Emerging evidence suggests that exosomes, nanovesicles shedding from pancreatic tumor cells, carry specific mRNAs and can modulate distant organ environments, offering a promising new avenue for biomarker discovery and understanding metastatic niche priming, potentially allowing for earlier intervention and monitoring. 9. Surgical resection remains the only potentially curative option for pancreatic cancer, where the Whipple procedure, or pancreaticoduodenectomy, is performed, though novel minimally invasive techniques and robotic-assisted surgeries are reducing morbidity and expanding criteria for operability in borderline resectable cases. 10. Tumor-associated macrophages in the pancreatic cancer microenvironment have been identified as key modulators of immune evasion and tumor progression. Thus, therapies aimed at repolarizing these cells from a pro-tumoral M2 phenotype to an anti-tumoral M1 phenotype are being rigorously explored. 11. In the sphere of chemotherapy for pancreatic cancer, FOLFIRINOX, a regimen comprised of folinic acid, fluorouracil, irinotecan, and oxaliplatin, has shown superiority over the traditional gemcitabine, significantly improving survival in select patients, albeit with an increased risk of adverse effects requiring adept management. 12. Liquid biopsies, leveraging circulating tumor DNA, ctDNA, hold promise for real-time monitoring of pancreatic cancer dynamics, offering a less invasive means to assess mutation landscapes and therapeutic resistance, thus heralding an era of highly tailored and adaptive treatment strategies. 13. Recent advances in molecular pathology have delineated various genetic pathways implicated in pancreatic cancer, with KRAS mutations being particularly prevalent, leading researchers to focus on downstream effector pathways like MEK and ERK as potential targets for innovative anti-tumor interventions. The concept of pancreatic cancer stem cells, a subpopulation within tumors driving long-term proliferation and relapse, underscores the necessity for developing therapies that specifically eradicate these cells, aiming to prevent progression and achieve enduring remission. Pancreatic cancer cells exhibit a metabolic shift toward glycolysis, even under normoxic conditions, a phenomenon known as the Warburg effect, proffering potential therapeutic targets aimed at disrupting the cancer cell's metabolic reprogramming and promoting apoptotic pathways. Despite its aggressive nature, early detection of pancreatic cancer could potentially be achieved via surveillance strategies in high-risk families through regular endoscopic ultrasound screenings, which allow for the assessment of ductal changes and preneoplastic lesions like intraductal papillary mucinous neoplasms, IPMNs. The aggressive metastatic capacity of pancreatic cancer is facilitated by epithelial mesenchymal transition, EMT, where the loss of cellular adhesion and increased invasiveness are mediated by transcription factors such as snail and twist, representing focal points for therapeutic intervention aimed at metastasis suppression. Augmenting the immune response against pancreatic cancer, experimental therapies include the use of oncolytic viruses engineered to selectively infect and lyse tumor cells, triggering a robust immune response, a strategy that is gaining traction in clinical trials for its innovative approach towards breaking tolerance. An often overlooked complication, the thromboembolic phenomenon known as Trousseau's syndrome, pertains to pancreatic cancer's ability to induce hypercoagulability, necessitating proactive management strategies to prevent venous thromboembolism through prophylactic anticoagulation in high-risk scenarios. Research underscores the role of gut microbiota composition in pancreatic cancer progression, revealing that an imbalance or dysbiosis may modulate immune responses and worsen outcomes, sparking interest in microbiome modulation as a novel adjunctive therapeutic avenue. Nutritional support plays a crucial role in the management of pancreatic cancer patients, particularly those undergoing intensive treatment regimens that often lead to malnutrition and cachexia. Thus, careful dietary planning and enzyme supplementation are vital to maintain an optimal nutritional status. Pancreatic cancer's infamy for chemoresistance is partly attributed to the abundance of cancer-associated fibroblasts, CAFs, within its stroma, which secrete factors that not only promote tumor growth but also protect cancer cells from apoptosis, suggesting that targeting CAFs could enhance therapeutic efficacy. The prolonged latency and diverse genetic alterations in the adenomatous precursors of pancreatic cancer necessitate robust screening and stratification strategies, as identification of precursor lesions like PAN-INs offers a window of opportunity for intervention prior to malignant transformation. Hyperangiogenesis, frequently observed in pancreatic cancer, is driven by aberrant production of proangiogenic factors like VEGF, resulting in a poorly organized vasculature. Thus, anti-angiogenic therapies are being explored to disrupt vascular supply and constrain tumor growth. Autophagy, a cellular process of degradation and recycling, plays a paradoxical role in pancreatic cancer, fostering tumor survival under metabolic stress conditions but also offering potential for targeted therapies designed to manipulate autophagic pathways and induce tumor cell death. The utilization of advanced proteomics in pancreatic cancer research allows for the elucidation of protein expression profiles and post-translational modifications unique to tumor cells, serving as a promising platform for the discovery of novel biomarkers and therapeutic targets. '27. Advanced glycation end products, AGEs, and their receptors have surfaced as pivotal players in the pathophysiology of pancreatic cancer, where they mediate pro-inflammatory pathways that enhance tumor progression, offering a unique target for attenuating inflammation-driven carcinogenesis. '28. The presence of occult peritoneal metastasis in pancreatic cancer patients, often undetectable through conventional imaging, necessitates the use of diagnostic laparoscopy or peritoneal washing cytology to guide therapeutic decisions and avoid futile surgical interventions. '29. The intricate interplay between pancreatic cancer and diabetes is further complicated by cancer-induced alterations in insulin resistance and secretion, prompting a need for interdisciplinary management approaches that address the metabolic derangements alongside oncological treatment. '30. Carbohydrate antigen 19-9, CA19-9, remains the most widely used biomarker for pancreatic cancer, despite its limitations in sensitivity and specificity, underscoring the ongoing quest for more reliable serological markers to aid in early detection and monitoring of therapeutic responses. '31. The surgical margin status post-resection, RO, clear margins, versus R1, microscopically positive margins, serves as a critical prognostic indicator, influencing postoperative survival outcomes and the decision-making process regarding adjuvant therapy necessity. '32. Pancreatic neuroendocrine tumors, PNETs, distinct from adenocarcinomas, possess unique pathophysiological traits with varying degrees of lethality depending on their hormonal activity and Ki-67 proliferation index, necessitating individualized approaches to treatment and follow-up strategies. '33. Understanding the metastatic tropism of pancreatic cancer, whereby disseminated tumors preferentially colonize the liver, lung, and peritoneal cavity, is critical for developing site-specific therapeutic strategies and improving systemic control of the disease. '34. The progressive development of radiomics, involving quantitative imaging analysis, offers unprecedented insights into pancreatic tumor phenotypes, potentially uncovering subtle changes in tissue characteristics beyond visual perception, thus refining diagnostic accuracy and guiding therapy. '35. Surgical and clinical outcomes in pancreatic cancer patients are notably influenced by hospital and surgeon volume, emphasizing the importance of centralized referral systems to high-volume centers to optimize patient care and surgical expertise. '36. Clinical research continually explores neoadjuvant therapy, treatment given prior to surgery, to downstage borderline resectable tumors, facilitating successful complete resections and improving survival outcomes, although patient selection and regimen optimization remain pivotal. '37. Hyperthermic intraperitoneal chemotherapy, HIPEC, while still largely investigational for pancreatic cancer, proposes an intriguing adjunctive treatment by delivering heated chemotherapy directly into the abdominal cavity post-surgery, targeting residual microscopic disease with augmented cytotoxicity. '38. Innovations in personalized medicine are gaining momentum through the development of patient-derived xenografts (PDXs) for pancreatic cancer, which allow the testing of therapeutic responses in individualized tumor models, tailoring treatments according to genetic and phenotypic diversity. 39. While intratumoral heterogeneity in pancreatic cancer complicates therapeutic strategies, advanced single-cell sequencing technologies are beginning to unveil genomic variations at the cellular level, aiding in the identification of resistant clones and informing dynamic treatment adjustments. 40. Racial and ethnic disparities persist in pancreatic cancer incidence and outcomes, rooted in complex socioeconomic, environmental, and biological factors, necessitating targeted public health interventions and equitable healthcare access to bridge the gap in management and survival. 41. Cachexia, a debilitating syndrome associated with pancreatic cancer, involves a complex interplay of inflammatory cytokines, muscle protein degradation, and altered nutrient metabolism, requiring comprehensive management strategies encompassing medical, nutritional, and rehabilitative support. 42. With the advent of artificial intelligence and deep learning algorithms, the potential to revolutionize pancreatic cancer diagnostics is perceptible, specifically in automating the detection of early neoplastic changes in imaging, thereby transforming diagnostic workflows and enabling preemptive therapeutic measures. 43. Emerging evidence indicates that certain lifestyle factors, including moderate alcohol consumption and regular physical activity, may inversely correlate with pancreatic cancer risk, presenting avenues for preventive measures that incorporate lifestyle modification alongside traditional interventions. 44. Epigenetic modifications such as DNA methylation and histone acetylation are increasingly recognized as pivotal in pancreatic cancer pathogenesis, with insights into these alterations paving the way for novel epigenetic therapies aimed at reprogramming malignant gene expression profiles. 45. The development of comprehensive databases integrating clinical, genomic, and proteomic information on pancreatic cancer patients facilitates precision oncology, enabling the identification of molecular alterations that can be matched with targeted therapies, thus revolutionizing disease management. 46. Despite pancreas transplantation being a well-established treatment for diabetes, it remains a largely experimental avenue in pancreatic cancer, with ongoing research exploring its viability and impact on metabolic control in select cases of refractory hypoglycemia-inducing neoplasms. 47. Retinoic acid, a derivative of vitamin A, has shown potential in preclinical models for modulating differentiation and growth in pancreatic cancer cells, offering insights into nutritional and pharmacological interventions that could influence cancer cell fate and reduce proliferation. 48. As our understanding of tumor angiogenesis evolves, innovative approaches including the normalization of tumor vasculature aim to enhance the delivery and efficacy of chemotherapeutics, potentially overcoming the notorious drug resistance and hypoxia associated with pancreatic tumors. 49. The exploration of clonal evolution in pancreatic cancer through advanced genomic techniques reveals how intratumoral genetic diversity can shape the trajectory of tumor growth in response to treatment, underscoring the need for adaptive and continuous management strategies. 50. While pancreatobiliary cancers, including pancreatic adenocarcinoma, are notoriously aggressive, ongoing research into the interplay between the immune system and tumor microenvironment highlights the potential for harnessing autologous or allogeneic immune cells to enhance anti-tumor immunity and complement conventional treatments. 1. Breast cancer is the most common cancer among women worldwide, accounting for approximately 25% of all cancer cases, and it arises primarily from the lining of the ducts and lobules in the breast tissue, classified as ductal or lobular carcinoma respectively, and is often influenced by hormonal, genetic, and environmental factors. 2. The pathophysiology of breast cancer often involves the overexpression of the HER2 protein, which accelerates the growth of cancer cells, or mutations in the BRCA1 or BRCA2 genes, significantly increasing a woman's lifetime risk of developing breast cancer by altering the processes controlling normal cell growth and DNA repair mechanisms. Three, early-stage breast cancer is commonly diagnosed using imaging techniques such as mammography, which can detect tumors that are asymptomatic and as small as a few millimeters, while MRI and ultrasound may be used to further evaluate suspicious areas, especially in dense breast tissue. 4. Treatment for breast cancer typically involves a multimodal approach, including surgery, which may be a lumpectomy or mastectomy, often followed by radiation therapy to reduce the risk of local recurrence, and systemic treatments such as chemotherapy, hormonal therapy, or targeted therapy, depending on the tumor's receptor status and molecular profile. 5. Hormonal therapy for breast cancer involves drugs like tamoxifen or aromatase inhibitors, which work by blocking estrogen receptors or decreasing estrogen production, respectively, and are particularly effective in estrogen receptor-positive, ER+ cancers, thereby preventing the recurrence of the disease, especially in postmenopausal women. 6. Triple-negative breast cancer, TNBC, which lacks estrogen, progesterone, and HER2 receptors, presents a significant clinical challenge due to its aggressive nature and limited treatment options, typically involving a combination of surgery and chemotherapy, as targeted treatments are currently not available for this subtype. 7. Sentinel lymph node biopsy is a procedure used to determine the extent of breast cancer spread by injecting a dye and/or radioactive tracer to identify the first few lymph nodes into which a tumor drains, minimizing the need for more extensive lymph node dissections and thereby reducing the risk of lymphedema. 8. Adjuvant chemotherapy is recommended for breast cancer patients with higher risk of recurrence, typically indicated by larger tumor size, lymph node involvement, or high-grade tumors, and consists of drugs such as doxorubicin and cyclophosphamide, which interfere with DNA replication in rapidly dividing cancer cells. 9. Breast cancer staging, classified from 0 to IV, is crucial in guiding treatment decisions and is based on the size of the tumor, involvement of nearby lymph nodes, and the presence of distant metastasis, with stage 0 indicating non-invasive cancer and stage 4 indicating metastatic disease with poorer prognosis. 10. Inflammatory breast cancer, a rare but aggressive form, is characterized by the diffuse redness and swelling resembling an infection, often without a palpable tumor, and is caused by cancer cells blocking lymph vessels in the skin. It requires prompt systemic therapy along with surgery and radiation. 11. Oncotype DX, a genomic test for early-stage, hormone receptor-positive breast cancer, evaluates the expression of 21 cancer-related genes to predict the risk of recurrence and likely benefit of chemotherapy, thereby assisting clinicians in personalizing treatment plans for individual patients. 12. Breast cancer in men, although rare, usually presents with symptoms such as a lump in the breast tissue, nipple discharge, or changes in the nipple or breast skin, and the treatment protocols are similar to those in women, often involving surgery, radiation, and systemic therapies. 13. The 5-year relative survival rate for localized breast cancer, detected before it has spread outside the breast tissue, exceeds 98%, highlighting the importance of regular screening and early detection, which significantly improve treatment outcomes and patient survival rates. 14. HER2-positive breast cancer, characterized by the overexpression of the HER2 protein, is aggressive but shows improved outcomes with targeted therapies such as trastuzumab or pertuzumab, which inhibit the HER2 receptors, thereby slowing or stopping the growth of cancer cells. 15. 15. Breast-conserving surgery, also known as a lumpectomy, aims to remove the cancerous tissue while sparing as much healthy breast tissue as possible, and is generally followed by radiation therapy to minimize the risk of cancer recurrence in the conserved breast. 16. Bone is a common site for breast cancer metastasis, and patients with bone metastasis may experience symptoms like bone pain or fractures. Treatment includes systemic therapies, bisphosphonates or denosumab to strengthen bone, and sometimes radiation therapy for pain relief. 17. Paget's disease of the breast, a rare form of cancer involving the nipple and areola, often presents with symptoms like redness, scaling, and itching, and is associated with underlying ductal carcinoma in situ or invasive breast cancer, necessitating prompt biopsy and treatment. 18. The Gale model is a risk assessment tool used to estimate a woman's risk of developing breast cancer over the next 5 years and lifetime by considering factors such as age, family history, reproductive history, and history of breast biopsies, aiding in individualized screening recommendations. 19. Breast cancer survivors may experience long-term side effects from treatment, including lymphedema, fatigue, cognitive changes, and increased risk of osteoporosis, necessitating ongoing multidisciplinary care and regular follow-up to monitor and manage these potential complications. 20. Microcalcifications on mammography, often seen as small white spots, can be an indication of early breast cancer, especially ductal carcinoma in situ, and typically warrant further evaluation with a magnified mammogram or biopsy to determine their nature and appropriate management. 21. The breast cancer subtype known as luminal A is estrogen receptor, positive and/or progesterone receptor, PR positive, HER2 negative, and typically presents with a favorable prognosis due to slower growth rates and responsiveness to hormone therapies. 22. Neoadjuvant therapy, administered before surgery, is used in certain breast cancer cases to shrink the tumor, making it operable or allowing breast-conserving surgery rather than mastectomy, and also provides the added benefit of assessing the tumor's response to systemic treatment. 23. The Nottingham Histologic Score, also known as the Bloom-Richardson score, grades invasive breast cancer based on tubule formation, nuclear pleomorphism, and meiotic count, providing a prognostic indicator that helps guide treatment decisions. 24. Carcinoma in situ, found in conditions like ductal carcinoma in situ, DCIS, or lobular carcinoma in situ, LCIS, represents an early form of breast cancer contained within the ducts or lobules without invasion into surrounding tissues, often requiring localized treatment and careful surveillance. 25. During breast cancer diagnosis, a core needle biopsy, guided by imaging techniques such as ultrasound or stereotactic mammography, is the preferred method for obtaining tissue samples to confirm cancer presence and subtype, as it provides adequate tissue for histological examination. 26. Radiation therapy for breast cancer is typically delivered postoperatively to eradicate residual microscopic cancer cells in the breast, chest wall, or regional lymph nodes, and it significantly reduces local recurrence rates, enhancing long-term survival outcomes for patients. 27. Aromatase inhibitors, such as anastrozole or letrozole, are often preferred for postmenopausal women with hormone receptor-positive breast cancer because they reduce estrogen production from peripheral tissues, thus lowering circulating estrogen levels that could stimulate tumor growth. 28. The use of prophylactic mastectomy, or preventative removal of breast tissue, may be considered for individuals with a very high risk of breast cancer, such as those with BRCA1 or BRCA2 mutations, as it significantly reduces the likelihood of developing breast cancer. 29. Breast cancer screening guidelines generally recommend women begin annual or biennial mammograms starting at age 40 or 50, but individualized screening strategies may be necessary for women with higher risk factors, such as family history or genetic predispositions. 30. HER2 testing is critical in breast cancer management, usually conducted through immunohistochemistry, IHC, or fluorescence in situ hybridization, FISH, upon biopsy or surgical specimens, as HER2 status determines the use of targeted therapies and influences treatment strategies. 31. Paraneoplastic syndromes are rare in breast cancer, but these immune-mediated or hormone-related effects, such as hypercalcemia or dermatomyositis, can complicate the clinical picture, requiring a high index of suspicion for timely diagnosis and treatment. 32. Breast cancer often metastasizes to the brain, and symptoms like headaches, seizures, or cognitive changes can indicate central nervous system involvement, often managed with surgery, stereotactic radiosurgery, or whole brain radiation, depending on the extent and location of lesions. 3. Breast density is a recognized risk factor for breast cancer, as seen on mammograms, with higher density indicating more glandular and connective tissue, which can mask tumors, thus necessitating advanced imaging techniques like 3D mammography or MRI for accurate screening. 34. Invasive lobular carcinoma, known for its distinctive growth pattern of small, non-cohesive cells, often presents with more insidious and diffuse growth, complicating detection and treatment, and sometimes requiring bilateral mammograms due to an increased risk of contralateral breast cancer. 35. Chemoprevention in breast cancer, utilizing medications like tamoxifen or raloxifene, is an option for women at increased risk, as these agents interfere with estrogen receptor pathways, effectively reducing the incidence of hormone receptor-positive breast cancers. 36. Phyllodes tumors of the breast, while rare, are distinct from other breast cancers because they arise from the stromal tissue and can be benign, borderline, or malignant, often requiring wide local excision due to their potential for local recurrence or, in malignant cases, metastasis. 37. Male breast cancer, accounting for less than 1% of all breast cancers, typically presents in older men with risk factors such as Klinefelter syndrome, BRCA2 mutations, or family history, and though rare, treatment parallels female breast cancer protocols, including surgery and adjuvant therapies. 38. Lobular carcinoma in situ, LCIS, is not considered a true cancer but an indicator of increased breast cancer risk, mostly involving both breasts, that often leads to intensified surveillance and sometimes chemoprevention to mitigate the risk of eventual invasive cancer development. 39. Breast-conserving surgery followed by radiation therapy provides equivalent survival outcomes to mastectomy in early-stage breast cancer, challenging the older notion that more extensive surgical procedures necessarily lead to better survival, thus enabling more personalized treatment approaches. 40. Invasive ductal carcinoma, the most common form of breast cancer, displays distinct microscopic features like duct-like structures on histology, emphasizing the heterogeneous nature of tumors, which guides the selection of systemic treatments depending on receptor status and genetic markers. 41. Breast cysts are fluid-filled sacs that can be mistaken for solid tumors during physical exams or imaging, often requiring aspiration under ultrasound guidance to relieve discomfort and confirm the cystic nature, while regular monitoring ensures they do not develop malignant features. 42. Molecular subtyping of breast cancer through gene expression profiling helps in identifying specific biological characteristics of a tumor, categorizing it into subtypes such as basal-like, HER2-enriched, or luminal, each with unique prognostic implications and tailored treatment strategies. 43. In breast cancer, circulating tumor cells, CTCs, and circulating tumor DNA, ctDNA, are emerging biomarkers that provide insights into the disease burden and dynamics, potentially guiding treatment decisions and monitoring response to therapy, though their clinical utility is still under investigation. 44. Breast cancer-related lymphedema, resulting from lymph node removal or radiation, leads to arm or breast swelling and is managed with physical therapy, compression garments, and sometimes surgical interventions to restore lymphatic flow and prevent infection or functional impairment. 45. Adolescent girls with a strong family history of breast cancer may benefit from genetic counseling and testing to assess for mutations like BRCA1 or BRCA2, which can significantly influence future screening practices and risk-reducing strategies, impacting their long-term healthcare plans. 46. Tumor heterogeneity in breast cancer is a key challenge in treatment, as distinct genetic and phenotypic variations in cancer cells within the same tumor or between primary and metastatic sites can impact drug response and resistance, necessitating adaptive and personalized treatment approaches. 47. The emergence of immunotherapy in breast cancer, which harnesses the body's immune system to attack cancer cells, has shown promise particularly in triple-negative subtypes through agents like checkpoint inhibitors, which are currently explored in clinical trials to broaden therapeutic options. 48. Breast cancer survivors are at risk of developing secondary cancers due to shared risk factors like genetics or the effects of previous treatments, thus requiring continued vigilance in screening and preventive measures to detect and mitigate these risks effectively over the long term. 49. Genetic testing for mutations such as PALB2 or ATM, alongside BRCA1 and BRCA2, can elucidate familial breast cancer risk, guiding decisions on enhanced screening and risk-reducing interventions like prophylactic surgeries or lifestyle modifications to lower cancer incidence or recurrence. 50. Liquid biopsies, a non-invasive diagnostic tool for breast cancer, detect tumor-derived materials in the bloodstream, offering potential for early detection, monitoring treatment response, and identifying emerging resistance, although their integration into routine clinical practice requires further validation. One. Cerebral aneurysms, which occur due to weakened blood vessels in the brain, can remain asymptomatic until they rupture. This highlights the need for proactive screening in individuals with high risk factors like hypertension, smoking, or family history of aneurysms, as early detection through imaging modalities such as MRI and CT angiography can be critical for prevention. 2. The pathophysiology of cerebral aneurysms involves complex hemodynamic changes that exert excess pressure on arterial walls, where undeveloped collagen and elastin fibers fail to provide adequate resistance, leading to focal dilation, while genetic predispositions may further exacerbate these vulnerabilities by altering vascular structural integrity. 3. Technological advancements in endovascular techniques have revolutionized the treatment of cerebral aneurysms, with the deployment of flow diverters and stent-assisted coiling offering minimally invasive options that significantly reduce recovery time, complications, and the risk of recurrence when compared to traditional surgical clipping. 4. An underlying cause of cerebral aneurysms is hemodynamic stress, which arises from turbulent blood flow, primarily at bifurcations of cerebral arteries where high shear stress leads to endothelial injury and subsequent vascular wall remodeling, setting the stage for aneurysm formation as the vascular architecture becomes compromised. 5. Ruptured cerebral aneurysms are a cause of subarachnoid hemorrhage, a serious clinical condition associated with elevated mortality and morbidity, where rapid intervention is crucial. Key symptoms like sudden severe headache, neck stiffness, and altered consciousness should prompt immediate diagnostic evaluations including CT scan and lumbar puncture. 6. The genetic factors contributing to cerebral aneurysms can include mutations in genes related to connective tissue formation such as COL3A1, which disrupts collagen synthesis leading to weakened arterial walls, highlighting the importance of genetic counseling for at-risk individuals and their families. Seven. Early signs of an unruptured cerebral aneurysm might present subtly, with neurological deficits manifesting as cranial nerve palsies, localized headaches, or transient visual disturbances, a situation that necessitates vigilant clinical evaluations and neuroimaging where high-resolution detectors can reveal early aneurysmal changes. 8. Risk factors for cerebral aneurysms include modifiable lifestyle influences such as smoking, which accelerates atherosclerosis and hypertension by promoting endothelial dysfunction, along with non-modifiable factors like age and female gender. Therefore, lifestyle modification and regular screening are integral to disease management and prevention. 9. In cases where surgical intervention is indicated, microsurgical clipping requires precise intracranial navigation to apply a titanium clip at the neck of the aneurysm, effectively isolating it from cerebral circulation to prevent rupture, significantly lowering the chances of hemorrhagic events with a relatively low complication rate. 10. Intracranial pressure (ICP) monitoring is critical in patients with suspected or confirmed ruptured cerebral aneurysms, as elevated ICP can lead to compromised cerebral perfusion and herniation. Aggressive management with mannitol, hypertonic saline, or CSF drainage may be necessary to maintain optimal cerebral hemodynamics. (11) Dual antiplatelet therapy is recommended post-coiling in aneurysm management to prevent thromboembolic complications, as the presence of foreign material in the cerebral circulation can stimulate platelet aggregation and thrombus formation, which might otherwise negate the benefits of endovascular repair. 12. The detection of cerebral aneurysms has been greatly improved with the use of 3D rotational angiography, which provides high-resolution images that assist in assessing aneurysm morphology and characteristics to aid clinicians in formulating customized intervention strategies, thereby enhancing patient outcomes. 13. With growing evidence of inflammation contributing to aneurysm formation, researchers are exploring pharmacotherapeutics aimed at mitigating inflammatory pathways, as inflammatory cytokines like TNF-alpha and IL-6 play a significant role in destabilizing the vascular matrix and facilitating aneurysmal growth. 14. Vasospasm is a common sequel to subarachnoid hemorrhage caused by cerebral aneurysm rupture, where intense cerebral artery vasoconstriction can lead to ischemic complications. Treatment approaches like nimodipine administration aim to alleviate these occurrences by inhibiting calcium influx into vascular smooth muscle cells. 15. Asymptomatic patients with small cerebral aneurysms often undergo a watchful waiting approach, where routine non-invasive imaging studies like MR angiography are employed at regular intervals to monitor aneurysm growth and the potential requirement for intervention, thus minimizing unnecessary surgical risks in stable cases. 16. Histological examination of aneurysmal sacs has shown macrophage infiltration and apoptosis within the medial layer, suggesting that therapeutic approaches targeting apoptotic pathways may hold promise in stabilizing aneurysmal walls and preventing subsequent enlargement or rupture. 17. The interplay of genetics and environment in cerebral aneurysm pathogenesis is becoming clearer with genome-wide association studies identifying loci like 9p21.3 associated with vascular disease susceptibility, promoting avenues for personalized medicine and targeted therapies for high-risk individuals. 18. Hypertension is a primary contributor to the formation and rupture of cerebral aneurysms, as chronic pressure overload results in endothelial injury and vascular remodeling, necessitating stringent blood pressure control and antihypertensive therapy as preventive measures in patients with known or suspected aneurysmal disease. 19. Dietary modification, including reducing sodium intake and increasing fruit and vegetable consumption, may lower aneurysm formation risk by mitigating hypertension and vascular inflammation, thereby complementing clinical management strategies and enhancing overall vascular health outcomes. 20. Neurointerventionalists are at the forefront of treating stable cerebral aneurysms with cutting-edge techniques that include the use of embolic agents or coils engineered to promote thrombosis within the aneurysm sac, effectively excluding it from circulation and reducing the likelihood of future rupture. 21. Advances in computational fluid dynamics modeling allow researchers to simulate blood flow patterns within cerebral vasculature, offering insights into the hemodynamic forces that contribute to aneurysm formation and influencing the design of novel flow-modifying devices for individualized aneurysm management. 22. Effective public awareness campaigns and education initiatives about cerebral aneurysm symptoms and risk factors play a crucial role in early detection and intervention, as they empower individuals to seek timely medical evaluations and adhere to preventive health measures, reducing overall aneurysm-related morbidity. 23. Postoperative management of cerebral aneurysm patients focuses heavily on rehabilitation therapies, which might include physical, occupational, or cognitive therapies, to address any neurological deficits or impairments resulting from aneurysm rupture or surgical intervention, facilitating improved functional recovery. 24. The presence of multiple cerebral aneurysms in individuals is not uncommon, necessitating a comprehensive diagnostic approach that involves advanced imaging studies to map the entirety of the cerebral vasculature, ensuring all potential sites of aneurysm formation are identified and appropriately managed. 25. Pharmacological agents like statins, known for their lipid-lowering effects, are being investigated for their vascular protective properties, which might extend to reducing the growth and rupture risk of cerebral aneurysms by enhancing endothelial function and reducing vascular inflammation. 26. Epidemiological studies reveal regional variations in cerebral aneurysm prevalence and rupture rates, likely reflecting differences in genetic predispositions, lifestyle factors, and healthcare access, underscoring the need for tailored public health strategies to address these disparities and improve regional outcomes. 27. Imaging biomarkers are being developed to enhance the prediction of cerebral aneurysm rupture risk, with studies investigating the correlation between aneurysm wall enhancement on MRI and instability, which could guide clinical decision-making and the timing of interventional therapies. 28. With family history being a significant risk factor for cerebral aneurysms, first-degree relatives of affected individuals are likely to benefit from early screening strategies, helping to identify potentially life-threatening aneurysms before they rupture and in settings where genetic counseling and testing are available. 29. Innovative biodegradable stents are the subject of ongoing research aimed at decreasing long-term thrombogenicity and foreign body reactions associated with aneurysm repair, offering the potential for safer, more effective long-term outcomes in patients undergoing endovascular treatment. 30. Cognitive outcomes post-aneurysm rupture depend on rupture severity, treatment modality, and promptness of medical intervention, with comprehensive neuropsychological assessments and supportive therapies being essential to improve cognitive recovery and enhance patients' quality of life. 31. Artificial intelligence and machine learning algorithms are increasingly being applied to cerebral aneurysm imaging for enhanced diagnostic accuracy, by improving the identification of aneurysm characteristics that indicate rupture propensity, thus optimizing individual patient management plans. 32. Glucocorticoids have emerged as a potential therapeutic option in the acute management of cerebral aneurysms by reducing perianeurysmal edema and inflammatory response, although their long-term efficacy and safety profile require further clinical investigation to inform treatment protocols. 3.3. The role of neurotransmitters in cerebral aneurysm rupture is being explored, with particular attention to serotonin and its effects on vascular tone and platelet aggregation, possibly revealing novel pharmacological targets for the prevention of aneurysm-related hemorrhagic events. 34. Interdisciplinary teams consisting of neurologists, neurosurgeons, and interventional radiologists are crucial in the comprehensive management of cerebral aneurysms, facilitating personalized treatment pathways that integrate medical, surgical, and rehabilitative care tailored to patient-specific health profiles. 35. Cerebrovascular autoregulation can be disrupted post-aneurysm intervention, necessitating meticulous monitoring of cerebral perfusion pressure to prevent secondary ischemic injury, with management strategies involving both pharmacologic and supportive measures to stabilize cerebral blood flow and oxygenation. 36. Nutrition plays a role in aneurysm recovery, where a diet rich in omega-3 fatty acids, antioxidants, and anti-inflammatory foods can support vascular health, aiding in the reduction of sequelae associated with aneurysm formation and rupture, and contributing to more favorable long-term outcomes. 37. Serological biomarkers such as matrix metalloproteinases are under investigation for their potential to predict cerebral aneurysm growth and rupture, as their involvement in extracellular matrix degradation may provide insights into aneurysm pathogenesis and offer targets for therapeutic intervention. 38. The development of patient simulation models in cerebral aneurysm education provides interactive opportunities for medical professionals to rehearse complex scenarios, enhance diagnostic acuity, and practice innovative treatment techniques, thereby improving clinical skills and patient safety. 39. The connection between brain aneurysms and polycystic kidney disease is well documented. Specifically, individuals with autosomal dominant polycystic kidney disease have an increased risk of intracranial aneurysms due to inherent vascular abnormalities, necessitating proactive screening measures. 40. Environmental influences such as pollution and low socioeconomic status have been implicated in cerebral aneurysm development, possibly through effects on systemic inflammation and access to healthcare, highlighting the importance of addressing social determinants of health in prevention strategies. 41. MicroRNAs are emerging as key regulatory molecules in the pathogenesis of cerebral aneurysms, where their modulation of gene expression related to vascular remodeling and inflammatory processes may provide novel therapeutic targets to halt or reverse aneurysmal progression. 42. Nanomedicine is finding application in cerebral aneurysm therapy, with nanoparticulate systems being designed to deliver drugs or genes directly to aneurysmal sites, thereby enhancing localized action while reducing systemic side effects, opening new frontiers for minimally invasive treatment strategies. 43. For patients contraindicated for surgery, balloon-assisted coiling provides a viable alternative for aneurysm management, where a balloon is temporarily inflated in the parent vessel to aid coil placement, proving particularly effective in achieving complete occlusion of wide-necked aneurysms. 44. The connection between hormonal factors and aneurysm formation, particularly in postmenopausal women, is under scrutiny, with studies examining the protective role of estrogen on vascular integrity, potentially offering insights into hormone replacement therapy as a preventive measure against aneurysm development. 45. Workplace challenges faced by individuals with cerebral aneurysms require specific rehabilitation strategies, ensuring an effective return-to-work process that addresses cognitive, emotional, and physical reconditioning, thereby enabling seamless reintegration and productive living post-intervention. 46. Circulating endothelial cells have been proposed as potential biomarkers for detecting aneurysm instability, providing a non-invasive means to assess endothelial damage and disruption, which are critical factors in aneurysm integrity and associated hemorrhagic risk. 47. The use of computational fluid dynamics in analyzing hemodynamic impacts post-endovascular therapy is essential, as these models provide valuable insights into flow modification effects, contributing to the refinement of devices and techniques aimed at improving treatment efficacy and patient outcomes. 48. Cross-disciplinary research involving epidemiologists, geneticists, and neuroscientists is pivotal in uncovering the multifaceted etiologies of cerebral aneurysms, building comprehensive models that integrate genetic, environmental, and lifestyle factors to inform preventative healthcare policies. 49. Preclinical studies using animal models of cerebral aneurysms are vital for understanding disease progression and testing potential therapeutic approaches, providing a controlled environment to investigate pathophysiological mechanisms and evaluate the translational potential of novel treatments. 50. The future of cerebral aneurysm management lies in personalized medicine, where advancements in genomic profiling and biomarker identification will facilitate tailored therapeutic interventions and preventive strategies, ensuring optimal outcomes based on individual genetic, physiological, and lifestyle contexts. 1. Hepatocellular carcinoma, HCC, is a primary liver cancer typically arising in the context of chronic liver disease, often precipitated by hepatitis B or C infections, obesity-related fatty liver disease, or chronic alcohol consumption, exhibiting a multifocal growth pattern within the liver and, in advanced stages, commonly producing elevations of the tumor marker alpha-fetoprotein.